basang-basa ang dati, ito'y damang-dama sa'king kalam ng punong-puno ng pananabik at ng kapalalim. Sa'king bawat paghinga nakatitig lamang sa iyo. Naglakad ka ng dahan-dahan sa pasilyo tungo sa altar ng simbahan. Hahagkanan, di ka bibitawan, wala na akong mahihiling pa. Ikaw at ikaw, ikaw at ikaw, ikaw at ritong panalangin ko'y makasama ka sa pagtanda. Ang hiling sa Diyos na may gawa, apelido ko'y maging iyo. Naglakad ka ng dahan-dahan sa pasilyo tungo sa'kin at hinawakan mo ako't aking di na pigilang maluha ng mayakap na. Ikaw at ikaw, ikaw at ikaw, ikaw at
Sa unang tingin agad na humalik sa nagniningning mong mga mata. Ika'y isang bituin na nagmula sa langit. Hindi ko mawari ang tagal ay mong dinatangi. Sadya namang nakakabighani, di may paliwanag ang nararamdaman. Namumukadkad ang aking ligaya sa tuwing ika'y papalapit na. Hawakan mo ang aking kamay, o para luman ika'y akin ang tatayin sa di mo inasahang paraiso. Palagi kita nawitan ng kundi di magsasawa. Di ka pababayaan, sasayaw kita hanggang sa walang hanggan. Mga gunita na laging naisip, sumisilip ang itinagdanang may wagaan. Liwanag na dulot mo, nagbigay sinag sa madilim kong mundo. Ibang-iba ako kapag ikaw na ang kapili. Sumisiping ang buwan at mga bituin na para ba sumasang-ayon sa atin ang kalawakan. Namumukadkad ang aking ligaya sa tuwing ika'y papalapit na. Hawakan mo ang aking kamay, o para luman ika'y akin ang dadalhin sa di mo inasahang paraiso. Palagi kita nawitan kung di magsasawa. Di ka pababayaan, sasayaw kita hanggang sa walang para luman ika'y akin ang dadalhin sa di mo inasahang paraiso. Palagi kitang nawitan ng kundi di man sasawa. Di ka pababayaan, sasayaw kita. Mahalin kita hanggang sa walang hanggan. Sa araw-araw, tanging ikaw ang palagi kong hinangat. Laging tanaw sa'yo ang ilaw na nagsisilbi kong liwanag. Labis ang ngiti kapag ika'y kaharap. Ramdam ko ang pagmamahal, kapag ika'y nariyan o aking tahanan. Dito ka lang, dito ka lang, dito ka lang, o aking tahanan. Sa bawat sandali na tayo ay magkayakap ng mahigpit, tagalay mong hinig ang bumabalot sa aking nilalamig na damdamin. Tayong dalawa'y pinagtagpo ng tamang pagkakataon. Hindi maitatanggi na sa akin ikaw ang tanging tiyan. Ikaw lang, ikaw lang at ako ang naninaan ng paraiso na ating sinimulan o aking tahanan. Pinabawi lahat ng iyong mga ngiti, negatibo na nakadikit sa aking labi. Kulay ng iyong ngiti ang aking kiliti, katotohanan na hindi ka maitatanggi. Mahal kita, walang iba. Kaya naman, dito ka sa piling ko. Dito ka lang, dito ka lang. Bumabagal ang ikot ng mundo kapag ika'y nariyan o aking tahanan. Dito ka lang, dito ka lang, dito ka lang. Dito ka sa piling ko. Nakadikit sa aking labi. Bumabagal ang aking kilong. Hindi ko maitatanggi. Dito ka lang, dito ka lang, dito ka lang, o aking tahanan. Nagbabadya ang hangin na nakapalipot sa'kin. Tila merong payawatig, ako'y nananapig. Di naman napilitan, kusa na lang naramdaman ang di inaasahang papungay ng kalawakan. Ikaw sa paligid umawit-awit, natutulala sa nakakaakit-akit mong tinatangi. Napapangiti mo ang aking puso. Giliw, di mapigil ang puso ng damdamin ko. Kung mapapaamin mo, amin mo. Giliw, nagpapahiwating na sa'yo damdamin ko. Napagtanto na gusto kita.
Hindi ko alam kung saan ko sisimulan. Binibigyang kulay ang larawan na para bang Ikaw ang nag-iisang bituing nagsisilbing buwan na kapiling mo. Sa likod ng mga ulap pang tayo lamang ang tanging ilang bukso ang damdamin ko. Amin mo,
Gusto kita, gusto kita. Anong sa lamang kang meron ka, binabalik ka ng makita.
sa limang kang meron ka, ako'y nabihag mo na.
Ako na ay napiang mo na. Hindi naman talaga sinasadya, pagkat hindi na kaya tayo para sa isa't isa.
Papahiwatig na sa'yo. Damdamin ko. Giliw
Na pagtanto na gusto kita.
Ika'y dumating na parang ihip ng hangin. Ako'y naghahinga dahil sa'yo. Tadhana may di natin pwedeng alamin. Liliwanag ang daan tungo sa'yo. Dito ka lang sa puso ko. Kung ito'y pag-ibig nga, takot ay di nadama. Dito ka lang palagi sa aking tabi. Lahat kayang harapin kung dito ka lang. Di mapigilan ang lungkot na nadarama. Para bang dahong ligaw sa hangin. At nung dumating ka, parang magandang panaginip. Kasama ka sa buwan tuwing gabi. Dito ka lang sa puso ko. Kung ito'y pag-ibig nga, takot ay di nadama. Dito ka lang palagi sa aking tabi. Lahat kayang harapin kung dito ka lang. Ang buong lakas ay ibibigay ko kahit nasaktan. Ika'y pupuntahan kahit saan ka man. Kung kailangan mo ako, aking mahal. Dito ka lang kahit puso ko'y pagod at parang di na kaya. Mamahalin ikaw pala ang makakasama, ang hanap ko noon. Ibang-iba sa ngayon, ika'y dumating sa tamang panahon. Ikaw na ba yung dinalangin ko? Handa kong gawin ang lahat, magkapili ka lang. Walang hihigit sa'yo, ikutin pa ang mundo. Ako'y babalik sa'yo. Tanging ikaw ang sigaw ng puso araw-araw. Aminin ko na sa'yo, ngayon lang nagkaganto. Ako'y babalik pa rin sa'yo. Sino ba ang mag-aakalang mabibigyan ako ng pag-asa? Labas sa liga ko, isang katulad mo. Ngunit nang dumating, napatanong ako, ikaw na ba yung pinangarap ko? Handa kong gawin ang lahat, magkapili ka lang. Walang hihigit sa'yo, ikutin pa ang mundo. Ako'y babalik sa'yo. Tanging ikaw ang sigaw ng puso araw-araw. Aminin ko na sa'yo, ngayon lang nagkaganto. Ako'y babalik pa rin sa'yo. Oh, 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 oh. Ba-ba-da-ba-da-ba-ba, ba-ba-da-ba-da-ba-ba, handa kong gawin ang lahat, magkapili ka lang. Walang hihigit sa'yo, ikutin pa ang mundo. Ako'y babalik sa'yo. Tanging ikaw ang sigaw ng puso araw-araw. Aminin ko na sa'yo, ngayon lang nagkaganto. Ako'y babalik pa rin sa'yo. Oh, oh, oh,
Paano bang mababawi lahat ng mga nasabi? Di naman inakalang ika'y darating lang biglang nang walang babala. Sa isang iglap, nagbagong lahat. Hindi ko na kaya pa na magpanggap. Ikaw ang kumpas pag naliligaw. Ikaw ang kulay sa langit na bughaw. Sa bawat bagyo na dumadayo, ikaw ang kanlungan na kailangan ko. Kahit hindi mo alam, ilang beses mo akong niligtas. ikaw ang hantungan at aking wakas. Paano maniniwala ika'y nasa aking harapan? Di naman naiplano ako'y mabihag ng ganito. Totoo ba ito? Sa isang iglap nagbago ko, hindi ko na kayang mawalay sa'yo. Ikaw ang kompas pag naliligaw, ikaw ang kulay sa langit na bukaw. Sa bawat bagyo na dumadayo, ikaw ang kaluluwa
Bakit nandito ka? Hoy, ako naman. Kakaloka. Uy, nape-pressure ako. Okay. Wrong room. Bye, sir. Ayan. Ingat po. Ayan. Okay, sige. Good afternoon, everyone. Hello. Afternoon, guys. Hello po. Ayan. Nag-special guest si Sir Raymond. Alright. Siya ba kanina? Siya ba kanina? Okay. Sige. Uy, ang ganda ng schedule nyo kasi kinontinue lang natin. So, apparently, ang lecture natin would be Recalls 3 ratio. Alright, sige. So, let me share my screen now. Kinabahan ako slide nung nandito siya. Wait lang. Kinabahan, hindi kinilig. Ano ba? Ay, wait lang. There you go. Okay. Kita niyo po yung screen ko, guys. Hello, hello, hello. Kita yung screen, kita yung video. Rinig ako. Okay. All right. Good afternoon, everyone. Ako na naman po, opo, ang ipinadala na universe para po mag-share ng mga nalalaman ko po with regards to you being a board exam passer at the same time a board exam top-notcher. So, to formalize our lecture discussion for today, I would like to reintroduce myself. My name is JD Rojas po. I'll be your lecturer until the 8 p.m. Until the 8 p.m. Okay, but hopefully, hindi po tayo mag-extend, okay? So if you have any questions or clarifications, please feel free to ask me para right then and there maka-clarify natin, okay? If you feel that we're going too fast, pakisabihan niyo po ako. And if you feel that we're going too slow naman, again, pakisabihan pa rin ako because I believe, guys, communication is the key. Okay, communication is the key. And if we have a more stable Wi-Fi connection, I highly encourage you to please paki-open po ng cams natin para naman nagkakakitaan tayo dito. Okay, if you have a less stable Wi-Fi connection, okay lang din naman po sa akin to keep your cams closed. Mas importante po sa akin yung nakikinig tsaka yung nagto-take down ng notes. Okay, ayan. Check lang. Wait lang guys ah. Feeling ko kasi sumisigaw ako eh. Itapat mo na to sa'yo. There you go. Okay, before we start our Recalls 3, I would like to congratulate you because you reached Recalls 3. Balita ko hanggang Recalls 9 daw to. Okay, so medyo mahaba-haba pa po yung lalakbayin natin towards getting our own licenses. But at this point in time, I would like to remind you, okay, na yung mga 13, oh my God, 13, parang ako rin mismo yung napapagod na. Okay, hindi, kaya yan, kaya yan, okay? I would like to remind you guys that at this point, baliwala po yung mga test taking strategies na i-share po namin sa inyo if number one, hindi po kayo magbabasa ng mga notes, ng mga references, ng mga transes because, okay, maaring alam po ninyo yung test taking strategies pero yung basis po ng pagsagot ninyo, ng tamang sagot, saan nyo kukunin, right? If you don't know the basic concepts, so please keep on reading, please keep going, okay? If you need to rest, okay lang yan, but please do not stop. Okay? Number 2 that I would like to remind you is, baliwala rin po itong test taking strategies na sinishare po namin sa inyo if hindi po kayo magsasagot na maraming test questions. Okay? Kasi paano po ninyo ipapractice itong test taking strategies kung konti lang po yung questions na sasagutan natin. Okay? So, andito po yung top rank to provide you for as much questions as you need, guys. I think more than 1,000 set of questions na po yung binibigay namin sa inyo or yung pinaprovide sa inyo para lang ma-practice kayo. Okay? Because on the actual board exam day, ano ba yung gagawin natin doon? Di ba magsasagot tayo ng questions? Okay? So, here, practice pa lang to. Okay, nagpa-practice lang tayo. Ideally, ano ba yung scores namin, kada recalls po? I wouldn't really mind about the scores, okay? To tell you honestly, I think hanggang sa kaduluduluhan, siguro, ilan lang ba, okay, yung umabot sa score ko? I think less than 80, 70 lang din naman ako nun. Okay, pero I think mataas na rin man yung chances because okay, kahit na po na mababa po yung scores natin sa recalls, let's say 40, 50s lang, okay na okay yan guys because hindi naman ito yung exactong set of questions na marireceive natin sa actual board exam, right? What if yung lumabas sa board exam is yung set na alam ninyo? Pwede mas tumaas yung scores nyo. Okay. Uy, hindi ko sinabing less than 80 less. Sabi natin, sige, 40, 50, 60. Ganyan lang din yung scores ko noon. Okay? Sige. Alright. Recalls 3. NP3. 51 to 100. So please guys, keep going. Keep answering questions. Keep reading. Okay? Recalls 3, NP3. Number 51. Okay, number 51. Ito na po yun. Okay? Pwede po bang pa-type ng ready na guys? Para lang alam ko na andyan po kayo. Okay? Kasi naka-close yung cams ninyo eh. So, yan. Huwag niyo ko iwan ah. Huwag niyo ko iwan. Tapusin natin to. Okay? I'll be giving you your first afternoon break. So that's 3:30 p.m. So that's 15 minutes break. Tapos yung next break natin, I think that's around 6 p.m. Medyo awkward po yung time slot natin kasi 2 to 8 p.m. So hindi po ako makakapagbigay ng dinner break. Okay, so 15 minutes break lang. Pero kung feel niyo po na oversaturated na yung brain cells ninyo, pakisabihan niyo po ako, okay? Para magbigay ako ng 5 minutes break in between. Okay? Sige, ang dami ko na namang sinasabi. Ito na po yun, number 51. A situation, a major continuing and non-negotiable task of every nurse in the care of infants and children at varying stages of their growth and development is the application of her assessment skills. The following questions apply. Ganun pa rin, kapag binigyan po kayo ng situation, paki-highlight po. Okay, and when I say highlight, paki-bilugan, paki-underlinean para lang ma-make sure na, uy, nabasa ko to. Okay, number 51. Our school curriculum now include educating the young regarding human sexuality. What is the most appropriate age group for the nurse to incorporate these in her instructions? As we know, okay, sa mga ganitong usapin guys, you want to start them young. Okay, as young as preschool stage, nakakaintindi na sila. Pero kung gamitan ng mga medical terms, okay, use the words na kaya nilang maintindihan. Okay, especially kasi yung mga preschool people natin, preschool kids, they are prone to ask questions. Okay, yung mga why questions, hindi natin maiwasan mabanggit nila yan. Okay, so it would go beyond preschool, let's say school age, at the same time adolescent period. Okay, here's the choices. Pipiliin po natin, ano ba dito yung pinakabata? Siya yung sagot. Okay, 51, that's Apple, 9 years old. Ganun, 51 is Apple, 9 years old. Again, number 51, Apple. Okay. As we know guys, yung concept ng sexuality, hindi lang naman siya limited sa sex per se, right? It is also about our child's identity, okay? How he or she feels about his or her developing body, and at the same time, kung paano ba niya ma-express yung feelings of intimacy as one grows older, right? So kahit bata pa yan, pag-usapan na natin. 51, that's Apple. 52, Joe was a preschooler who just lost his grandma in an accident. At his age, he believes that that is, okay, Sir Archie. Okay, manifesting. So preschooler po ito, naniniwala po sila that it is letter Apple, temporary and reversible. Okay, temporary, reversible. Let's also be careful kapag sinasabihan natin sila na, uy, alam mo kapag may namatay sa atin, parang natutulog lang sila. Okay? Kasi they would take it literally. Okay? Matatakot na silang matulog kasi feeling nila mamamatay na rin sila. Okay? In addition to that, kapag sila po mismo yung nagkasakit, they would feel na punishment nila yon for something that they did. So, kailangan din nating ipaintindi na hindi naman yun punishment for them. Okay? 52, that's Apple. 52, letter Apple. Again, number 52, that's Apple. Okay. 52, that's letter Apple. 53, in caring for a 3-year-old, Nurse Nell knows that she needs to obtain the height of a child as part of the routine health screening. To obtain an accurate measurement, the child must. Okay. Ito po yung isang sure score sa inyo guys, okay? So out of 500 questions, hindi ka naman po mabubokya sa board exam. They would ask a simple question as this one. Okay, in this case, nagtatanong lang daw, paano ba kumuha ng height ng isang bata accurately? Right? So that's letter apple. Remove his shoes and stand upright with head level. Okay, number 53, that's letter apple. Number 53, letter apple. Once more, 53, that's letter apple. Number 54, the father of a 2.5-year-old asked Nurse Nell how to prevent early childhood dental cavities. The best response by Nurse Nell would be, so, okay, kapag binigyan kayo ng edad ng bata, kahit ano pa yung edad niyan, okay, paki-highlight po, okay, because lalo na nasa mundo po tayo ng pedya, mag-iiba po yung interventions na gagawin natin sa kanila. This one is a toddler child. Okay, in the context of preventing your early childhood dental cavities. Okay, here, bago tayo pumunta sa choices, alamin muna natin yung basic concepts. Magkakalkalan muna tayo na utak dito. Okay, approximately 6 months of age ng bata. Okay, magsisimula na pong tumubo yung ngipin niyan. Okay, what is the first primary teeth to erupt? Okay, at around 6 months. Yes, ang gagawin. Lower. What? Lower what? Okay. Practicein na rin natin yung kompletong sagot. Okay. Lower central incisors. So that's followed by your upper central incisors. Kaya napaka-cute ng mga bata na nagtiteething episodes. Diba? Kasi yun yung unang lumalabas sa kanila. Okay. As early as that kind of teeth, we have to protect it for as much as we can because, diba, especially sa diet nila, sa nutrient content especially, okay, kapag yan po is na-exposed sa mga sugar contents, let's say sucrose, okay, kapag po kasi na-digest yung or na-metabolize yung sugar doon sa ngipin ni baby, okay, yung bacteria po na yun ay magpo-produce ng acid and that acid is responsible for the tooth decay. Okay, so yung acid na yun, that would slowly dissolve the enamel of the teeth, kaya siya nabubulok. Okay, so number 54, letter dog, make sure your child's diet is nutritious and limit snacks high in sugar. Okay, yung diet yung pakialaman natin, yung i-modify natin. Ito rin po yung same reason kung bakit hindi natin sila hinahayaan na matulog na merong milk bottle sa bibig nila. Kasi tumatambay lang doon yung milk, okay, more exposure to sugar contents. Okay, 54, that's dog. 54, letter dog. Yes. Number 54, letter dog. 55. Nurse Nell inquires about the activity of a 3-year-old under her care. The mother states that the child loves to play at the park and the nurse encourages the mother to continue physical activities. What important principle guides the nurse's response? Okay, sige. So, you have your 3-year-old over here. I-highlight mo rin po yung mga pinagagagawa ng bata. Okay, i-highlight mo rin itong continue physical activities. Kailangan po malinaw sa atin, sino ba yung bida sa tanong? Okay, yung bata po, hindi yung nanay. Okay, ano ba yung tinatanong sa atin? Ang focus niya po is about the physical activities of the child. Bakit daw kailangang i-encourage pa? That's letter apple. Allowing the toddler to walk, run, and hop increases the child's kinesthesia. Okay, 55. Letter apple, hindi lang tayo basta-basta nag-highlight ng keywords, right? You also have to make sure na tama yung hina-highlight natin because it would lead us to the right answer. 55, letter apple. Again, number 55 is apple. One more, 55, letter apple. Number 56, the nurse is caring for a G3P1. Postpartum client who just had her delivery. Again, please highlight the patient. 56, the client after she was discharged came back to the clinic in her 3rd postpartum day. Again, please highlight. It tells you something, guys. She noticed that her breasts are really full and that she feels that it's really tense. What will the nurse tell the patient? Okay, nasa mundo po tayo na OB naman ngayon. Okay, it's very, very important for us to know, okay, which one is normal and which one is abnormal. Okay, dapat malinaw sa iyo. Normal ba to, abnormal? Okay, and then you do your interventions. Okay, here in this case, basically, 3rd postpartum, nagko-complain na po si mother Okay? Feeling niya puno na daw yung breasts niya at tense na daw. Okay? As you know, you just do your health education. Here, mother, normal po yan. Kasi po sa unang labas po, nung gatas po ninyo sa suso, okay, ang tinatawag po natin dyan ay colostrum. Okay, so that colostrum would be continuously excreted by the mother for the first 2 postpartum days. Okay, so after the first 2 postpartum, let's say the 3rd postpartum day, okay, yung colostrum na po na yan would start to convert or be translated to mature milk na. Okay, so from colostrum, magiging mature milk na yan. Of course, meron pong physiological processes for that. The breast will become full. Okay, so number 56, that's Kat. Tell the client that the breasts become tender and full at the start of the 3rd postpartum day. Okay. Ayan. So yung main concept natin, from colostrum, magiging mature milk na siya. Normal po yan. Number 56, that's Kat. Number 56, letter Kat. Number 57, the patient is about to be discharged from the clinic. The patient asked the nurse of when her menses will return if she will not continuously breastfeed her baby. What will be the proper health teaching of the nurse? Okay, sige. About the menses naman na. Okay. Alam natin na kapag na-deliver na po si baby, okay, madi-deliver na rin pati yung placenta, right? So upon delivery of the placenta, magtatapos na rin po yung production ng placental estrogen at the same time your progesterone. Okay? So kapag po bumagsak na po yung hormone concentrations natin, estrogen, progesterone, yun na po yung signal. Okay, na uy, it's the FSH time to shine. Okay? Tataas na po yung production ng FSH natin, causing us to have ovulation. Babalik na po yung ovulation. Okay? In the context of our breastfeeding mothers, okay, just because wala pa po silang menstruation doesn't mean hindi sila nag-ovulate. Okay, they have their ovulation back, pero wala nga lang silang menstruation. Especially kapag religious silang nagpapa-breastfeed, let's say 3 to 4 months, hindi sila magkakaroon ng menstruation. Ang tawag po natin dyan would be lactational amenorrhea. Yun yung lactational amenorrhea. In some cases, until the end or during the entire lactation period of the mother, hindi siya magkakaroon. Okay, dahil dun sa mechanism na yun. Now, if sabihin natin na working si mother, kailangan na niyang bumalik sa hospice. Okay, so madidisrupt na rin yung breastfeeding process, babalik na rin po yung menses niyan. Mas maaga. Okay, that's letter apple. The patient will have her menstrual flow back on track in 6 to 10 weeks after giving birth. Okay, number 57, that's apple. Okay, 57 apple. Isa pa po, 57, that's letter apple. 57, letter apple. Napakainit, guys. Share ko lang, knowing that the patient has high levels of BUN in her urine, okay, what will the nurse tell the client about her diet? All right. So, babalik din po tayo sa mga main physiological processes or mechanisms during the whole labor and delivery, which, as we know, guys, okay, increase po yung muscle activity ni mother during the labor. At the same time, kapag po na-deliver na si baby, tsaka si placenta, so na-reach na po yung process of involution, kung saan yung portion po ng uterine muscles would be broken down into protein na lang. Okay, kasi liliit na ulit yung uterus nun eh. So magsisecrete siya or magbe-breakdown na yung protein contents. Okay, ihi lang siya ni mother. Okay, so with this case, i-modify po natin yung diet niya. That's letter boy. Tell the client to increase her intake of chon-rich food. Okay, number 58, that's boy. Number 58, that's letter boy. Again, number 58, that's boy. Number 59, after 3 days, the patient had a urinalysis. The nurse noticed that the patient's BUN is relatively high. What would the nurse do? Okay. Similar concept, right? Letter boy, noted occurrence is normal. Okay, normal po yan. 59, letter boy. Again, number 59, letter boy. One more. 59 is boy. Number 60, the nurse is checking for patient's vital signs and noticed that her temperature is increased. the mother noticed that she also feels really warm and thirsty. What would the nurse tell the patient? During the whole process of delivery, okay, magko-compensate po yung body by increasing its own temperature because meron pong blood loss na nangyari dyan. So that would be secondary to dehydration. Okay? Kung mapapansin natin, nagsabi rin si patient, she feels warm and thirsty dahil nga po doon sa dehydration process na yon. So sabihin mo lang sa mother na normal po ito, okay? Tapos i-encourage mo po siya na uminom ng maraming fluids because eventually, yung elevated temperature niyan is babalik na rin naman siya sa normal. Okay, once the patient has an adequate fluid intake. Okay, so number 60, that's apple. Number 60, letter apple. Paano naman po, kunwari, kapag 30th hour, tapos 38.3 degrees Celsius, normal pa po ba yun? 30 hours na. Tapos 38.3, febrile si mother. Okay? So baka pwede mo na siyang i-refer kasi further assessment na kailangan nun, possibility of infection na. Right? And in a general sense, yung konsepto po ng infection, hindi naman siya agad-agad lumalabas. It takes time. So usually, after 24 hours, in the context of delivering a child. Okay, number 60, that's apple. 60, letter apple. Number 70, safety and quality during the birth-giving episode is the nurse's principal concern. The following questions apply. Number 61, a client has just delivered a baby 12 hours ago. During the postpartum assessment, the uterus is found to be boggy with profound lochia flow. Ayaw natin to, guys, because of a possible complication, which is what we call your uterine atony. Napakagagaling naman ng section na to, Diyos ko. Okay, so lakihan ko lang. There you go. That's uterine atony. So continuously bleeding yan. Ayaw natin yan. We want a firm uterus. We want a well-contracted uterus. Okay? Nurse's first action is to. First action kasi, yung tinatanong. At bago po tayo magtawag ng kung sino-sino, meron naman po tayong kayang gawin as an independent professional. Right? So assessment, tapos intervention natin. That's letter boy. Massage the uterus until firm. Okay, 61. Letter boy. Again, number 61 is letter boy. If upon assessment na displays to the right, okay, yung uterus ni mother, paihiin na lang muna natin kasi baka full bladder siya. Tapos i-reassess after. Okay, so 61, that's boy. Kasi 'di ba, balik lang tayo. Saan nga po 'yun? Okay. Kasi 'di ba yung naglalabas kasi siya ng proteins. So palitan natin yung nilalabas niya. So taasan natin yung diet niya ng protein intake. Right? Ganun. Okay. So 60, that's apple. Number 61, that's boy. 62, a woman carrying a breached fetus is scheduled for external cephalic version. Okay, nakuha mo yun, ma'am. Okay tayo doon sa concept na yun. Okay. She says to the nurse, I'm really scared of the procedure. Will it hurt badly? What is the best reply of the nurse? Okay. Sige, before we go to the choices, alamin muna natin, ano po ba yung ibig sabihin ng external version? Right? Ano po ba yung ibig sabihin ng external cephalic version? As much as possible, ayaw nating isubject yung isang nanay sa isang cesarean procedure kasi it's very, very invasive. Now, if upon assessment, breached po yung fetus niyan, okay, baka meron pa tayong pwedeng gawin, baka pwede pang i-massage, ikutin si baby hanggang sa cephalic na yung presentation niyan. Okay? Kung nahihirapan po kayong mag-imagine, guys, to the rescue po yung picture na to. Okay, so for example, ito si baby, naka-breach siya. Of course, doctors po ang gagawa nito. Ito yung kamay ni doc with the help of your ultrasound to locate the baby's position at the same time the position of the placenta. Okay. Magbibigay din po tayo ng tocolytic agent dito to help relax the uterus para mas with ease na mamassage si baby to change the position hanggang sa cephalic na yung presentation. Okay. Okay, given this kind of procedure, okay, alam natin na may contraindications to. Hindi po sa lahat ng baby applicable gawin itong procedure na to. Okay? Number 1, contraindication is if you have a multiple gestation. Okay, multiple gestation. For example, twins. Right? Napakaliit ng space. So, paano mo ikutin si baby kung may isa ka pang baby dito? So, hindi applicable ito. Okay? Number 2, contraindication. Meron pong severe oligohydramnios si mother. Pag sinabi mong severe oligohydramnios, napaka-konti naman na amniotic fluid. So, ganun din. Mahihirapan din gumalaw-galaw si baby kung konti lang yung amniotic fluid niya dyan. Okay? Another contraindication, of course, kung meron na pong existing complication, for example, yung umbilical cord po is nakarap sa leeg ni baby. Okay? Mas ayaw natin siyang galawin kapag ganun na yung nangyayari. Okay? So, hindi po sa lahat ng pagkakataon applicable itong procedure na to. Okay? Hindi po ba pwede mga midwives? Actually, honestly, hindi ako masyadong familiar. Okay, i-review natin yung responsibility ng mga midwife kung pwede pa silang mag-perform nito. Okay? Ayan. So, balik po tayo. Hindi daw. Okay? So, balik tayo dito, number 62. I'm really scared of the procedure. Will it hurt badly? That's letter boy. Sometimes the procedure is uncomfortable. If it becomes too painful, let the doctor know and she will stop the procedure. Okay? Sean naman, right? Wait lang. 62, that's boy. Balik tayo. Tama naman. Sean naman yung pinili natin. Sean rich food. Letter boy. Ah, wait lang. All right. Sige. Sige, balikan natin yung pinaka-concept. May nalito lang guys, bigla. Okay? High levels of BUN in her urine. Okay, in her urine. So, ibig sabihin, nag-excrete ka dyan. Nilalabas natin secondary to kasi increased yung muscle activity during the labor. Tapos, nagbe-breakdown yung protein. Okay, dahil yung portion ng uterine muscle natin, okay, lumiliit during involution. Okay? So, kapag nagsisecrete siya ng maraming protein, dagdagan natin. Okay, i-modify natin yung diet. So, 58 boy. Nilalabas niya kasi yung protein. So, dagdagan natin. Palitan natin yung nilalabas niya. So, 58, that's boy. Yes, so secondary to those mechanisms that we talked about. Okay. So, related din siya sa pregnancy. Okay. Karina? Okay, sige. Wait lang. May questions pa. Sige, isulat natin dito yung contraindications to having your external cephalic version. Number 1 is kapag may multiple gestation. Okay, number 2, kapag meron ka pong severe oligohydramnios. Okay, number 3 is you have yung mga existing complications, let's say cord wrapping around the fetus neck. Yan. Ito yung mga ilang instances na hindi natin po pwedeng gawin itong cephalic version. So you will locate the position of the patient, of the fetus, using your ultrasound. So once na na-identify na natin yung exact location ni baby, okay, at na-establish natin na ay, oo nga, breech nga siya. Okay, literal na massage. As in, iikutin lang talaga yun. I've seen one in actuality. So, sa OB, okay, parang literal na massage lang ni doctor yan. Okay, gagawin po ito sa delivery period, labor and delivery period. Okay? Kapag malapit na lumabas si baby, tsaka siya iikutin during the, sorry. Yung uterus. Okay, so here, saan yan? It's like kneading a dough. Okay, ganun natin imamassage yung uterus kapag boggy siya. It's like we're just kneading a dough. Okay, over time, magre-respond yung uterus na yan, dapat magko-contract siya. Okay? Again, 61, that's boy. 61, that's boy. Number 62, that's boy ulit. Could be. Yes, you could do your Leopold's maneuver. Okay, 62, that's boy. Okay na tayo. Proceed. On the same page na ba ulit ang lahat? 63, it is most likely that the physician would consider performing an amnioinfusion when external fetal monitoring tracing shows. Okay, before we go to the choices, define muna ulit tayo ng mga bagay-bagay sa buhay. So, let's highlight this term, amnioinfusion. Okay? Pag sinabi mo amnioinfusion, ibig sabihin, magdadagdag ka ng fluid sa loob ng uterus or ng tiyan ni mother kasi kulang yung amniotic fluid. Okay? Especially kapag daw meron ka nakitang severe variable deceleration. Okay? Itong variable deceleration na to, what does this imply? Ano ini-indicate nito? Cord compression. Alam nyo, namumuro na kayo guys. Ang gagaling nyo talaga. Okay? Cord compression. Bakit po nagkakaroon ng cord? Bakit po kailangan magbigay ng amnioinfusion kapag may cord compression? Because, okay, nai-stress po kasi si baby. Okay? Kapag nai-stress yung fetus sa loob ng tiyan ni mother, umuunti rin po yung ihi niya. Right? So kapag nare-reduce din yung fetal urine volume na napoproduce ni baby, umuunti rin po yung amniotic fluid kasi isa sa component ng amniotic fluid is the urine. Right? So kapag onti na po yung amniotic fluid, okay, magkakaroon siya ng possible cord compression. Kailangan nating ma-relieve yung cord compression na yon, dagdagan natin yung tubig. Okay, 63, that's cat. 63, letter cat. So may continuous monitoring po tayo dyan. Parang just enough lang to know na hindi na babalik yung variable deceleration episode. So if that happens, stop na rin yung amniotic infusion. Okay, so 63, that's cat. 63, letter cat. Again, number 63, letter cat. 64, a woman arrived to the labor suite and states, I have water leaking down my legs. What assessment is most appropriate in this situation? Kapag ito po, yung na-receive nating cue from the mother, we would want to assume na, uy, baka amniotic fluid ito. Okay, hindi naman tayo po pwedeng mag-a-assume lang. So, kailangan may test tayong gagawin. That's letter C, FERP test. Basically, itong FERN test na po na ito, kukuha ka ng amniotic fluid as the sample. Titingnan po yan under the microscope. So, kapag may nakita po silang FERN-like pattern, okay, that's positive for FERN test. Ibig sabihin, amniotic fluid yon. Okay? Along with your FERN test, guys, meron pa po tayong pwedeng gawin dyan. It's what you call your nitrazine. Nitrazine paper test. Okay, nitrazine paper test. That's an example of your pH test. Okay, kung saan, kapag ito daw po ay naging color blue. Okay, kapag daw yan is naging color blue, ibig sabihin, positive siya with the presence of your amniotic fluid because in the first place, yung amniotic fluid natin, guys, alkalinic in nature. Right? Alkaline yan. Let's say 7.1 to 7.4. Okay? So 64, letter C. Ganun. 64, letter C. Again, number 64, that's letter cat. 64, that's cat. 65, the nurse is preparing a woman for epidural anesthesia. The woman asks, why is my IV running so fast? It feels so cold. Ganun. What is the appropriate reply of the nurse? Okay. Alam natin that when we're giving an anesthesia, meron pong mga side effects yan. Number one side effect, hypotension. Okay, hypotension. Eh gusto nating habulin yung hypotension na yan. So tataasan muna natin yung rate just to make sure na hindi totally bababa yung BP ni mother. Okay, 65, that's letter apple. 65, letter apple. Okay. If this is not enough, baka pwedeng mag-administer ng medications. Let's say any kinds of your vasopressor, ephedrine, norepi, pwede yan. Okay. Kapag merong maternal hypotension, alam natin na compromise din po yung placental blood perfusion. Right? Anong klaseng positioning natin ilalagay si mother? Anong positioning yan? To reduce your vena cava compression. Ganon. Left side lying. Hindi lang basta side lying. Okay, kumpletuhin natin. Left side lying. Very, very, very good. Okay, number 65, that's apple. 65, letter apple. Again, number 65, letter apple. 66. Ina Marie calls her prenatal clinic to report that she had intermittent lower abdominal cramping and occasional spotting for the last 24 hours. Her last menstrual period was 8 weeks ago, and 2 weeks ago, she had a positive pregnancy test. Okay? Isa pong kagandahan kung bakit binabasa natin yung situation is that even before we read the question, okay, napipicture na natin sa utak natin kung sino ba yung next patient na itatanong sa atin. Right? Here, meron daw po siyang positive pregnancy test 2 weeks ago. Tapos yung LMP niya was 8 weeks ago. So we would want to assume na, uy, kung buntis to, first trimester pa lang siya. Right? First trimester. Tapos imagine, anong symptoms na po yung nafe-feel niyan? Occasional spotting, lower abdominal cramp, which is very, very unusual for a patient who is under the first trimester period. Okay? So here pa lang, i-assume na natin na anong nangyayari sa'yo, Ina Marie. Meron ka bang abortion? Okay. So ipapart mo sa utak mo, abortion siguro to. Ganon. Ganon tayo dito. So number 66, a woman has been in preterm labor off and on for 2 weeks. She is 28 weeks pregnant. It seems inevitable that she will deliver soon. Okay? In this question, preterm naman siya. Okay. Which of the following medications would the nurse prepare to give this client? Okay. Hindi na daw mapipigilan. The baby has to come out. Okay. But we want to make sure na kapag nilabas itong baby na to, he or she will survive on its own. Diba? Sa extrauterine life niya. Okay. Bibigyan po natin siya ng steroids, guys. Yan. Bigyan natin siya ng steroids. Okay. If you would try to explore more about the topic between the relationship of steroids and your preterm delivery, medyo hindi pa po fully understood yung mundo na yon. But one mechanism na gusto nilang tingnan is that kapag daw po kasi nagbibigay ng steroids, mas bumibilis daw po lalo yung formation ng long surfactant. It's for the long maturity, guys. Okay, hanapin lang natin sa choices, steroids, celestone, letter apple. Okay, this one is an example of your betamethasone. Yan, 66, that's apple. 66, that's letter apple. Okay, if you want to give your betamethasone, ito po yung dose niyan. So that's 12 milligrams for 2 doses. Okay, taken or given 24 hours apart, every 24 hours IM. Okay, IM yan. Now, if gusto mo naman pong ibigay dexamethasone, which I think parang mas common atang binibigay ang dexamethasone, okay, mas malimit naman po. So that would be 6 milligrams for 4 doses. Okay, Q 12 hours apart. Every 12 hours, IM pa rin. Okay, so if you want a quicker reference for the dosage, please feel free to screenshot. Okay. Pero between the two, mas preferred yung betamethasone. Kasi mas napapabawas niya yung risk to having respiratory distress syndrome for the babies. Okay, 66, that's apple. 66 letter apple. Isa pa po, 66 letter apple. 66 apple. 67. Which of the following positions should the nurse place the patient who has been diagnosed with prolapse cord? Again, guys, prolapse cord. Ayaw nating may ipit yun. Okay, so Trendelenburg position to relieve the pressure in the cord. 67, that's cat. 67 letter cat. And if ever na lumabas na po yung cord, please avoid touching the cord like palpating kasi magkukos po yun ng vasospasm. Okay, 67, that's cat. 67 letter cat. Again, 67 is letter cat. 68. A week later, Ina Marie comes back to the emergency room because of heavy bleeding and severe cramps. Vaginal examinations reveal that her cervix is dilated and tissue is bulging through the OS. Which of the following would be the best procedure in managing this new condition? Okay, i-highlight natin yung assessment findings. Okay, kapag po bumukas na yung cervix in the context of your abortion, ang tawag na po natin dyan ay inevitable abortion. Hindi mo na mapipigilan. Okay, inevitable abortion. It has to come out already. Okay, pwede po tayong magpa-ultrasound for that. Okay, just to establish na namatay na po yung fetus sa loob. Okay, after that, okay, to avoid the complications such as bleeding or sepsis, okay, linisin po natin yung loob ng uterus ni mother. So mag-perform tayo ng dilatation and curettage dyan. Okay, iraraspahin po siya. Okay, but the best answer for number 68 would be letter boy, oxytocin stimulation. Bakit po? To further dilate the cervix, okay, we have to induce the labor para lumabas yung conception sa loob. Okay, or yung products of conception sa loob rather. Okay, 68 letter boy. Hindi mo kasi malalabas yan kapag hindi mo na-induce yung labor. Okay, so 68, that's letter boy. Okay, 68, that's letter boy. Ano po ang Sherrod-Carr procedure? Okay, ito is under the context of your cervical cerclage, right? Dun yan. Okay, hindi po ba for DNC? But before you're able to do this one, i-induce mo muna yung labor para ma-dilate further yung cervix. Okay? Ayan. So ito muna tayo, oxytocin stimulation muna. Okay? So 68, that's boy. 68, letter boy. 68, letter boy. 69, Ina Marie comes to clinic. Pelvic examination which reveals vaginal bleeding but no dilatation of the cervix. Confirms a tentative diagnosis. Which of the following should not be considered in the management of Ina Marie's condition? Okay. Ito naman po na vaginal bleeding but no dilatation of the cervix. Kung kanina is we have your inevitable abortion, this one becomes your threatened abortion. Okay? Threatened abortion. May magagawa ka pa po to save the fetus. Okay? Such as bed rest or abstinence from intercourse, pati administration of mild sedatives. Okay? Pero kasi, tinatanong sa atin, not be considered. So we have your negative sign over here, that's letter dog, administering of synthetic estrogen. Okay, 69, letter dog. 69, letter dog. Kasi daw po, kapag nagbigay ka dyan ng estrogen, tataas naman po yung risk na mother to having your cancer. Clear cell carcinoma, to be specific. Okay. 69, that's dog. Number 70, the most likely diagnosis for Ina Marie's condition based on the information presented, that's letter C, threatened abortion. Okay, threatened abortion. Okay, yun din yung isang purpose nung situation kasi cluster of questions yan. Related sila sa isa't isa. So, konting na dito, threatened abortion. Pwede isagot natin, letter C, threatened abortion. Okay, number 70, letter C. Number 70, that's cat. Again, 70, letter cat. Number 71, there are various pediatric disorders that require comprehensive assessment. Okay, sulat natin. Pwede daw po siya magkaroon ng clear cell carcinoma. Okay? Kapag chronic exposure dito sa synthetic estrogen. So 69, that's dog. 69 is dog. Number 70, that's cat. 70 is cat. 71. In feeding the infant with the myelomeningocele sac, how should Nurse Rebecca position him to prevent complications? Pedia na naman to, guys. Tama ba tayo, NP3? Bakit napakadaming OB-pedia question today? Nakakaloka. But either way, sagutan pa rin natin. Okay? I just have to complain first. Yan, yung mga mechanism, coping mechanism. Okay, sige. So, i-highlight mo to. Tapos, positioning, i-highlight mo rin. Okay? Before we go to the actual choices, please, okay, let's talk a little bit about this concept para lang malinaw sa ating lahat. Okay? So kapag po narinig ninyo yung concept na spina bifida, yon, spina bifida, di ba? Ano ang spina bifida? Isipin niyo na lang, that is a kind of your neural tube defect. Neural tube defect po yan. Yun lang yun. Okay, we have two major classification of your spina bifida. The first one is what you call your spina bifida occulta. The next one is your spina bifida cystica. Spina bifida cystica. There you go. Okay. Okay. Anong pinagkaiba nila, ma'am? Of course, may isa dyan mild lang. Okay, occulta yon. In fact, guys, sabi daw, mas mild daw po yung occulta because it is sometimes called as your hidden spina bifida. Paano hidden spina bifida? Wala po kasi siyang external sac-like cyst na makikita. Okay, ang palatandaan lang talaga natin dyan is yung tuft of hair. Okay, tuft of hair. Now, kapag narinig nyo po yung tuft of hair, please think of your spina bifida occulta. Kaya lang talaga yung palatandaan natin dyan. Okay, meron po siyang defect but it is not visible externally. Okay, may small gap sa spine, yes, pero wala kang opening, wala ka ring sac na makikita sa likod ni baby dyan. That's your occulta. Okay, tuft of hair, may small portion lang ng buhok dyan. Okay, i-highlight natin. When you say cystica, on the other hand, guys, baliktarin lang natin. So kung kanina wala ka makita, ito meron na po. Actually, visible na po yung defect niyan. You could now see the external sac-like cyst. Yan, external sac-like cyst. Okay? And under the concept of spina bifida cystica, meron pa po yung two further classifications. So kapag po narinig ninyo yung konsepto na meningocele, okay, may kapatid yan guys, myelomeningocele. Yan. Myelomeningocele. I-differentiate naman natin sila. So kapag narinig niyo po, meningocele, yes, okay, sige, may external sac-like cyst, pero anong laman? Right? Anong laman ng meningocele? You could have your meninges. So isulat natin, sac-like cyst or cyst, okay, with the meninges filled with spinal fluid. Okay? May meninges filled with spinal fluid. Okay? Kapag naman po myelomeningocele ang pinag-uusapan, okay, mas severe form naman po ito because hindi lang po meninges yung laman yan. Hindi lang din po spinal fluid ang laman yan. Ano pa po? May portion na po ng spinal cord. Okay? With the nerves. Kasama rin dyan. Okay? So that's the difference between meningocele and myelomeningocele. Pero parehas silang may sac-like cyst. Okay? Isama ko na rin po sa konsepto para kapag nag-aral kayo, isahan na lang. Yung konsepto po na encephalocele. Okay? So kapag narinig mo naman yung encephalocele, okay, seal, so may cyst ka rin dyan, pero saan natin makikita? Hindi na po sa vertebrae ni baby, sa skull na po. Okay? So you could have your cyst or sac-like cyst located in the skull. Ganun, located in the skull. Okay? Ayan lang yung kailangan yung maintindihan guys kapag spina bifida ang pinag-uusapan. Okay? At dahil ayaw ko kayong nahihirapan mag-imagine ng mga bagay-bagay sa buhay, let me show you a picture of those. Okay, so here is a picture of your spina bifida occulta. If you would notice, wala kang sac na makikita dyan. Ano lang po makikita? Buhok lang po. Okay, very, very not visible. Unlike here, when you go here, meningocele, sac-like cyst, presence ng spinal fluid at the same time your meninges. Tapos, if you go here, myelomeningocele, obviously, mas severe siya tingnan, right? Kasi hindi lang meninges, spinal fluid, even the portion of your spinal cord, okay, affected na rin. Okay? And kung nakikita natin si baby here, hindi natin siya pwedeng isupine. Okay, bakit? Kasi madadaganan niya yung cyst. Okay? It screams infection. It screams complication. Okay, kapag nadaganan yan. So you have to make sure to keep the child in a prone position. Okay, kahit anong mangyari. Okay, now balik po tayo dito. So please feel free to screenshot, guys, if you want a quicker reference. Okay. Harry, so let me delete this now. Ayan. Sabi daw, in the context of feeding naman daw, paano natin siya papakainin? Still, you have to keep the patient in prone position with the head turned to the side. Okay, with the head turned to the side. Very, very understandable na napaka-awkward ng position kapag pinapakain si baby na merong myelomeningocele sac. Okay? Kasi kailangan nating ma-maintain yung ganong position. But if you want na medyo elevate po si baby, pwede po tayong kumuha ng diapers. I-stack po natin yon sa upper chest niya para medyo nakaangat siya. Para hindi naman niya ma-aspirate yung kinain niya after. Okay? Yung encephalocele, hindi siya under ng concept ng spina bifida. Katabi siya. Kunwari, ito yung spina bifida na concept, ito yung encephalocele. Okay, hindi siya under. Kasi pag spina bifida, nasa spine, nasa vertebra. Kapag encephalocele, nasa skull naman siya. Okay? Siningit ko lang, guys, para ma-differentiate natin. So imaginein po ninyo, yung bukol na to, nandito sa skull. Okay, ano pong laman ng encephalocele? Okay? Depende. Pwede rin siyang meningocele na itsura na puro meninges lang or spinal fluid. Meron din namang may portion ng spinal cord. Okay? So, pwede siya dito at the back of the skull. Pwede rin dito actually sa may noo. Pwede siya dyan lumabas. Okay? Kaya, the way that we define this encephalocele, it's meningocele and your myelomeningocele pero located sa skull. Ganun lang, yung shortcut natin. Okay? So, 71, that's boy. 71, that's boy. 72, the patient with myelomeningocele is placed under a warmer without any clothing. How should Nurse Rebecca care for the patient's sac? We have to protect it for as much as we can. Ayaw nating magiging dry po siya at madi-dehydrate. So letter C, apply sterile, moist, non-adherent dressing over the sac. It is a sac. Di ba pag sabi mo sac, may laman na tubig yun eh. Di ba? So iwasan nating madry yan. And the way that we should change for the dressing, dapat daw as frequently as every 2 to 4 hours, just to make sure lang na we have to keep it moist as possible. Right? So number 72, that's cat. 72, letter cat. Number 72, that's cat. One more, number 72, that's letter cat. 73. Nurse Rebecca is handling another patient with myelomeningocele, type spina bifida. Nurse Rebecca knows that neural tube disorders like spina bifida is prevented by prenatal intake of which of the following? Okay, alam ko to eh. Okay, na folic acid yung sagot. Pero ang problema, hindi ko alam kung anong klaseng B-complex ba siya, guys. So please do not overlook as simple questions as this one. Okay, so vitamin B9 is for your folic acid. Okay, 73, that's apple. Vitamin B6, that is your pyridoxine. Vitamin B12, this one is your cobalamin. O, kayo naman sumagot. Ano naman yung vitamin B1, guys? TH. Vitamin B1, thiamine. Very, very, very good. Okay. Uy, ang gaga. Naiiyak ako, Sir V. Grabe, ang gagaling nila. Recalls 3 pa lang. Wala pa tong pre-boards 1 ah. Okay, 73, that's apple. 73, that's letter apple. Okay, 73 apple. 74, Janix is a pedia patient of Nurse Rebecca. Janix is diagnosed with Duchenne's muscular dystrophy. Because of this condition, when Janix tries to walk, he is said to walk up his front, pressing his hands against his ankles and thighs. Rebecca notes sign as. Okay, that's letter apple, gover's sign. Ito po yung exactly, okay, na ginagawa ng isang batang meron Duchenne muscular dystrophy if he wants to stand. Pinaka all fours mo na yan, tapos kakapit siya sa tuhod niya para tumayo ng tuluyan, ng upright. Okay? So let's talk about your muscular dystrophy for a little while. Muscular dystrophy. Ito, this one. So please feel free to screenshot. Carry na, 73, that's apple. 73, apple, 74. Let's talk about muscular dystrophy. Okay, ito po, muscular dystrophy, hindi lang po siya isang individual disease. Actually, group of diseases yan. Pero isa lang naman yung pinaka-main affectation yan. It would cause you to have progressive weakness. At the same time, loss of muscle mass. Yan yung pinaka-problema kapag meron kang muscular dystrophy. Okay? Dagdagan natin ng word na Duchenne. Okay? Kasi kapag dinagdagan mo ng Duchenne, hindi lang ito yung ibig sabihin yan. It becomes, okay, a genetic disorder. Okay? So Duchenne's muscular dystrophy, genetic disorder po ito. In fact, this one is an example of sex-linked recessive trait. Okay? Sex-linked recessive trait. So with this one, we would want to assume na ay, puro male population yung pinaka-affected nito. Okay. Ayan, so progressive weakness, sabihin natin na lumabas si baby, very, very perfect, walang mali sa kanya. Pero the very first time na mananotice natin na, uy, bakit parang may iba sa bata na to? Usually preschool age po yan. Okay, usually preschool siya na da-diagnose. But some references would tell you that as early as 3 years old, pwede na pong maging obvious yung symptoms. Okay, so number 74, that's apple. Wag yun ang pinagpapapansin yung ibang choices na hindi naman related sa dystrophy. Letter boy, Chadwick sign. O, ano to? Discoloration ng cervix. Ortolanis, pati yung Barlow, Santo, hip dysplasia. Okay, very, very wrong. So 74, that's apple. Here is 73. $73, that's apple. Carry na tayo dito. 73. All right, 74. Apple. Carry. 75. To maintain the optimal functioning of Janix's muscles, select the interventions that Nurse Rebecca should include in her care plan and discharge plan. Again, with the select all that apply questions, hindi natin mapipigilan ang pagdami nila, guys. Okay? We just have to prepare for them as they come. Okay? Sinasabi ko na rin naman po sa inyo na wala naman po tayong secret on how to really best answer number 75 na select all that apply. Patience is the key talaga. Okay, tiyagain natin kasi hindi mo masasabi na, uy, all of the above to, kung hindi mo naman inisa-isa yung choices. Okay, so make sure na basa mo yung bawat choices. Okay, 74 is this one. 75, maintain complete bed rest for as long as possible. Imagine, meron siyang risk na progressively weakness. Okay, tapos ibe-bed rest mo lang, edi mas lalong bibilis yung progressive weakness na yan. So ayoko niyan. Okay, as much as possible, kung kaya maging ambulatory ni patient, hayaan mo lang siya. Okay, i-uphold natin yung independence ni patient. Okay, hanggang sa kaya niya. Okay, number 2, perform stretching exercises, strength and muscle training. Gusto ko to. Okay, perform breathing exercises to increase and maintain lung vital capacity. Gusto ko rin to, guys, kasi po meron tayong respiratory muscles, right? So eventually, Okay, along sa trajectory ng disease, pwede rin siyang maging affected. Okay, number 4, comply to follow up in physical therapy, of course. Kasi ang main problem natin would be progressive weakness. Number 5, encourage influenza and pneumococcal vaccines. Kasama rin to guys. Kasi nga po, dahil meron tayong possibility na maging affected yung respiratory muscles niyan, okay, tataas na rin yung risk of having respiratory infections. Okay, so additional protection na to, itong vaccines. So i-highlight din natin. Okay, number 6, encourage parents to perform all Janix ADLs to avoid fatigue. Ayaw natin na magiging dependent po siya. So, burahin sa paningin. Kung ano lang po yung highlight, yun lang yung tamang sagot. So, that's 2, 3, 4, and 5. Kitang-kita na natin ngayon. Letter dog. 75, that's dog. Okay, number 75, letter dog. 75 is letter dog. Number 75, dog. 76, Nurse Nicole is addressing concerns of several clients in the outpatient department of lying-in clinic. The following questions are clients consulted Nurse Nicole. Does she perform health teaching? An antenatal client receives education concerning medications that are safe to use during pregnancy. Nurse Nicole evaluates the client's understanding of the instructions and determines that she needs further information when she states which of the following. Again, kapag po nakita niyo itong phrase na yan, further information, ibig sabihin may nabanggit siyang mali. Kaya mo siya tuturuan further. Okay, i-correct mo yon. So ilagay lang po natin dito negative sign. That's letter dog. If I need to have a bowel movement, X-lax is preferred. Okay, medyo mali siya doon because kapag po pregnant patients ang pinag-uusapan, hindi muna natin sila bibigyan ng stimulant laxatives. Okay? Stimulant laxative po ito, it's very, very abrasive for the pregnant people. Okay, ano lang po yung recommended? Okay na sa kanila, yung bulk laxatives. Okay, ano ba yung example ng bulk laxatives na to? We have Hercules, Dulcolax, pwede rin. Citrusel, yan. Ano pa ba? Metamizole. Yan, yung mga example ng bulk laxatives natin. Ang milk of magnesia, pwede po itong ibigay. Okay? Pero ang hindi rin pwedeng ibigay ay mineral oil because that would prevent the absorption of the vitamins needed within the GI tract. Okay? So 76, that's dog. 76, letter dog. 76, that's dog. Okay? Stimulant laxatives, wag muna, medyo abrasive for the pregnant women. 77, 30-year-old multigravid client has missed 3 periods and now visits the prenatal clinic because she assumes she is pregnant. She is experiencing enlargement of her abdomen, positive pregnancy test, and changes in the pigmentation of her face and abdomen. These assessment findings reflect this woman's experiencing a cluster of which signs of pregnancy. Dahil meron po tayong positive pregnancy test over here, that's letter boy, probable. Okay, probable tayo dyan. Kapag sabi mo probable, ito yung mga objective findings ni nurse. Okay, kapag naman po presumptive, ito naman po yung mga subjective cues ni patient mismo. 77, that's boy. 77, letter boy. Again, 77 boy, 78. An antenatal primary gravid client has just been informed that she is carrying twins. The plan of care includes educating the client concerning factors that put her at risk for problems during the pregnancy. Nurse Nicole realizes that the client needs further instruction when she indicates carrying twins puts her at risk for which of the following. Mahaba yung tanong. In fairness, i-highlight mo yung mga kailangan mong i-highlight for you to get the right answer. Needs further instruction. So, mali. Yung hanatin natin. Okay? Preterm labor. Okay? Kapag may twins ka, very, very prone to have preterm labor. Tama. Kapag may twins ka, very, very prone to have twin-to-twin transfusion. Tama rin. Okay? Kapag may twins ka, pwede kang magkaroon ng anemia. Tama rin naman. Except letter dog. Group B streptococcus. Hindi siya kasama. Okay, so number 78, letter dog. 78, letter dog. Okay, i-compare lang natin ng mabilisan. Ano bang pag sinabing identical tsaka fraternal? Okay, so kapag sinabi mong identical twins, ito yung sikat na sikat. Okay, monozygotic. Okay, twins. Okay, so kapag sinabi mong monozygotic, of course, sige, share natin mamaya. Wait lang ha, tapos na lang natin to. Monozygotic, so that's single ovum and single sperm. Okay, nanggaling sila sa isang ovum. Okay, nag-divide kasi yon. Okay, this one, usually isa lang din yung placenta dyan. Okay, they share it. Tapos they have your one chorion. They have two amnions. Okay, they also have two umbilical cords. Okay, if you would notice, yung patients natin na identical twins, usually same-sex yan. Okay, usually same-sex yan. Kung yung isa ay babae, yung isa babae na rin. Usually. Okay, susulat natin dito, usually. Same sex. Okay, next one is your fraternal twins o kaya dizygotic. Dizygotic. Okay, so kapag naman po fraternal twins, ang kinakaharap po natin, okay, dalawa naman po yung na-fertilize na ovum. So that's two separate ova. So that's two ova and sperms. Okay. Ano pa? They have two placentas. They have two chorions. Two amnions. Lahat dalawa. Tigi-tigisa sila. Okay. And two umbilical cords. Okay. Kung kanina po sa identical, usually same sex. Ito naman, pwedeng same, pwedeng different sex. So usually, different sex. Yung isa lalaki, yung isa babae. Yan lang yung pinagkaiba nila. Basically. Okay. Pag-usapan po natin, ano po ba yung twin-to-twin transfusion? Baka mababanggit pa yan further sa UB lectures ninyo. Pero kasi kapag dalawa po yung twins natin, kapag dalawa yung chan, kapag dalawa yung bata sa chan, as we know, di ba, complication ang multiple gestation. Right? Complication siya because the way that a female body is made, dapat isang tao lang yung kaya niyang i-cater, pero kasi dito dalawa. So anong nangyayari po? Nag-aagawan po sila ng supply. Okay? So yung placental blood supply ay hindi equally divided sa kanilang dalawa. Anong implication nun kapag nag-aagawan sila ng blood supply? Of course, yung isa po magiging malnourished. Okay? Possible pwedeng magkaroon ng organ failure yung isang twin kasi kulang siya sa blood supply. Napupunta lahat sa isang baby. Yun po yung twin-to-twin transfusion. Okay? Complication po yan. Harry, okay. Meron bang dapat gawin para makakonceive ng twin? Actually, I haven't read further, okay, sa concept na to, but I think genetics has something to do with it. Okay? Kapag may lahi kayong puro twins, pansinin ninyo, ayan, malakas yung twins sa isang sa isang family na yun. But I would like to read further on this one. Kung meron bang dapat gawin if you want a twin, okay? Pwede ka rin magkaroon ng twin kapag in vitro fertilization. Okay? Isipin lang natin na yung multiple gestation, complication yan eh. Diba? So one complication ng in vitro fertilization, sa test tube siya na na fertilize is having twins. Okay? Here, 79, Nurse Nicole is teaching a new prenatal client about her iron deficiency anemia during pregnancy, which statements indicate that the client needs further instruction about her anemia. Again, further instruction. So something wrong. Yung hanapin natin. That's letter boy. I may have anemia because my family is of Asian descent. Okay. Mali po ito, guys. In fact, if we're going to talk more about the ethnicity or the prevalence across the races of having anemia, basically, ang pinakamataas po yung risk of having anemia yung mga African Americans na patients natin. Actually, yung Asian descent, relatively lower prevalence po yan. Okay? And just because you have a higher risk to having anemia, okay, pwede mo naman itong supplyan ng mga supplements natin, iron supplements, right? So 79, that's boy. 79, letter boy. Oo, Judger yan. 79, that's boy. Magdadasal na lang po ba if I want a twin kung malakas tayo kay Lord? Pwede. Okay, so 79, that's boy. Number 80, during a visit to the prenatal client or clinic. Irma is at 32 weeks gestation and complains of heartburn after Nicole's health teaching. The client needs further instruction when Irma says she must do what? Okay. Complaints of heartburn. Okay, may reflux na nagaganap. Okay, medyo may mali po ito. Mali yung hanapin natin, right? Kasi needs further instruction. Yung letter D yan because kapag po nag-consume ka ng fluids during your meals, anong mangyayari? Lalaki rin po yung volume ng food content natin sa stomach. Okay? So mag-i-increase din po yung stomach distension. Anong implication nun? So kapag malaki yung stomach distension, it would add more pressure to your lower esophageal sphincter. Okay? It would add the risk to having your reflux. So 80 letter dog. Putol po ang question. Alright, so i-bonus natin. Okay? Paki-take note na lang po ng question tapos i-bonus natin, ha? Wait lang, tinitingnan ko. Ay, oo nga, kulang nga. So, paki-bonus dito. So, +1 sa atin. Pero paki-take note ng question para kapag kayo na lang mag-isa yung nagre-review nito, alam niyo yung tamang sagot. So, 80, that's dog. 80, letter dog. 81, Ellie. A nurse working in the OB ward of a second-level hospital received a post-normal delivery mother back in the ward with her healthy newborn baby girl. Rooming in is newly practiced in this hospital. Ellie attended a meeting in the hospital representing her ward where she pushed for adherence to the expanded Breastfeeding Promotion Act of 2009. This measure provides the third vital component of the breastfeeding law. Okay, by letter boy, maintaining the provision of facilities for breast milk collection and storage and establishment of lactation stations. Okay, kung mapapansin nyo guys, yung mga malls na binibisita natin from time to time, may sarili po silang mga breastfeeding stations. Right? May sarili silang breastfeeding stations. Kasi according to this law, may kaltas daw yun sa tax na babayaran nila kapag nag-provide sila ng mga breastfeeding stations. So yun sinasabing incentives. Okay, so 81, that's boy. Okay, 81, that's boy. Longest, the best na lang po. Hindi. Okay, hindi ko kayang mag-settle sa ganong ratio. Okay, guys, wala po kaming ituturo na ganon na longest, the best, ha? Okay, we still have to analyze the choices. Nagkataon lang po na siya yung pinakamahaba. Minsan merong, kung sino yung shortest, siya yung tamang sagot. Okay, balikan po natin yung number 80, may nagtatanong lang po. Kasi between meals naman, hindi with meals. Okay, consume liquids only between meals. Avoid highly seasoned foods. Avoid laying down right before eating. Eat small frequently. Uy, oo nga. Consume liquids only between meals. So, hindi during meals. Magkaiba yun, right? Tama ba? Okay. So, okay. Well, walang tamang sagot if that is the case. Kasi ang hinahanap natin is negative sign. Eh, lahat naman ito is tama. Right? So, bonus pa rin. Bonus pa rin siya. Okay? Bonus pa rin siya if that happens. Kasi tama rin pala, consume liquids only between meals. Okay? Ang mali lang guys, if kapag yung liquids na yon ay during meals, iniinom. Okay, with meals, yun yung bawal. Okay, kasi po, tataas din yung volume na present sa food, as a stomach. So, increase yung abdominal distension or yung stomach distension. So, kapag increase yung stomach distension natin, that would put more pressure sa lower esophageal sphincter. So, mag-i-increase din yung risk sa reflux. Okay, so bonus talaga. Itinakda ang tanong na ito para maging bonus. Okay? Sorry guys, and thank you kasi napansin ninyo. Okay? 80, that's bonus. 81, that's boy. Nung ako po ba yung nagre-review, binabasa ko po ba ulit yung rashes sa Rico's? Oo naman. Ito yung pinangkakapitan ko, guys. Yung mga rasyo. Okay. 82. After her duty hours, a milk company representative approached Ellie, offering her part-time job with them. Ellie turned down the offer because this is in conflict with her desire to promote breastfeeding. In addition, okay, Section 32 of Administrative Order, okay, sabi daw that letter boy provides that it is the primary responsibility of the health workers to promote, protect, and support breastfeeding. 82, letter boy. Okay. 82, letter boy. All the more that we have to be patient advocates in this kind of situation. Kapag nakita mo tong choice na to is silent about the matter, burahin mo yan sa paningin mo. Okay? Parang nabanggit ko na ata before na once you have your licenses, okay, it would amplify our voices to speak for the rest of the population, especially in the issues of our healthcare issues. Okay? So hindi tayo magiging tahimik lang. Okay, gamitin natin yung voice na yan to be a patient advocate. Okay, so 82, that's boy. 82, letter boy. 82, letter boy. If you are silent, you are siding the oppressors. May mga ganon tayong mga pinaniniwalaan, right? So 83, Ellie is very much aware that in the case of the newborn, within the first hour after birth, which is necessary, that's letter boy, immediate initiation of breastfeeding continued within 6 months up to 2 years and beyond. Okay, we know this, right? So 83, that's boy. 83, letter boy. Again, number 83. Letter boy, 84, soon after both mother and baby were settled in their hospital room, the pediatrician who is now in the hospital came to see the baby. Sabi niya daw, is there a standard milk formula the hospital prescribes or would want us to use? Nurse Ellie was quick to respond, I'm sorry, but shouldn't we be adhering to the National Milk Code Act of 2006 and Expanded Breastfeeding Act of 2009? Oh, pag sinabihan ka nito, guys, di ba? Ano pang laban mo? May batas siyang sinabi. That's letter boy, patient advocate and law-abiding practicing health worker. Okay, this is the kind of professional nurses that we aspire to be. Yung patient advocate. Okay, 84, that's boy. 84 is letter boy. Again, number 84, letter boy. 85, Ellie is aware that in accordance with RA 7600 of 1992, the purpose of the rooming in or twofold, actually word by word lifted po ito sa law natin. So that's number 1, encourage, protect, and support the practice of breastfeeding, as well as number 3, create an environment where basic physical, emotional, and psychological needs of mothers and infants are fulfilled. That's letter dog. 85, that's dog. Okay. 85, letter dog. Again, number 85, letter dog. One more. 85 is dog. 86, Phil, a 9-month-old infant, is admitted in the PD unit due to enlarged head circumference, bulging fontanelle, and sunset eyes. He is diagnosed to have hydrocephalus. So, i-highlight natin yung edad ni Phil. Okay. Anong meron sa kanya? Ito yung symptoms niyan. Hydrocephalus. Okay. Okay, Phil underwent ventricular peritoneal shunting. What is the best position for Phil post-operatively? Before we go further, let's talk a little bit about hydrocephalus. Okay, i-define lang natin, one word lang yan. Ano to? Excessive CSF in the ventricles, or pwede rin pong nasa subarachnoid spaces yan, right? Pwedeng sa ventricles, pwedeng subarachnoid spaces. Okay. Ano naman po yung purpose ng ventricular peritoneal shunting na yan? Okay, so yung excessive fluid natin from the ventricles, madidrain po yan papunta sa peritoneal cavity ni patient. Okay, so from ventricles, bumaba, peritoneal cavity, tapos yung tubig doon would further be reabsorb back to the systemic circulation. So yun yung way para mabawasan yung excessive CSF sa utak ni baby. Okay, here, kailangan din nating i-make sure yung continuous observation and monitoring because based sa growth and development ng infants, napakabilis po nilang humaba. Napakabilis nilang lumaki, right? So we have to make sure na same size or right size pa rin ng shunting yung ibibigay natin sa kanila because madedefeat po yung purpose kung umiksi. Okay, yung catheter na nilagay natin sa loob. Okay? The best answer for number 86 is letter apple, flat on bed. Okay? Actually, tama rin naman. Yung head is elevated, pero kasi napaka-vague ng elevated head. Okay, gaano ka-elevate? 90 degrees, 45 degrees? Kasi kung magsisettle tayo sa head of bed elevated, that's supposed to be 15 to 30 degrees lang. Okay, dapat low Fowlers lang yan. Right? So, mas safe isagot yung letter apple, flat on bed for the first 24 hours para lang maiwasan natin yung too rapid reduction ng CSF sa brain. Okay? So, 86, that's apple. Mari-reabsorb back in the systemic circulation once na nasa peritoneal cavity na po yung fluids. Okay? Same principle din naman kahit adolescent na yung patient. Okay? Ayaw lang natin na masyadong mabilis yung pag-drain ng fluids natin. Okay? Sabi po ni Sir Alpha P elevated. Yes, correct. Actually, I acknowledge that. Tama naman, head is elevated, 15 to 30 degrees. Pero kasi hindi niya sinabi dito kung gaano ka-elevated. Okay, medyo vague kasi siya. So, flat on bed tayo. Di ba may option na flat on bed, meron ding head is elevated. Dito tayo, letter apple. Okay. For the first 24 hours. Again, for the first 24 hours post-op. Okay, so 86, that's apple. 87, at 9 months old. Which of the following behaviors is indicative that his development is delayed? He can. Letter apple, sit with support. Okay? Kapag ang isang bata ay 9 months old na, diba? Expected natin that he or she can sit well without support. Pero kasi sa kanya with support pa rin. So 87, that's apple. Okay, 87, that's apple. Again, 87, apple. 88, the top priority in rendering nursing care to this patient is letter boy, monitor signs of increased ICP. Okay, monitor the signs of increased ICP. We have tense fontanelles, increasing head circumference. We could also have lethargy, irritability. Ano pa ba? Poor sucking ability. Yan, mga signs na increasing ICP. Okay. Pagpidya ang patient natin. 88, that's boy. 88, letter boy. Again, number 88, letter boy. One more. 88 is boy. 89, magnetic resonance imaging is done. Which of the following results does not confirm the diagnosis of hydrocephalus? That's C. Atrophied brain. Pag sabi mo atrophied brain, lumiit. Right? Meron po tayong hydrocephalus na case. So, dapat nag-enlarge yan. Kasi yung brain cavities, pati yung ventricles, may build up na CSF. So, 89, that's cat. Okay? Taking note of the word not. Okay, so, lagay natin dito negative sign. So, 89, that's cat. Again, number 89 is cat. Number 90, which of the following is not true about hydrocephalus? It is letter apple, disorder that occurs only at birth. Napakadaming word na nota in fairness. Ilagay mo dyan, negative sign. Okay? Meron tayong tinatawag na congenital hydrocephalus. Ibig sabihin, occurs at birth. Yung hydrocephalus na yon. Meron din naman tayong tinatawag na acquired hydrocephalus. At pag sinabi mo acquired hydrocephalus, it could be secondary to trauma or injuries. Okay? Pwedeng secondary to bleeding, or even tumors. Okay, so hindi po totoo yung letter apple. Number 90 is apple. Okay, number 90, apple. Again, number 90, that's apple. Number 90, that's letter apple. 91, Nurse Haley knows that structural scoliosis is not. Okay, structural scoliosis is not. So, i-highlight mo yan. Lagay tayo dito negative sign. Okay, when you say scoliosis, sa madaling salita, ano pala tandaan natin dyan? Curvature of the spine. Nag-curve po yung spine yan. Sumasayaw on its own. Okay, and when you say structural scoliosis, it is idiopathic. And when you say idiopathic, unknown origin. Okay, unknown origin. Personally, for me, yung word na idiopathic, isa sa mga napakalungkot na word sa mundo ng medicine. Di ba? Parang nagkaroon ka ng sakit, bakit? Wala lang, bigla na lang. Di ba? Yun yung concept ng idiopathic. Unknown yung origin yan. Okay? Pag structural scoliosis, it could be a damage to your vertebrae. Okay? You could have your primary lateral curvature with a compensatory second curve. So for example, you have a severe degree of your scoliosis. Okay? Yung primary curvature mo would be at the thoracic area. Okay? Tapos yung secondary curve mo would be at the lumbar area. Pwede yun. Okay? So, structural scoliosis is not letter dog compensatory mechanism in children who have unequal leg lengths and refractive errors because ang tawag po natin dito is functional scoliosis. Okay, so kapag sinabi mong functional scoliosis, secondary na lang siya, yung cause nun. Okay? For example, school-age child na napakabigat ng backpack, napakabibigat ng books na dala-dala niya. So additional pressure yun sa shoulders niya, magko-compensate yung spine. Magka-curve yan. Okay? So number 91, letter dog. If you have your structural scoliosis, you also have your functional scoliosis. Number 91, that's dog. Number 92, which is the following positions of the femur, is accurate in relation to the acetabulum in a child with congenital hip dislocation. Okay, congenital hip dislocation, that's letter dog, superior. Okay, superior. Number 92, that's letter dog. Again, okay, here is an example of your picture of your DDH or your hip dysplasia kung saan na-displace po palabas yung head of femur natin sa acetabulum. Sana po siya napunta superior or above it. Okay, ayan. Nasa taas siya, right? Kaya superior. So number 92, that's dog. Number 92, that's dog. Number 93, child with bilateral club feet is going home in corrective braces after having both casts removed. Nurse Haley is completing discharge teaching for the parents, which of the following is the highest priority. Okay? Sa kahit anong konsepto ng bracing, guys, the very purpose of the brace is to maintain, okay, the stability of that position para ganyan lang siya, hindi siya gagalaw. Okay? Very, very understandable if hindi sa buong 24 hours ay nakasuot yung braces, especially since from time to time, kailangan nating i-assess yung skin niyan. Okay? Kung meron na ba siyang impaired circulation or whatnot. Okay? So, the best answer is letter dog, increase the time of interval of wearing the braces and have the child wear them eventually as much as possible. Okay? 93, letter dog. For most hours of the day, kailangan sana nakasuot siya. Okay, 93, that's dog. 93, letter dog. Again, number 93, that's dog. 93, that's letter dog. 94, which of the following observations does Nurse Haley expect to see in her patient with thoracic scoliosis? Okay, pwede ka kasi magkaroon ng cervical scoliosis, pwede ring thoracic, pwede ring lumbar. Okay, that's letter dog. The patient's thoracic area is asymmetrical. Okay, hindi pantay. Okay, iba naman po yung konsepto ng letter boy. Sternum is protruding. Ano nang tawag mo dito? This one is serpectus carinatum. Okay, carinatum. Okay, nag-protrude siya palabas. Ang tawag po natin dito would be your pigeon chest. Pigeon chest. Okay. Iba rin naman yung pumasok sa loob. Okay, ang tawag naman natin dyan is pectus excavatum. Okay, wherein the sternum grow inward. Pumasok naman siya. Okay, these two concepts, magkaiba yan sa scoliosis. Okay, kasi kapag scolio, curvature of the spine. 94, that's dog. 94, letter dog. 95, 13-year-old female with structural scoliosis has Harrington rods inserted. Nurse Haley knows that the best position during the post-operative period is okay. Sige. Alam natin na wala pong cure ang scoliosis. Again, scoliosis has no cure, but it can be managed. Okay, ang pinaka-invasive management natin ng scoliosis is through your surgery wherein magpapasok po sila ng metal rods. Okay, attach na yun sa spine para as much as possible, yun po yung susundin niya to follow the midline position or the neutral position. Okay, in some cases, napaka-aggressive po ng scoliosis ng bata. Pumipiglas po yung rods na yon. Okay, bumabalik ko siya. Okay, so hindi siya all the time successful or hindi siya all the time effective. Okay? And after you place these Harrington rods, kailangan po nakasupine in bed si patient. Okay? Because in this kind of position, marireduce po natin yung pressure of the spine, okay, which could affect the stability of the spine. Okay, so number 95, that's cat. Number 95 is cat. Again, number 95 is cat. 96, aside from knowing the diseases which are currently included in the Philippine Newborn Screening Program, okay, it's about your inborn errors of metabolism. All of the following can trigger hemolysis in children with G6PD deficiency except. Okay? Except, guys, feeling ko sawang-sawa na kayong, okay, mabasa yung word na except. Okay, that's letter dog, junk foods. Okay, 96, that's dog. Ano yung pinaka-issue natin kapag G6PD deficiency yung pinag-uusapan? Diba? Kapag kulang ka daw sa enzyme na yan, basically, it would result to a premature destruction of your RBC. So yung main affectation talaga niyan, RBCs. Kaya ka po may hemolysis dito. Okay, dagdagan natin. Pwede ka rin magkaroon ng jaundice. You could also have splenomegaly. Ano pa ba? Aplastic crisis. Pwede rin. Okay, except letter dog, junk foods. 96, that's dog. 96, letter dog. 97, for newborns diagnosed with maple syrup urine disease. Which of the following vitamins should be increased in their diet? Okay, so i-highlight natin to, another example of your inborn error of metabolism in which, ano naman po ang problema? Diba? May defect ka sa metabolism na amino acids natin such as your leucine, okay, you also have your isoleucine, pati valine. Okay? At dahil nahihirapan po yung katawan na i-metabolize itong amino acids na to, magbi-build up lang po siya. Ano yung pinaka-complication natin kapag MSUD ang pinag-uusapan? Isoleucine. Okay? Mental retardation as well. So, i-modify po natin yung diet ni patient, taasan natin yung thiamine, at the same time, babaan natin yung levels ng amino acids na mga ito. Okay, so number 97, that's apple. Number 97, that's apple. Again, number 97, apple. 98, which of the following is recommended for newborns who are diagnosed with galactosemia? That's letter dog, soy-based formula. Okay, soy-based formula. Okay. Actually, kung gusto mo ng formula milk, meron tayong special na nire-recommend sa patients with galactosemia. Ang tawag natin doon is what you call your Nutramigen. Ganon, Nutramigen, guys. Formula milk ito, pwede mo siyang milk substitute sa infants with galactosemia. Okay? So, number 98, that's dog. Number 98, that's dog. Balik lang daw 96. That's dog. 96, that's dog. 96 is dog. Okay na po. 97, that's apple. 98 is dog. 99, inclines with PKU or phenylketonuria. At which developmental period would the dietary restrictions be easily applied? Be easily applied, guys. Okay, let's start them young. Okay, infancy period. 99, that's apple. As much as possible, gusto natin ng phenylalanine-free diet. Okay? Phenylalanine-free diet para maiwasan natin yung mental retardation or any other cerebral degeneration signs and symptoms. Okay? Mas madali po kasing mag-modify ng diet kapag infant period pa lang at mas madaling maagapan, 'di ba? To prevent the child from becoming cognitively challenged. So number 99, that's apple. Number 99, that's apple. 99, apple. Last number, 100. Which of the following food products should be eliminated in the diet of a child with phenylketonuria? That's cat. Milk. Okay? Wait lang, may nakalimutan ako. Gusto ko lang din i-share na meron din naman po tayong special milk na pine-prescribe sa kanila. Ang tawag po natin dito is Lofenalac. Yes, correct. Yan. Habol ko lang, Lofenalac. Very, very good. Okay, so number 99, that's apple. Number 100, that's milk. Okay. Questions. Are we clear so far? Yes, of course. Siyempre magbe-break tayo. If you don't have any questions yet, okay, let's take your 15 minutes break. On my clock, it's 3:45. So 4 o'clock, sakto. Okay, please enjoy your afternoon break, guys. Pahinga po muna kayo. Thank you so much. Thank you po. Okay, sige. So we're back now. Tapos na po natin yung NP3. That's 51 to 100. Let's go to NP4. But before anything else, I would like to tell you something. I would like to share with you the statement na pinaghahawakan ko rin, guys. Of course, if we have dreams, okay, we wouldn't want to rush the things that we want to last forever. Okay, ulit. We wouldn't want to rush the things that you want to last forever. Okay, so in the process of us taking our board exam for the license, gusto ko lang sabihin na inyo yan. Okay, yung blessing na yan, guys, may pangalan mo na, kukunin mo lang. Okay, kukunin mo na. Okay, it's meant to be you. Pero ang problema kasi minsan, sa sobrang excited natin to get this certain blessing, doon pa nagkakaroon ng problema. Minsan na over-excite tayo, guys. Anong nangyayari? Doon pa nagkakaroon ng doon ka pa matatalisod, guys. Okay? So, I think at this point in time, since March na po, tapos sa May na yung board exam, I would highly encourage you to, as much as possible, na binibilisan natin yung process as okay, kung kaya naman po to take it in a more gentle way, okay, we want to enjoy the process, okay lang yan. Okay? Please, please, please trust the process, guys. We'll get there, pero dito muna tayo. Okay? Sige po. NP4. Ganun pa rin. If you want or if you have any questions, please feel free to ask me. Okay? Para right then and there, maka-clarify natin. Okay? Number 1. Situation. Sophie is a married female who was admitted to the health psychiatric unit because of substance abuse. Which of these initial assessments would indicate presence of withdrawal? That's letter Apple, elevated vital signs and nervousness. Pili ko sawang-sawa na kayo sa question na to. Lagi siyang lumalabas. For some reason, number 1, that's Apple. Okay, number 1, that's letter Apple. Number 2, which of these medications will manage alcohol withdrawal? Okay, so please i-highlight natin alcohol withdrawal. That's letter dog, lorazepam, because benzodiazepine, drug of choice natin. Okay, asa dyan yung benzo? Letter dog, lorazepam. Okay, etong letter C, naloxone. Ito po yung ginagamit natin to manage opioid toxicity. Okay. Etong letter boy, disulfiram, baka lang po may sumagot ng disulfiram pero hindi po siya for the alcohol withdrawal. Ito po, if you want to maintain abstinence from alcohol. Okay? Kung baga kapag po inimom mo yung disulfiram along with the alcoholic agent, magkakaroon ka dyan ng reaction. Okay? Ang methadone naman, on the other hand, para sa naman to? If we want to maintain abstinence from your opiates. Okay, so number 2, that's dog. Lorazepam. Number 2, letter dog. Again, number 2, letter dog. Number 3. Sophie's spouse comes to you to tell you that he has to care for Sophie because the patient is in denial for substance abuse issues. Alam natin to, guys, pinaka-common na defense mechanisms for our alcoholic patients, denial. Nursing diagnosis was made. Ayun. Dysfunctional family processes, alcoholism related to codependency. Which goal would indicate an understanding of the current situation and the connection between the diagnosis and outcome? That's letter boy, Sophie's admission of being an alcoholic. Okay. Since alam naman natin ang defense mechanism ng mga alcoholic patients as denial, para masabi natin na na-overcome nila yon is kapag sila mismo may sariling recognition of the problem or the self-awareness is there. Okay, so number 3, that's boy. Number 2 is letter dog. Two, that's dog. Ito yon. 2, that's letter dog. Again, number 2, that's dog. Number 3, that's boy. Number 4, you are the nurse in the emergency room. 22-year-old May is brought in with an apparent head injury after being involved in a serious car accident. He is unconscious on arrival and exhibits signs of increasing ICP. Okay, highlight this one. i-highlight mo rin po yung profile ni patient, ano bang nangyari sa kanya. Number 4, you are aware that early indication of deterioration in the neurologic status of client is letter C, decrease in the level of consciousness. Okay, actually ito po talaga yung earliest sign, okay, of increasing ICP. Number 4, that's cat. Number 4, letter cat. Again, number 4, it's letter cat. Number 5, you position the patient. Which position would be most appropriate? That's apple. Elevate the head 30 to 45 degrees. Bakit po? To promote venous drainage. Okay, to promote your venous drainage. Ayaw rin natin na masyadong acutely flexed yung leg ni baby, ni patient. Okay, kasi mas tataas po lalo yung ICP niyan. Pati yung letter C tsaka dog. Number 5 is apple. Again, number 5, apple. Number 6, you assess the client frequently for signs of increasing ICP, which is letter dog, unequal pupil size. Anong tawag natin dito? May medical term tayo dito eh. That's AN. Anisocoria. Yon, anisocoria. So if you are suspecting for any possibility of increasing ICP, wag niyo po sanang kalimutan yung eye assessment natin, yung pupil assessment. Okay, it could be a sign as well. Number 6, that's dog. Number 6, letter dog. Again, number 6, letter dog. Number 7, you assess the client which of the following respiratory signs would indicate increasing ICP in the brainstem, that's letter dog. Slow irregular respiration. Okay, slow irregular respiration. This talks about the presence of your Cheyne-Stokes respiration. Cheyne-Stokes po ito. Okay, yeah, number 7, that's dog. Number 7, that's letter dog. 7, that's dog. Number 8, when a client arrives at the ER, which of the following should you consider priority care? Ito na nga pong sinasabi natin, babalik po tayo sa situation, apparent head injury, increasing ICP. So of course, protect the airway, letter C, establish an airway. Okay, priority, airway number 1. Okay, in this situation, airway number 1. Number 8, that's cat. Number 8, letter cat. Again, number 8 is letter cat. Number 8, that's cat. Number 9, a nurse in the hospital is teaching a new staff nurse about the guiding principles and policies of the PhilHealth. Which of the following are not included in the mandate and functions of PhilHealth? Okay, take note of the word not. Okay, palitan natin yung sagot. Gawin nating letter apple. Okay, so number 9, that's apple. Use services now, pay later. Okay, number 9, that's letter apple. Meron pong sariling website, yung function, yung PhilHealth, which specifically talks about the mandate and functions of PhilHealth. Okay, hindi natin mababasa yung letter apple. Okay, so number 9, that's apple. Ayan, pakitama na lang guys, ha, sa copy ninyo. Yes, pwede siyang under CHN concept. Okay, so number 9, that's apple. Again, 9 is letter apple. Number 10, the following diseases treated at the outpatient department are covered by PhilHealth except letter apple, cardiac diseases. Okay, 10 is apple. Number 11, which of the following PhilHealth benefit packages is not included in the case payment scheme? Again, with the word not. Okay, that's letter boy. PhilHealth, pneumonia, low risk. Okay, kapag po pneumonia, yung pinag-uusapan, actually kaya nilang i-cater yan. Pero hindi po low risk, moderate to high risk po yung kinikater nila. So number 11, that's boy. Okay, number 11, letter boy. Okay. Okay, number 11, that's boy. Number 12, Alexis, head nurse in the OB ward, is managing her staff and personnel. She must be guided by the principles of leadership and management. The following questions apply. The nurse entered the patient's room to perform tepid sponge bath. Patient refused the attempt, but the nurse responded, I need to bathe you, or else I will have to tie you down. Again, di ba, may pagbabanta pong nangyari dito. So anong klaseng tort ito? That's letter apple, assault. Okay. Ano ba yung keyword natin para masabi mong assault yan? Threatening of the patient. Okay. Paano naman po yung battery? Ano naman yung palatandaan natin dyan? Unconsented, unwarranted. Okay. Touching of the patient. Hindi naman nag-yes sa consent yung patient pero hinawakan mo pa rin. Battery yun. Or kapag tinutuo mo na sinabunutan mo yung patient or pinalo mo. Okay. Battery yun, guys. Okay. Ito po concept ng false imprisonment. For example, tinali mo yung patient without a doctor's order or hindi naman siya yung threat to public safety, tinali mo siya. Okay, false imprisonment yon. Okay, pwede rin naman, kunwari, ready to go home na sila pero hindi mo pinapauwi kasi meron silang unsettled bills. Okay, pwedeng false imprisonment yon, guys. In that certain case, anong gagawin natin doon? Papapirmahin mo lang po sila ng promissory note. Okay, pwede silang pauwiin. Basta merong promissory note. Okay, this one, itong letter dog, invasion of privacy. Okay, pwedeng invasion of privacy yung situation if number one, hindi ka naman directly involved sa care ni patient, pero sinilip mo yung genitalia niya o yung private parts niya. That's invasion of privacy. Okay, another example situation is, for example, admitted po sa ward ninyo yung kabit ng isang politician, guys. If you try to probe sa private life ni patient, invasion of privacy ang tawag doon. Okay, ayan. Number 12, that's assault. Number 12, that's assault. Number 10, what is your suggested answer for number 10? Ay, parang sa previous class, parang nagtanong din sila kung TB. Sige, i-confirm ko to, ha? Okay, pinark nga pala namin to. Okay, ipapadaan ko tong sagot sa question kay ma'am. Okay, confirm ko muna yung final answer. Okay, so feeling ko TB yung sagot, pero for now, cardiac diseases muna tayo. Park natin to. Okay, so here, pag po medical data, yung tinignan ni patient, hindi na po yun privacy, confidentiality na siya. Okay, yun yung pinagkaiba ng privacy tsaka confidentiality. Okay. All right, number 13. During a meeting with the staff, the head nurse involves the group in decision-making regarding the scheduling of ward classes. The group was divided into two decisions. What must the head nurse do? That's letter C, come out with a majority vote. Okay, majority vote tayo dito. Okay, hindi po applicable itong asking the groups to meet halfway, tsaka yung letter apple. Mas lalong hindi po pwede yung si head nurse na lang lagi yung magde-decide. So 13, that's cat. 13, letter cat. Number 14, according to RA 9173, the following are the guidelines to be observed by registered nurses except what? Again, very, very highly recommended, guys, na yung nursing law natin, please paki-memorize. At the same time, yung code of ethics, paki-memorize din po niyan. Okay? So, ang basis natin dito would be the code of ethics. Okay? Guidelines to be observed daw kasi. Except letter A, preserve life, respect human rights, and promote health environment because hindi po ito guidelines. Okay? Principles po ito. Okay? So, 14, apple. Okay, number 14, that's apple. 14 is letter apple. Again, 14 apple. Number 15. 15. The head nurse is starting quality improvement in their ward using the Six Sigma approach. What is the proper sequence to follow? Okay, so i-highlight natin to, Six Sigma approach. Okay, ito yung way na pwede natin gamitin to prioritize the problems. Okay, so unahin po natin yung number 2. Define, we would want to define the problem. So yung problem statement nandiyan, yung goal statement nandiyan. Okay? What else? Number 4, to measure. Gusto naman natin i-measure yung current process, okay? Through your data collection. Okay? So second. Number 3, analyze. Analyze the cause of the issues. Okay, number 4, that's to improve. We would want to improve our process. And lastly, to control. Okay, with regards to the concept of controlling, gusto nating i-refine yung bagong process na yon. Okay, tapos i-maintain that way. So, that's 24153. Okay, that's letter C. Number 15, letter K. Number 15, letter cat. Again, number 15, that's letter cat. Number 16, ISBAR is a verbal communication tool that provides a structured, orderly approach in providing accurate, relevant information in emergent patient situations and handoffs. Which of the following is not part of ISBAR? Hindi po kasama sa ISBAR. Bago natin malaman yan, okay, i-define muna natin ano ba yung ISBAR. That's introduction, situation, okay, background, assessment. Lastly, have your recommendation. Okay, asan po dyan yung hindi naman nabanggit? That's letter C, analysis. Okay, so number 16, letter C, analysis. Number 16, letter C, analysis. Pre-practice natin to guys no undergrad tayo. 'Di ba? Kung paano ba mag-ISBAR para hindi tayo mapapahiya kapag nag-refer kay doctor. Okay, may sistema kung paano magre-refer, kung paano kayo mag-uusap as a healthcare professional. Okay, so 16, that's cat. 16, letter cat. Number 17, nurse in the 5th Avenue Hospital is caring for an HIV positive patient. The patient is prescribed with zidovudine or retrovirr. Orally po itong ibinibigay. What should the nurse instruct the patient to do? That's letter D, a dog. Take the drug at specified intervals. Okay. Let's use an elimination method para iba naman. Okay, letter apple. Take the medication only with food. Actually, pwede mo po itong inumin with or without the food. So wala siyang regard sa food. Without regard to food. Okay, lie down after taking capsules. Mali po ito. Dapat po maintain upright. Okay, letter C. Instruct that with proper usage, it can cure the disease. Ano daw? It can cure the disease? Okay, wala pong cure ang HIV. Okay, number 17, that's dog. 17, letter dog. Again, number 17, that's dog. Number 18, what is the major problem the nurse should be cautious of when taking care of a patient taking zidovudine? That's letter C, side effects in taking the drug. Okay, ano ba yung mga possible side effects ng zidovudine? Number 1, anorexia. Nawawalan sila ng ganang kumain. Ano pa? Severe anemia. What else? Neutropenia, seizures, isama natin yan. Okay, so imagine, ito yung mga possible side effects. So all the more that we have to be cautious in giving this drug. Okay, so number 18, that's cat. Number 18, that's cat. Again, number 18, letter cat. 19, which among the following laboratory findings is the most significant in an HIV positive patient? Okay, that's letter apple. Decreased CD4 counts. Okay, so kapag ito po yung pinag-uusapan, i-clarify na rin natin at this point in time, ano po ba yung difference ng CD4 count, okay, sa viral load? Kasi they go together. Pwedeng dalawa silang pinaperform sa patient or kahit viral load lang. Okay, when you say CD4 count, basically, ito po yung amount of CD4 in the body. Okay, itong CD4 na to, component to ng immune system natin. Gusto natin na mataas yan, guys. So, the higher, the better. Okay, the higher, the better. Kasi the higher, mas protected tayo. Number 19, CD4 count, it's about the amount of CD4 in the body. What about viral load? Okay, kapag viral load naman ang pinag-uusapan, this is the amount of the HIV, okay, in the body. Ito yung amount ng virus na nasa loob ng katawan mo. Okay, so ibig sabihin, the lower, the better. Diba? To the point na undetectable. Okay, so number 19, ito yung difference ng CD4 count tsaka viral load. Pag CD4 count, the higher, the better. Pag viral load, the lower, the better. Okay, to the point na undetectable. So 19, that's apple. Correct. Kasi kapag undetectable siya, okay, untransmissible na rin. Correct. Very good. Okay. Actually, yung frequency in taking your zidovudine, depende yun sa doktor. Okay, kung gaano mo siya kadalas iinumin. Number 20, headache, impaired cognition and loss of vision or early manifestations of which of the following? Okay, it's not apple, AIDS. Ang AIDS, hindi po siya sakit. Again, AIDS is not a disease. It is a state or it is a condition. Okay, wherein the patient's CD4 count is less than 200 na lang. Napakababa. Okay? So, we can say na ito yung pinaka-severe immunocompromised state ng isang HIV patient natin. Okay? Sometimes, nag-overthink yung students kasi kaka-rationalize ng mga choices kung bakit siya yung maling sagot. Okay? I would like to tell you at this point in time na meron pong ibang choices na gawa-gawa lang ng BON. So please do not try so hard to rationalize. Okay? You might also want to explore the fact, okay, na meron mga choices na gawa-gawa lang. For example, letter dog. Wala namang ganyan. Okay? Hobby na mag-overthink. Okay? Kaya tayo tumatagal. Let's say, 2 hours lang yung allotted for 100 item pero na-stop ka sa number 20 kasi gusto mong patunayan further sa sarili mo na letter apple talaga yung sagot. Ganon. Okay? So 20, that's apple. Okay? 20, letter apple. Again, number 20 is apple. Number 21, the nurse came up with a nursing problem, imbalanced nutrition, less than body requirements. Her intervention for this would focus on letter dog, allowing the patient to have small meals evenly spread throughout the day. Okay? Less than body requirements. In the first place, isa po sa side effect ng zidovudine, we have your anorexia, right? Wala siyang ganang kumain. So all the more na kailangan small frequent feedings tayo dyan. Okay, so 21, that's dog. 21, letter dog. Again, number 21 is dog. 22. Which of the following suggestions should a nurse make to a known polysubstance abusing woman who is 18 weeks pregnant? 18 weeks pregnant, guys, polysubstance abuse. Okay, so sagutan po natin ito through the process of your elimination. If you cannot stop taking the drugs, you might consider terminating the pregnancy. O kung ayaw mo pala tumigil, magpa-abort ka na lang. Imaginein mo, guys, okay, sinabi mo yun sa pasyente, very, very non-therapeutic, right? So, X to. Hindi tayo ganyan nakipag-usap sa patient. Okay? Letter C, if you enter a drug treatment program now, your baby will be born healthy. Diba? How sure are you, right? Na kapag in-enroll mo yung sarili mo sa drug treatment, okay, magiging healthy si baby. False reassurance to, guys. Hindi po tayo nagbibigay ng false positive sa mga patient. Okay, so 22, letter C, X din yan. Okay, letter dog, it may not be possible for you to stop drugs completely, but you should consider limiting the drugs you use during pregnancy. For example, since polysubstance abusing woman daw siya, let's say tatlo yung iniinom niya or yung tinitake niya. We have your shabu, we have your marijuana, okay? Tapos yung isa po is alcohol. Okay? Sabi mo, you should consider limiting the drugs you use, okay? Baka naman pwedeng bawasan mo ng alcohol tsaka marijuana, okay? Magshabu ka na lang. Di ba? Ganun yung sinabi mo sa patient. Di ba? Very, very hindi rin siya therapeutic. Okay? And kahit ano naman pong substance yung iinumin or i-take ng patient, lagit-laging may risk po yan for teratogenic infections or complications. Okay? So letter boy talaga yung tamang sagot. You should stop using all drugs immediately before your baby develops birth defects. Tapos bigyan mo siya ng appropriate health education. If you keep taking shabu, ito yung mangyayari. If you keep taking alcohol, ito yung mangyayari. Okay? So 22, letter boy. 22, letter boy. Again, number 22, letter boy. Number 22, letter boy, binalikan ka ng patient. Sabi mo, kapag nag-enroll ako dito, magiging healthy si baby. Bakit ganito yung paa niya? Okay, mga ganun. Okay, wag kang ganun. Wag paasa. Okay, 23, what drug is given to maintain abstinence from opiates? Buti na lang guys, nasagutan na natin to. Let's letter boy, methadone. Okay, methadone. Pansin nyo, kapag psych drugs yung pinag-uusapan natin, same set of choices lang din naman yung binibigay nila. So you have to be sure, okay, na which is which drug is for which one. Parang ganun. Okay, so 23, that's boy. Okay, dyan ka lang naman malilito, iniiba-iba lang nila yan. 23, that's boy. Again, number 23, letter boy. 24. Sophie has completed 1 week of treatment for her alcohol dependency. She exclaims, I will not resort to alcohol drinking now, but there seems nothing left for me. How would you best respond? That's letter dog. What did your addiction mean to you emotionally? Okay. If you would try to explore yung mga theories kung bakit nagiging alcoholic yung patients natin, it is because they failed to make social attachments to other people or emotional attachment. So yung emotional attachment na yun, kanino niya dinikit? Okay? Sa alcohol mismo. Ngayon, tinanggal mo yung alcohol sa buhay niya. Okay? Syempre may void yun para sa kanya. Okay? So 24 letter dog, i-explore natin yung feeling na yun. Okay? 24 letter dog. Kinabisado ko lahat ng drugs na feeling ko lalabas. Okay, kinabisado ko lahat ng feeling ko lalabas. Okay, so 24 letter dog. The way I memorized for the drugs, sinabay ko siya sa mga MS topics or sa psych diseases. Okay? Okay, may nalito guys, may nalito. Balikan daw natin. Sabi niyo po kanina, yung opioid toxicity is naloxone. Correct. This one is for antidote of opioid toxicity. Okay, ang tinatanong kasi natin to maintain the abstinence from opiates. Okay, sober siya from the from the opiates. Ano daw yung ipapainom sa kanya? Methadone. Okay. Yan. Please do not be confused anymore. Okay. Tips po sa pag-review ng MedSurge. Yan. Maganda mag-aral ng MedSurge kasi I don't know, for me personally, I get lost whenever I study for these things. Siguro kasi gusto ko naman talaga siyang pag-aralan. Okay, so kapag nag-aaral po ako ng MedSurge, sa isang araw, let's say sabihin ko, respy ka lang today or cardio, wala nang iba. Okay, kailangan medyo hyper-focused ka sa isang concept para alam mo tumatak sa'yo. It's not really about the quantity, okay, of how much you review, but about the quality, okay, each day. Okay, hindi rin naman po pwede na sa isang week lang ay isang beses ka lang mag-aral or magbukas ng libro. Okay, dapat as often as possible, ini-immerse mo yung sarili mo sa mga concepts para lang, then ma-make sure mo na natural lang din siyang lalabas sa'yo. Okay, na ma-retain. Correct. Okay. Wag mo namang ipagkalat, guys. Nahihiya naman ako kapag sinasabi kong top 7 ako. Okay, so when we say abstinence, yung para matigil sa pag-abuse ng opiates, okay, sober na siya sa opiate, hindi na siya nagtitake. Para lang ma-maintain natin na hindi siya mag-take at all ulit. Ano yung ipapatake natin sa kanya? Methadone yan. Okay, so 23, that's boy. Kayo na yung susunod na magiging top-notcher, of course. Papasa na po namin sa inyo yung corona because you deserve it. Okay? Mag-review or mag-focus na isang topic per week or isang topic per day? Very, very good question. Again, ito po ay nire-recommend ko lang, hindi ko siya ini-impose na ito yung gawin nyo. Okay? Kasi iba-iba naman tayo ng circumstances, pati ng learning styles sa buhay. But I would highly recommend na isang topic per day. Let's say, MS lang ako ngayong Tuesday. Okay? Wednesday, OB Pedia. Thursday, Psych. Friday, CHN. Hindi ko siya pinagsasama-sama. Kasi na-try ko rin yung isang buong week CHN. Na-try ko yun the next week, puro psych lang. Hindi siya effective kasi nagiging complacent ako na Wednesday pa lang, tapos ko na siyang basahin. So, ang nangyayari, Thursday, Friday, Saturday, Sunday, nagdi-Netflix na lang ako, di na ako nag-aaral. So, dapat everyday. Okay, iba-ibang topic. Okay, para din makalkal mo mabuti yung brain mo. Okay? 24, that's dog. Last na muna to itong sasagutin ko Ano po yung vitamins na tinitake ko? Vitamin C lang, kasi ayokong magkasakit. Okay, tapos of course, vitamin E for the skin. Okay, tapos iron. Yan. Syempre naman, product ako ng Top Rank, guys. I'm a very, very proud product of Top Rank. Pure online po ako. Yan, pure online. Okay? Kayo guys, kung helpful sa inyo yung ginkgo biloba, G lang. G lang. Kape reveal. Wala po akong i-reveal kasi hindi po ako umiinom ng kape, guys. Ayun, that's the one weird thing about me. Pero kapag may nag-invite naman sa akin na mag-coffee, G lang. Pero on a regular basis, hindi ako nagka-coffee. Okay? Sige. 25. Sige, babalikan natin yung mga questions, guys. Mag-proceed muna tayo dito. Just keep the questions coming. Sagutan natin yan mamaya, okay? Sophie was admitted to the facility to treat her alcohol treatment. This was insisted by the spouse. During interview, Sophie tells you, I may drink every day, but my habit is controlled and non-destructive. You recognize this as denial of the current situation. How would you best respond? That's letter apple. What have been the negative consequences of your drinking? Because, as we know, denial na sila in the first place. So, kailangan nating iparealize sa kanila yung reality of the situation. Okay? 25, apple. 25, letter apple. Yes, reflection. 25 is apple. Number 26. Apparently, naulit na po. So that's letter boy. Sophie's admission of being an alcoholic. 26, that's boy. 26, letter boy. Again, 26, that's letter boy. Paano mo po nilalabanan yung antok? Ayoko kasing matalo, guys. Ayoko kasing bumagsak. So, kailangan ko to. So, labanan mo lang siya. Motivation. Yun lang. Okay. Adrenaline din, guys. Fear of failure. Charot. Okay. So, this one, 26, that's boy. 27. Which of these medications will manage alcohol withdrawal? That's letter dog. Lorazepam. 27, that's dog. 27, letter dog. 28, which of these initial assessments would indicate presence of withdrawal? Naulit na po ulit, that's apple. Elevated vital signs and nervousness. 28, that's apple. 29, a nurse is attempting other biobehavioral nursing interventions when taking care of her patients. Okay, kapag sinabi mong biobehavioral nursing intervention, these are the nursing interventions that you could do, okay, without the use of your medications. Okay, kasi kapag yan ay ginamitan mo na ng gamot or medications, hindi na po biobehavioral ang tawag dyan. Okay, pharmacologic intervention na po. Okay, some examples of your biobehavioral nursing interventions, we have your massage. You could also have your guided imagery, your music therapy, mga ganyan. Okay, the touch therapy, pwede rin yan. Use of touch as part of nursing care for geriatric patients is generally considered as therapeutic. Which of the following is true about the use of touch? That's letter C. Its effect is based on the individual preferences. Iba-iba naman tayo. Yung iba, ayaw talaga magpahawak at all. Okay, yung iba naman, love language nila yung physical touch. Okay, so iba-iba yan. Okay, depende yan sa bawat tao. 29, that's cat. 29, letter cat. Okay, 29, letter cat. Number 30, time travel is letter dog, ability that allows humans to be constantly aware of the past and the future and not only for recollection of past personal experiences. Okay, number 30, letter dog. If you would remember, meron po tayong isang question sa pre-intensive ratio wherein it also talks about the concept of your time traveling. Pero iba yung sagot natin doon. Right? Kasi kung babalikan po natin yung question na yon, naka-cluster din po siya sa isang situation wherein, okay, in-associate niya po yung time travel in the context of pain. Okay, so what I'm trying to tell you guys is kapag naka-encounter kayo ng similar concept, okay, or similar question, okay, just because parehas sila doesn't mean same answer na rin kayo. Kailangan pa rin pong i-analyze yung choices, Okay? Kasi dito ka pipili ng best answer. Huwag mo i-pattern yung sagot mo dito doon sa previous question na similar lang naman. Hindi naman exactly the same. Right? So 30, that's dog. 30, letter dog. Again, number 30, letter dog. Kung ano lang yung binigay na choices, doon ka lang mag-focus. Huwag ka nang maghanap ng wala. Okay? So 30, that's letter dog. 31. Nurse DT is a nurse for several clients in National Center for Mental Health. The following questions apply. A patient has just attempted to commit suicide by hanging. To prevent the patient from attempting this again, which of the following is appropriate for the nurse to do? That's letter apple. Ask a nurse to watch the patient constantly. Okay. I also remember a similar question like this one, pre-intensive din yon. Ako rin ata yung nag-ration nun, wherein, ganito rin naman po yung situation, commit suicide by hanging, ano na daw yung next best na gagawin. Okay? If you would notice, doon sa question na yon, okay, nag-cancel out kasi tayo ng choices. Letter apple, kailangan daw ng supervision ni nurse. Letter dog, kailangan din ng supervision ni nurse. According to our ratio before, similar choices, they cancel out. So, hindi natin siya pwedeng isagot. Now, ano na daw yung next best na pwedeng isagot? That's your seclusion room. Kaya sinagot natin nung time na yon, seclusion room. Okay? Kaya seclusion yung sagot natin last time. Okay? But this time, okay, meron ka kasing patient constantly at hindi mo siya, okay. Okay, sige, ulitin ko. Okay? Kasi I also remember that kind of question last time sa pre-intensive kung saan, okay, kung saan ang pinili po natin sa option is the seclusion room. Right? Pero this time, ang pinili po natin is to watch the patient constantly. Constant supervision kasi yung hinahabol natin na keyword dito or concept. Okay? Kasi doon sa previous question, nag-cancel kasi tayo ng choices. Dalawang choices nagsabi na kailangan mo daw siya ng constant supervision. Okay? Since hindi na natin sila pwedeng isagot dahil kinancel na natin sila, dahil similar choices, what is the next best answer? Kaya tayo nagsettle sa seclusion room. Okay? But in this kind of situation, hindi mo na naman yan pwedeng ma-cancel. So, siya naman talaga yung dapat na isasagot natin yung best answer, letter apple. Okay? And I would also like to share with you about the concept of seclusion. Okay? Medyo hindi natin ginagamit itong seclusion because meron siyang legal implications. Okay? Ano pa? As much as possible in the world of psych, guys, sa mundo po ng psych, gusto po natin mag-promote ng therapeutic environment, safe environment, at saka least restrictive environment. So medyo last option natin yung seclusion room. Okay? Okay? Next, to answer your question, hindi po ba dapat inconsistent checking? Tama na rin naman yung concept na nagets ninyo. Pero kasi for these kinds of patients who have a high potential for lethality, let's say, pwede niya ulitin at pwede niya ikamatay this time. Okay, so kailangan mo na ng constant supervision. Actually, the way that Videbek, yung reference natin, phrase this kind of explanation, sabi niya, institutional policies have different institution have different policies. Iba-iba po tayo ng protocols. But in a general sense, kapag meron kang mataas na potential for lethality at mamamatay si patient, constant supervision. But I do not invalidate yung concept na alam ninyo which is dapat irregular checks. Tama rin naman yun. Okay? Para hindi niya matimingan yung silip mo. Okay? Next question. Hindi po pa pareho yung safeguard the client sa nurse? Siyempre kasi nurse, we have a responsibility. It's our job. Okay? Sabi natin, kung kaya mo namang gawin on your own as an independent professional, huwag ka na magtawag ng ibang tao. Okay? So letter apple pa rin yung best answer dito. Okay? Okay na tayo dito, guys. Are we clear? Ayoko lang na may mami-misinterpret. Tapos sasabihin niyo, sabi po ni Ma'am JD, ganito yung sagot. Charot. Okay. Okay na ba? Okay tayo dito. Pero yon, constant supervision muna yung priority answer, tapos seclusion na. Kung hindi mo po pwedeng piliin yung constant supervision, mag-seclusion tayo. Okay. Yes. Nurse naman talaga, ask a nurse to watch the patient constantly. Si nurse ang magwa-watch kay patient. Alin yung uulitin ko, yung tatlo? Okay. Kasi sa mundo po ng psych, guys, for example, admitted po sila. Gusto natin mag-promote ng safe environment, therapeutic environment, tapos least restrictive environment. When you say seclusion kasi, of course, ihiwalay mo yan sa general patients natin. Okay, hindi natin siya masyadong ginagamit as an intervention. Especially, meron ding legal implications for that. Okay? Paano po yung interval sa constantly? When you say constant supervision, kailangan lang ma-make sure ni nurse na hindi siya mawawala sa paningin niya. Okay? Ayun. Okay? Alam ko na kung bakit kayo nalilito kasi gusto nyong ipagsama yung concept ng constant supervision tsaka yung irregular checks. Okay? Pag constant supervision, if a patient has high potential for lethality in relation to suicide, meron din naman tayong low potential for lethality. For example, iinom siya ng shampoo. Medyo relatively low potential yon, right? So pwede mo doon i-apply yung irregular checks natin. Okay? Yes, okay. Right, point din yon. Indication din po yung seclusion if threat to society or to other patients yung patient. Okay, kapag sobrang aggressive niya, pwede mo siyang ipasok sa seclusion room. Carrie? So 31, that's Apple. I hope we're clear now. I hope we're clear now here. Okay, sana hindi niyo po ma-misunderstood or misinterpret yung concepts. Huwag natin pagsama-samahin. Okay, so 31, that's Apple. 32, a client with diagnosis of antisocial personality disorder was given a 2-hour pass to leave the hospital. Okay, the client returned to the unit 15 minutes past curfew and did not sign in. The next day, this behavior is brought up in a group meeting. The client says, it's all the nurse's fault. The nurse was right here and did not remind me to sign. What is the best response by the nurse? Inhale, exhale. Okay? Gusto mo siyang tarayan pero therapeutic communication pa rin tayo. It is a responsibility to sign in when you returned from a pass. Especially, anong klaseng patient po ba meron tayo? Antisocial personality disorder. In the first place, they are rule breakers. Ano pa? They are manipulative. Ayaw nilang mag-take no responsibility. They would blame it with others. Okay? So 32, that's cat. Okay, ipa-reflect natin sa kanila yan. 32, that's letter cat. 32, letter cat. Again, 32, that's letter cat. Again, 32, that's cat. 33, a patient is experiencing acute dystonic reactions. All of the following PRN medications are prescribed. Which of the following medications should the nurse administer? The drug of choice for patients experiencing acute dystonic reaction is letter C, diphenhydramine. Okay, or Benadryl. Ito pong dystonic reaction, one of your extrapyramidal symptoms yan, or side effects. Marami kang pwedeng administer dyan. Okay, pero ang best choice kasi, letter C, diphen. Okay, 33, letter C. Apart from your, ay wala pa pala dito. So 33, that's cat. Okay, 33, that's letter cat. 34, you are an advocate for women's rights. You were invited as a resource speaker on violence against women and their children. Very, very interesting to learn about. The following questions relate to this. Which of the following should be the focus of care who are suspected to be abused, maltreated, or neglected? Ayan. The best answer is letter boy, immediate treatment of any injury because, again, pipili lang po tayo within the choices. Okay, and as we know, physiologic over psychosocial. Okay, physiologic over psychosocial. Okay, ito pong letter dog, preservation of evidence. Pwede mo itong isagot kapag ang patient natin is, let's say, sexually assaulted patient or rape patient. Okay, preservation of evidence yan. Pero kapag po abused or maltreated, letter boy. Number 34, that's boy. 34, letter boy. Sa pa po, 34, that's boy. 35, which of the following is the most common clinical manifestation of child neglect? Letter apple, malnutrition and dehydration. Guys, hindi ka na naawa kay Inigo, guys. Ginutom mo siya. And as we know, nutrition, one of the fundamental rights that should be given to our children, right? So 35, that's apple. 35, letter apple. 35, letter apple. So pag ginuto mo yung pasyente or yung bata, bakit? Diba? That's one of your responsibility as a parent. 35, that's apple. 34, boy. 34, boy. 35, apple. 36, the health worker's main concern when abused, maltreated, or neglected is suspected should be, letter dog, safety and welfare of the client. Okay? If you would notice, here, at this point in time, ang main concern natin would be safety. Ito naman na ngayon, yung number 1. Okay, it's not all the time airway number 1, guys. So please, please, please learn to prioritize. Okay, paki-analyze po carefully nung situation. Again, okay, i-contextualize natin yung sagot doon sa tanong. Okay, so 36, that's dog. 36, letter dog. Okay, 36, that's letter dog. Again, 36 is dog. 37, one of the violent acts is sexual violence. Which of the following does not constitute sexual violence? May word na naman na not, guys. At kahit nagsisigawan yung word na not, please, paki-highlight pa rin at maglagay ng negative sign. Believe me, guys, it's very, very easy to overlook because, okay, once you receive your questionnaire, napakapangit po nung font na ginamit ng BON, Diyos ko. Nagbayad tayo ng 900, tapos ganun yung itsura ng questionnaire. Okay, ang pangit na nga nung font, napakaliit pa nung font size. Okay, so please be extra alert sa actual board exam. Pwede po ba magdala ng highlighter? I think parang bawal ata. Parang ballpen and pencil lang ata. Pero paki-revisit po ng PRC guidelines, baka pwedeng magdala ng highlighter. Okay, dito guys, hina-highlight ko lang kasi hindi ko kayang bilugan or underline. Okay, pero po sa notes ninyo, paki-bilugan po or paki-underlinean. Okay, pwede po ba ang calculator sa board exam? Yes, pwede ang calculator, guys, as long as baliwala kasi yung dala mong calculator kung hindi mo alam yung formula mismo, guys. Okay, so pwede, wag lang po yung yung scientific calculator, dapat regular calculator lang. Pwede po bang sulatan yung questionnaire? Pwede, guys. Pwede mo ring i-flames yung sarili mo, pati yung crush mo, guys. Pwede magsulat sa questionnaire. Okay, basta you have to keep your answer sheet clean. Okay, kasi wala po silang spare dyan. Kapag po nabasa yung answer sheet ninyo, sayang. Okay, so 37, sagot natin is letter C, economic abuse, because magkaiba po yung sexual abuse sa economic abuse. Hindi mo siya pwedeng isubsume. Different topic yan. Okay, so 37, letter cat. Pwedeng sulatan ng formula. Ay, hindi, yung questionnaire, hindi yung calculator. Cheating na yan, guys. Cheating yan, not naman. Okay. Nagdala ng holder. Yun ang hindi ko na matandaan. Sorry guys, hindi ko na ma-memorize yung guidelines ng PRC. Pero paki-revisit na lang po ha. Especially baka updated na. Baka dati sa amin bawal pala magdala sa inyo, pwede na. Okay. So make sure lang na from time to time, bisitahin natin yung PRC website. Okay. So 37, that's cat. Yes, chine-check nila yung laman ng envelope. Okay, 38. Women and their children are protected against violence under this law. Okay, women and their children. So, anti-VAUSI po tayo dito. Okay, that's letter dog, 9262. That's anti-VAUSI Act. Okay. 7160. That's the local government code. Okay, letter boy. This one is your anti-rape law. Letter apple, this one is your child abuse law. Okay, very good. Yan, so 38, letter dog. Uy, ang gagaling ng iba dito sa mga law. In fairness, kaya pang isiksik sa brain cells. Okay, 38, that's dog. 39, Dylan is a 21-year-old volleyball varsity player in a leading university. He was admitted for eye trauma after a volleyball game. Okay, meron daw siyang bluish discoloration in his right eye. This condition is caused by, letter dog, rupture of a blood vessel in the conjunctiva. Okay, actually, ito po yung black eye na pinag-uusapan natin or nakikita natin. Okay, so 39, that's dog. 39, letter dog. Okay. Pwede po maghawak ng panyo habang nag-e-exam. Tissue swelling around the eye. Okay. Okay. Iba kasi yung swelling sa bleeding. Kaya ka may black eye, nag-bleed kasi siya sa loob. Okay, rupture of blood vessel, kaya siya nag-bleed sa black eye. Okay, 39 letter dog. Iba siya sa swelling. Okay, 38. This one, letter dog. "38" is letter dog. Okay. Let's take a look at number 34. Which one? So kapag sexual abuse na po yung pinag-usapan, ang priority na natin, letter dog, preservation of evidence. Okay? Ayan. Letter dog po. Carrie. Okay, where were we? 40. Potential result of blunt eye trauma is bleeding into the anterior chamber of the eye. This condition is termed as, letter boy, hyphema. Okay, so ito pong hyphema, okay, wherein may pooling of blood inside the anterior chamber of the eye of the patient. Okay. Ito yung itsura ng hyphema with your corresponding black eye. Ayan. Kaya siya nagkaroon ng ganitong kulay, syempre may bleed kasing nangyari. It's not only about the tissue swelling. Okay, so 40, that's boy. 40, letter boy. Again, number 40, letter boy. 41, which of the following is the priority nursing diagnosis for a patient with eye trauma? We're talking about the eye trauma. May injury pong nangyari. So, hindi po ito sensory issue. Okay, so hindi natin isasagot yung letter apple. At hindi rin tayo sasagot ng risk kasi may actual problem na nangyari. So, that's letter dog. Impaired tissue integrity, ocular. Although, minsan sa ibang mga eye injuries natin, may corresponding visual impairment na rin. Pero not all the time. Totoo yon. Okay, so 41, that's dog. 41, that's letter dog. Again, number 41, letter dog. 41, dog. 42, when teaching Dylan in relation to eye injuries, which of the following would be your focus? That's letter boy, prompt treatment of the injury. Okay, prompt treatment of the injury. This is one of the best examples where I could explain to you, okay, na meron tayong tinatawag na umbrella answer. Ganyan. Ito umbrella answer na to guys, napaka-encompassing ng choice na to na pwede mo isubsume underneath it yung mga ibang choices. Yung letter apple, cat and dog, pwedeng ipasok sa letter boy. Okay, yun yung umbrella answer. Okay. 42, that's boy. 42, letter boy. Again, number 42, that's boy. Number 43, another cause of eye trauma is chemical burn. Which of the following measures would you advise when it happens in the home, guys? Okay, so i-highlight mo to. Ano nangyari kay patient? Chemical burn. Saan nangyari? Yung pangyayari. Okay, home setting. Okay, again, sabi ko mag-highlight tayo ng mga bagay-bagay na pwedeng makatulong sa atin to find for the best answer. Okay, along with the patient profile, with the medical condition, with the signs and symptoms, nursing diagnosis, ano pa yung pwede nating i-highlight kung saan po nangyari or the setting. Okay, because let's say sa ER setting ito, iba yung intervention. Okay, kapag ICU setting, iba rin yung approach. Okay, all the more kapag sa bahay nangyari, kulang ka ng resources dyan. So pwede tayo mag-settle sa tap water lang, that's letter dog. 43, letter dog. Irrigate the affected eye with tap water. And when you say irrigate, guys, it has to be running water. Right? This should be at least 15 minutes. Tapos tsaka mo siya dalhin sa hospital. Okay? We make use for what we have according to the setting kung nasan tayo. Ideally, sana sa line. Right? Wala tayong sa line sa bahay So realistically speaking, tap water lang. Okay? Tapos tsaka mo siya dalhin sa hospital. 43, letter dog. Yes, standard yan. At least 15 minutes on running water. Okay? So yun yung importance kung bakit pati setting kailangan nating alamin. We make use for the resources that we have. Okay? So 43, that's dog. 43, letter dog. 44, you are a nurse in the psych ward caring for several patients. A patient expressed many physical complaints during the first 2 weeks on the alcohol rehabilitation unit. The result of the physical exam has been negative. Pero bakit? May nafe-feel pa rin si patient. Okay, so i-highlight natin ito. Physical complaints. I-highlight natin ito. Ayan. Ano pa? Okay, keep requesting for the medication of her discomfort based on the patient's behavior. Which of the following interpretations is correct? Anong tawag doon, guys? May psychologic or psychiatric term tayo for that eh. Meron kang physical symptoms, pero wala namang organic basis. Wala namang apparent medical condition. Letter S. Okay. Anong tawag natin dyan? Somatization. Correct. Somatization. It's letter boy. The patient is attempting to relieve the anxiety. Okay? So, yung mental anxiety mo nako-convert into bodily symptom. For example, magti-take ka na ng board exam, guys, nadjejebs ka tuloy. Okay, yun yun. Okay, ano pa? Magti-take ka na ng board exam, nasusuka ka tuloy. Mga ganon. So, 44, letter boy, nagsasomatize ka. 44, that's boy. Again, number 44, letter boy. Isa pa po, 44 is boy. 45, the client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? Okay, for me, napaka-fulfilling mag-duty sa psych ward kasi mas na-appreciate natin on how or why these patients behave or act like that. Okay? Kapag po meron tayong depressed patient, tapos kinausap mo, very, very understandable kung hindi siya magsasagot or kung hindi siya magre-reply sa'yo. Okay? Kasi wala nga siyang energy to do so. Okay? So, kahit naman na gano'n, na hindi siya sumagot sa'yo, meron ka pa rin naman pong intervention na pwedeng gawin, such as offering yourself, that's letter apple, I'll sit here with you for 15 minutes. Okay? So kahit umupo ka lang doon at hindi kayo mag-usap, okay, may effect din yun sa patient. Mafe-feel niya na, ay, okay, I'm worthy of his or her attention and time. Okay? Over time, okay, magbi-build kayo ng trust. Okay? Mag-i-increase rin po yung self-worth ni patient. Okay? So 45, letter apple. 45, that's letter apple. You offer yourself. 45, letter apple. Huwag mo i-expect na sasagot siya sa'yo. Unrealistic expectation yon, especially kapag depressed si patient. 45 is apple. 46. Oh, ako na hindi naka-experience mag-duty sa psych. It's okay, guys. Kung gusto mo mag-venture sa psych world, sa mundo ng psych, okay, mag-apply ka sa mga ospital na mayroong magagandang psych wards. Okay? 46. Keith spends most of the day lying in bed with the sheet pulled over his head. Which of the following approaches by Nurse Bong is most appropriate? Pwede siyang kausapin ng kausapin. I think, ito yon. Okay, ito yon. Pwede mo siyang kausapin ng kausapin, but not to the point na may irita naman siya sa'yo. I-pacing mo naman, okay, yung communication mo sa kanya or yung attempt mo to communicate. Okay? Here, in this situation, nakataklob lang daw siya ng kumot throughout the day. Okay, so ibig sabihin, ini-imply na ayaw niyang kumausap ng ibang tao. Again, patient pa rin natin siya. So we still have to do something about him. Okay? Letter boy, initiate contact with the client frequently. Okay? Pwedeng by the use of the touch. Okay? Sabihin mo, uy Keith, andito lang ako ha, nasa nurse's station lang ako. Okay? Or from time to time, sabi kasi initiate contact with the client frequently. Or, uy, Keith, kakain na tayo. Andito na yung pagkain mo. Or, uy, Keith, meron tayong activity sa kwarto na to. Gusto mo bang sumali? Mga ganon. 46, that's boy. Okay? Because even though na brief contact lang yan, okay, may effect pa rin yan sa kanya. Okay, of course yung trust nandyan. Eventually yung self-esteem tataas yan. Para ma-feel niya na di siya pinagpabayaan. Correct. 46, that's boy. 46, that's letter boy. Again, number 46, that's boy. 47, neuroleptic malignant syndrome is potentially lethal complication of treatment with antipsychotic drugs. Okay, which of the following manifestations should the nurse recognize as early sign of neuroleptic malignant syndrome? Another example of your extrapyramidal symptoms or side effect. Letter C, muscle stiffness. Okay, 47, that's cat, muscle stiffness. Along with your muscle stiffness, guys, kapag may neuroleptic malignant syndrome, anong meron? High fever. Ano pa? Autonomic instability, let's say hypertension, diaphoresis, pwede rin. Ay, baka di ko siya nasusulat. Hypertension, pwede rin po dyan yung diaphoresis. Delirium, pwede rin, pero hindi kasi siya early sign. Early sign yung hinahanap natin, muscle stiffness. Actually, palpitations, sige, palpitation. Kasama yan. 47, that's cat. Okay, 47, letter cat. Again, 47, letter cat. Once more, 47, cat. 48, the nurse provides information to a depressed patient and his family about ECT. Which of the following statements would the nurse include the teaching? So, i-highlight po natin ito, ECT. Letter dog, the patient must remain flat on his back for 1 hour after treatment. Bakit? Very, very high risk to injury, secondary to mild confusion and headache as your side effects. Okay? Para lang mas mapanatag ka na, uy, letter dog, isasagot ko self. Okay lang ba? Okay, so mag-process of elimination tayo dito. Letter apple, the patient will have a minimal muscle twitching. Kasi nungalingan, guys. Tonic-clonic nga po, di ba? Yung i-induce nating seizure. So, hindi lang yan minimal muscle twitching. Okay, the patient must be in restraints. Again, another lie, guys. Okay, mas prone yan sa injury kapag ni-restraints natin. Letter C, the patient will remain awake and alert during the treatment. Hindi nga po, nagsiseize nga siya, right? So letter dog talaga yung best answer. 48, letter dog. 48, that's letter dog. Again, number 48 is dog. One more, 48 is dog. 49, you are a staff nurse in the ortho unit of the Department of Surgery trying to do some research studies. Guys, research na guys. Okay, maging excited tayo sa research, guys. Yun din yung isang technique. Kahit naman na hindi mo favorite yung isang subject, pero dahil kailangan mo siyang aralin, okay, isipin mo na lang na favorite mo siya para magiging favorite ka rin niya. Okay, para magiging excited din siya sa'yo. Okay, 49, you are assisting. Favorite niyo for real. Oh, that's nice. Okay, you're assisting in a research study on assessing patient reactions to the use of new dressing material. Ayan na, si attorney naman na ngayon, yung mina-manifest natin ay medical student questions, the credibility of the nursing research. Your response would be, letter boy, nursing research is essential for the development of nursing science. Okay, again, kapag po, okay, kapag po nakita ninyo yung to keep quiet, okay, burahin mo sa paningin natin because nurses, we are not quiet with this one. Okay, passive response to, correct. Okay, so 49, that's boy. Again, number 49, that's letter boy. One more, 49 is boy. 50, which of the following research methods has for its purpose to describe social processes present within human interactions? Okay, ito po talaga yung description ng grounded theory, right? So number 50, that's boy. Number 50, that's letter boy. Okay. Itong phenomenological nursing research, basta makita mo lang yung lived experiences na keyword o kaya naman po meanings, okay, of experiences, yan yung isasagot natin. Okay. Kapag po participatory action research, ano to? Parang kopar lang to, guys. Okay, parang kopar lang to. Ito yung makikihalubilo ka sa participants mo to understand the social issues better. Okay, kapag sinabi mo namang case studies, ano naman to? In-depth. Ano pa? Multidisciplinary. Okay, na in-depth talaga. Malalimang discussion ng certain topic. Okay, so 50, that's boy. Grounded theory. 50 letter boy. Again, number 50, that's boy. Number 51, in the clinical question, is breastfeeding more effective in increasing the birth weight of preterm infant than adding corn oil to the infant formula? What is the intervention of interest? Okay. Kapag po pinapa-identify sa atin yung parts ng clinical question, ano yung acronym na kailangan nating matandaan? Ano yung acronym na kailangan mo ilapag dyan? Clinical question, yes. Okay, PICO. Okay. Magkaiba po yung clinical question sa research question lang. Kasi yung research question, yun yung alam nating usual research. Okay? Pero kapag clinical question, usually ang outcome nito would be evidence-based practice. Okay? Ito po ay kalimitang ginagamit kapag applied research yung gusto nating gamitin. Okay? And here, we have your PICO as your acronym, that's your population, intervention. Pag sinabi mong intervention, guys, that is the new treatment you want to prove effective. You want to prove effective. Okay, yung gusto mo patunayan. Okay? Of course, meron kang comparison dito. Ito naman po yung existing. Okay, o kaya yung traditional. What else? Letter O, outcome. Anong gusto mo mangyari out of your research? Okay? In this kind of clinical question, asan po dito yung population? Asan dyan yung population, guys? Asan dyan yung population? Yes. Okay, the preterm infants. What about the intervention? Asan dyan yung gusto mo namang patunayan? The breastfeeding. Very good. Which yun din yung tanong sa atin. Okay? What about the comparison? Comparison, yung existing na ginagamit, the corn oil. Okay? Lastly, outcome is letter boy, increasing the birth weight. Okay? Very, very, very good. Once na alam mo po yung mnemonic or yung acronym, hindi ka naman na malilito kapag clinical question yung pinag-uusapan. Okay? So 51, that's apple. Again, number 51, that's apple. Number 52, in a research question, what is the relationship between wound healing and nutrition among elderly patient with hip surgery? Which one is the dependent variable? Okay, kapag po parts naman no research question yung pinag-uusapan, ano naman po yung acronym natin for that? Okay, PEERD naman na. Very, very, very good. Okay, that's your PEERD. So PEERD stands for your population. May population ka pa rin dyan. Okay, now you have your independent variable, then your relationship, and then your dependent variable. Okay? Ang tinatanong sa atin is dependent. Asan muna yung independent variable dito? When you say independent variable, ito yung binabago natin, right? Yung minamanipulate natin, tapos i-check natin yung effect doon sa dependent variable. Okay? All right. That's your nutrition, independent variable. Ano effect kapag tinaasan ko or binabaan yung nutrition? Right? So wound healing becomes your dependent variable. Okay, so 52, that's boy. 52, that's letter boy. Again, number 52, that's boy. Balik lang daw po 51. Okay, 52, that's boy. 53, Luke is an 11-year-old grade 4 pupil in a private school was diagnosed to have ADHD, attention deficit hyperactivity disorder. Which of the following is not a main characteristic of ADHD, guys? Not a main characteristic. So, negative sign na naman tayo dito. That's letter apple, passivity. Okay. The rest of the choices, ito po actually yung key features ng patients natin with ADHD. Okay, 53, that's apple. 53, letter apple. 53, that's letter apple. Na-imagine nyo ba ako, guys, nung ako yung nagre-review, gentong-gento rin ako. Nababaliw na. 54, his teacher has observed Luke to have difficulty waiting for his tutor, often batting into conversations and blurts out answers without waiting for questions to be finished. These are manifestations of. Okay, so here, i-describe po natin, okay, anong tinutukoy niyan? Let's letter dog, impulsivity. Okay, impulsivity. When you say impulsivity, actions ka lang, no actions. Hindi mo pinag-iisipan yung consequences ng ginagawa mo. Okay, that's you being impulsive. Okay, when you say hyperactivity, literal, hyperactive ka dyan. You want to move constantly. Okay, for example, kapag yung keyword mo dyan, fidgeting, tapping, pwede rin. Tapping of the shoes. Okay, ano pa? Excessively talking could be hyperactivity. Okay? When you say inattention, it means medyo reduced yung ability mo to focus. You tend to wander off from one task to another. For example, si bata, inutusan mong magtapon ng basura. Okay, sa labas ng bahay niya. Okay, inutusan mo siya magtapon ng basura sa labas ng bahay niyo. Apparently, nung nasa bakura na siya, nakita niya yung luma niyang laruan. Okay, nakita niya yung luma niyang laruan, nasira na daw. So inayos niya guys, nakalimutan niya na magtatapon pala siya ng basura. That's what you call your inattention. Okay. 54, sabi daw dito is sabat siya ng sabat. It's letter dog, impulsivity. 54 is dog. Again, 54 letter dog. One more, 54, that's letter dog. 55, Lily is a 7-year-old grade 1 kid diagnosed with ADHD. Manifestations of ADHD are usually identified in what situation or event when a child is letter C, enrolled in the education system. Okay, kaya po kapag ADHD ang pinag-uusapan, usually around preschool to school age, nada-diagnose ito. Okay? Kailangan mo muna kasing ipasok siya sa isang sistema para mas lilitaw yung features niya. Kailangan mo rin siyang ihalo sa ibang students para lang malaman mo na, uy, ito yung nangyayari sa kanya at hindi niya ito plain personality. Okay? So 55, that's cat. 55, letter cat. Again, number 55, letter cat. 56, the school nurse reports that Lily frequently exhibits the following behavioral manifestations of ADHD, except. Okay, may word na except. So yung walang katotohanan daw, yung sasabihin natin or isasagot natin, that's letter dog, incorrect and messy word. Okay, just because they are experiencing inattention, hyperactivity, and impulsivity doesn't mean hindi na po sila nakaka-produce ng magandang output. Okay? In fact, guys, sa mundo po ng fashion, okay? Sa fashion industry, guys, marami pong mga ADHD na fashion designers. Napakagaganda ng gawa nila. Okay, so sila yung concrete example. So just because may ADHD ka, doesn't mean pangit yung gawa mo. Okay, so 55, that's cat. 54, that's dog. 54, dog. 56, that's dog. Okay. Pwede po ba silang maging moody? Yung mga patients with ADHD? Yes, pwede rin. Diba? Meron silang impulsivity. Okay? They have difficulty expressing their emotions. So, mafu-frustrate sila, guys. Magiging moody na lang sila. Okay? So, 56, that's dog. 56, letter dog. 57, Lily tells the nurse, I don't have friends because I'm stupid. Which of the following nursing diagnosis would the nurse identify for him? Obviously, lalaki pala si Lily apparently. Okay, let's letter dog, low self-esteem. Okay, low self-esteem. Okay, self-esteem by its definition, okay, mababa po yung pagtingin ninyo sa sarili nyo. Okay, mababa rin yung way ng pag-value mo sa sarili ninyo. And if you are feeling this one, itong low self-esteem, while you are studying for the board exam, okay, it is very, very well acknowledged and well validated, and sobrang hindi mo naman may iwasan na ma-feel yan, guys. Okay, so what you want to do is to take a step back. Okay, you would want to have your own self-awareness and to reflect on yourself. Okay, and also, you are worth it. Okay, you are worth it and you deserve it. Okay, so 57, that's letter dog. 57, letter dog. Mahirap kasing paniwalaan na mahal ka ng ibang tao kung ikaw mismo ay hindi mo mahal yung sarili mo. Kasi maapektuhan din yung the way you think about the other people towards you. That's the concept of your self-esteem. Okay, so 57, that's dog. 57, letter dog. Okay, 57, letter dog. 58. Nurse expects Lily to have an impaired social interaction as the child exhibits excessive talking, short attention span, and low frustration tolerance, which of the following interventions is not useful in his case. Given, okay, na may ganito siya guys. Okay, wait lang, highlight natin. Let's letter dog, give complex tasks at the same time. Mas lalong wala naman siya matatapos kapag isang bagsakan mong binigay yung tasks niya. Okay? So mas okay po sana kapag simple tasks, one at a time na lang. Okay? So paisa-isa lang. 58, let's dog. 58, letter dog. Again, 58, letter dog. 59, situation, Nurse Claire wants to improve in her care for patient Phil, who is an alcoholic. She asks help from her head nurse, Gloria. Claire goes to Phil's bedside to greet him. Gloria corrects Claire of greeting which is not appropriate to Phil. Okay, mali na naman guys yung hahanapin natin. Again, sana hindi kayo magsawang maghanap ng mga mali. Let's letter apple. Hi Phil, so you got drunk last night. Okay, sa Tagalog, hi Phil, so nalasing ka na naman, lasinggero ka talaga. Okay, it's very, very judgmental, guys. It's very, very aggressive statement. It's very, very non-therapeutic. Kaya po siya yung sagot. Okay, 59, that's apple. The rest, it was said in a, let's say, general statement. Okay, wala naman siyang challenging statements na sinabi dito. How was your drinking affair last night? So, kamusta naman yung inuman ninyo? Okay, hindi naman siya threatening sa patient, right? Ayan. Unlike letter apple, once na binitaw mo yung word na drunk, medyo may connotation na tayo dyan. Okay, so 59, that's apple. 59, that's letter apple. Again, number 59 is apple. Number 60. Phil turned his back away from Nurse Claire, saying, "It's none of your business, you ugly duckling." The appropriate response of Nurse Claire would be, "Ang tagal kong binild pabalik yung self-esteem ko. Tapos sasabihin mo lang na ugly duckling ako?" Okay. Letter dog. I don't think you mean what you have just said, do you? Ganun. Okay. Tiisin mo guys, wag mo siyang patulan. Therapeutic communication pa rin tayo dito. 60 letter dog. You beast, you're as ugly as I am. Diba? Tapos bumagsak na naman yung self-esteem ko. Nagkulong na naman ako sa kwarto. Okay. Sa loob-loob mo, letter boy talaga yung gusto mong isagot. Are we curious so far? Do you have any questions so far? Okay. Sige, I'll give you your 5 minutes break lang. Toilet break, water break, rest your eyes break. Okay. I'll be here for you guys. Hintayin ko kayo. Okay. So 5 minutes lang ha. 5:25 continue tayo. Okay. Thank you so much po. Ano pong tips para makapasok sa top 10? Okay. Ano bang tips para makapasok sa top 10? Actually, napaka-general question yan. And my general answer would be, first one, you have to have your self-confidence kasi walang maniniwala na ibang tao kung ikaw mismo hindi mo pinapaniwalaan na kaya mong ma-belong sa top 10. Okay, I think the next tip that I would like to share with your advice is wag mong tigilan. Okay, wag mong tigilan. Ikaw lang din naman yung makaka-assess kung enough na ba yung preparation mo. Ngayon, kung feel mo na kulang pa, just keep going. Okay, if you're tired, magpahinga. Kasi mas counterproductive yung pinipilit mo na lang mag-aral, guys. Kung wala ka sa mood, ito yung wag. Ito itulog mo na lang. 'Di ba? Masayang kasi kapag nagsasayang tayo ng panahon tsaka no energy kapag nagpapanggap lang tayong mag-aral. Kung wala ka sa mood, for me, hindi ko sinasabi na ano, I mean, I do not want to impose things, pero shini-share ko lang yung akin. Okay, ano po yung routine ko pag magre-review? Yun nga po, since ayoko na kasi nung paulit-ulit, ayoko nang panoorin yung recorded video. So, yung buong umaga sa top rank yun. Tapos yung sa gabi, oras ko siya. Okay, so natutulog ako after dinner, let's say 8 to 9 tulog ako, 10 o'clock to 4 a.m., yun na yung sarili kong oras. Okay? Andito yung notes ko ng top rank, andito rin yung iba pang references. Okay? Siguro, kaya nabibigla yung ibang tao kapag sinasabi ko na nabasa ko lahat ng references. Siguro kasi associated dun yung decreased amount of my hours of sleep. Okay, yun talaga yung pinaka nag-suffer or na-sacrifice ko, yung tulog. Pero worth it naman siya sa dulo. Okay? Kailangan ba mag-pull na all-nighter? Yun yung technique ko. Wala akong choice eh. Kasi let's say 7 to 8 p.m. top rank. So saan pa ako mag-aaral on my own? Eh hindi naman sapat na umasa lang ako sa top rank. Kailangan ko rin, alam mo yon, kailangan ko rin mag-aral on my own. Ayan. So, yun din yung gagawin nyo, guys. Ano po, meron with the coaching with the icons, guys. Sali kayo. Coaching with the icons. Kasi yung mga authors ng libro, guys, mami-meet nyo sila via dito sa Zoom. Sayang hindi face-to-face. Ganon din kami. Zoom lang din naman. Pero it also increase in our confidence in passing and even topping the board exam. Meron mga certain information na sa kanila ko lang talaga natutunan or natutukan, aralin, at may lumabas. Guys, yun eh, may lumabas, guys. So I highly encourage you to attend the coaching with icons if you have time. Okay? May mapupulot po tayo dyan. Hindi lang yung information per se, pati yung knowledge, pati yung motivation to pass and be like them in the future. Okay? Ayan. So, wala kang 8 hours na tulog. Depende yan sa araw. Kasi sa study plan ko, 7 days, yung isang araw doon, non-negotiable, matutulog ako o rest day ko yan. Okay? Carry na. Okay. Sige. Okay. Kaya-kaya niyo yan, guys. Kayo pa ba? Okay. So, number 60, that's dog. Yan ba yung coaching of the icon na days? Hindi ko na matandaan. Sorry, guys. Ayan. So, 60, that's dog. 61, you are a staff nurse in a government hospital being transferred to psych unit. You were required to equip yourself by attending the enhancement program on crisis intervention to assess your knowledge and skills. You were given a pre-test. Okay? The main objective of crisis intervention is to, letter C, return the person to the root of the crisis to identify the cause. Okay? Ang word-by-word definition po talaga ng crisis intervention or goal ng crisis intervention is the resolution of an immediate crisis. Okay, resolution of an immediate crisis. Kapag po nagbasa kayo ng references, such as this one, resolution of an immediate crisis, tapos hindi nyo siya actual na nakita sa board exam, okay lang yun, guys. Because sometimes the BUN would use different wordings, would use different words to confuse you. Okay, but I hope meron po kayo enough analysis to realize na ay, same lang din naman yung sinasabi. Same lang din naman yung essence ng statement. So yun na yung pipiliin natin. Okay, ito pong letter dog, eliminate the stressor. Medyo imposible po ito mangyari because as we know, we can never really eliminate our stressors. Laging meron yan. Okay, so instead of eliminating, siguro dapat ang ginamit nila is reducing the stressors. Okay? Ito pong letter boy, ensure the patient's safety. Marami po kasi tayong iba't ibang klase ng crisis. Let's say midlife crisis or quarter life crisis. Diba, hindi naman compromised yung safety natin doon. So it's not all the time applicable. Okay, so 61, that's cat. 61, letter cat. Again, number 61, that's cat. 62, which of the following is not an assumption in the concept of crisis? Not an assumption. So, negative sign na naman tayo dito. Letter C, crisis is a growth retarding factor to the emotional development of a person. Medyo may kasinungalingan po itong statement nito. Bakit po? Kulang. Yung sinabi niya, very, very limited. It's not only growth retarding. Actually, once na ma-overcome mo yung crisis sa buhay mo, okay, you could even go out of it as a bigger and better person. Hindi siya pang growth retarding lang. Okay, 62, letter C. Yan yung minsan kinakaption nga natin yan sa Facebook posts natin eh. Okay? Bigger and better person this 2023. Mga ganon. 2022, pinahirapan mo ko. This 2023, ganon. Anyway, 62, that's cat. 62, that's cat. Naloloka na ako dito, guys. Okay, this is my year. Ganon. 63. Which of the following nursing interventions is the most appropriate for a client who is in the early state of crisis? Okay. Okay. Gusto ko rin po kayong i-remind na kapag po nag-highlight tayo ng mga keywords, you have to make sure na tama at kumpleto yung i-highlight natin. Taking note of the word early state. Okay, so here the best answer is letter apple. Encourage client to express feeling and emotions related to crisis. Okay, verbalization tayo dito. Okay, 63, that's apple. You require client to be actively involved. That's a very, very heavy word. Okay, especially nasa crisis state siya. Okay. Development of insight, hindi siya early state. Evaluate the situation, hindi na siya early state. 63, that's apple. 63 is apple. Again, number 63, that's apple. 64, a crisis that is acute but temporary and due to external source, it's letter dog, dispositional. Okay, itong dispositional, ito yung mga examples na short-term crisis natin. For example, pumasa ka po sa board exam and apparently nag-top ka pa, guys. Okay, so ang dami mong offers, kaliwat kanan may offer ka. Ngayon, nagka-crisis ka tuloy. Okay, ano bang pipiliin ko dito? DOH ba? Or academe ba? Or ano ba? OB ba yung field ko? Mga ganyan. Okay, that's your dispositional. Okay, kapag sinabi mong traumatic crisis, of course, yung nag-traumatize sa'yo, let's say rape or murder, yung mga crimes. Okay, when you say transitional crisis, this has something to do with your life stages. Okay, pero kasi ang pinaka-example nito or isang example nito would be, for example, kayo, from student nurse, magiging registered nurse ka. Okay, transition mo yon, right? Student nurse to registered nurse. Pero, for now, may crisis ka sa ngayon. Okay, board exam. Okay, yun yung transitional crisis mo. Okay, ang developmental crisis naman, on the other hand, expected na mafe-feel mo yan. Okay, along your different life stages. So, let's say, from teenager to young adult, mga ganyan. Okay? Yung marriage, another example of your developmental crisis. Okay? Having a baby, developmental crisis thing. Okay? So 64, that's dog. Again, 64, letter dog. 64 is dog. 65, Alex is a staff nurse in the psych ward of Hospital Cabo. The following questions apply. OCD is characterized by recurrent unwanted thoughts which lead to ritualistic and repetitive behaviors. Which of the following medications is appropriate for OCD? Okay? Alam niyo, feeling ko mas magaling na kayo dito. Nagkasawa na ata kayo sa concept ng OCD. Okay, that's letter dog, clomipramine. 65, letter dog, clomipramine. Marami rin naman tayong mga meds na pwedeng administer sa patients with OCD, one of which is your clomipramine. Benzopediren. Okay, 65, letter dog. 65, dog. 66, which of the following sets of symptoms is characteristic of generalized anxiety disorder? That's letter apple, uncontrollable worrying, significant distress, or impaired social functioning for at least 6 months. Ganun lang talaga guys. Nagbigay sila ng term. Hahanapin mo sa choices ngayon. Ano bang ibig sabihin yan? Okay? Itong letter boy, intense fear and helplessness within 1 month. Okay? Bago pa lang kasi, ang tawag natin dito is acute stress disorder. Okay? Ito po, letter cat, you're experiencing extremely traumatic event. Okay? Ito pa lang ang nabasa mo, PTSD na yan. Okay, letter dog, significant anxiety provoked by specific feared object or a situation. Yes, correct. Okay, this one is a specific anxiety. Okay, or phobia. Okay, 66. Letter apple, correct. Okay, 66, that's apple. Post-traumatic, sulat natin, that's post-traumatic stress disorder. Kunwari, nanakawan ka sa isang kanto, na-trauma ka guys, napapanaginipan mo, may flashbacks even. Okay, at ayaw mo na rin dumaan sa kanto na yon. Yun yung PTSD. Okay, or na-trauma ka sa college life mo, pwede rin. Ayan. Okay, so 66, that's apple. 66, letter apple. 65 po, that's dog. Okay, 65 po, that's letter dog. 66, that's apple. Paano po ako nag-aral ng pharma? Nakakasira po talaga ng bait kapag yung actual drug book or handbook yung aralin natin. So ano po ito? Depende nyo po sa MS topics. Okay, so for example, respy ka ngayon, isama mo na lahat ng respy drugs. For example, neuro ka, di lahat ng mga naisip nating neuro, meds, mga ganon. Ika-cluster natin yung pag-aaral ng pharma, hindi yung isang bagsakang pharma day. Okay? Baka hindi ka na makaabot sa board exam, 0.5 na lang yung brain cell mo. Okay? Kalahati na lang. 67, a schizophrenic patient says to a nurse, "You are wearing a pretty red dress. Tomatoes are red, vegetables make you healthy. I am not healthy." A nurse should recognize that these statements are an example of letter dog, looseness of association. Okay? Etong letter apple, echolalia. Alam natin na this one is repetition of words. Kaninong words? Kaninong words to guys? Okay, sabihin niya sa'yo, kumain ka na ba? Okay, sabihin niya na sa'yo, kumain ka na ba? Okay, ulit-ulitin niya lang yung words mo, others words. Okay? On the other hand, kapag po palilalya, ang na-encounter natin, still, repetition pa rin po ito. Yes, ang galing-galing nyo talaga. Okay? Repetition of own words yan. Kailangan pa ba ako dito, guys? Okay. Okay? Next one. Kapag naman po, ecopraxia. Yan, ecopraxia. Repetition pa rin. Pero ano na po yung inuulit niya? Oh, others actions. Actions naman or movements. Very, very, very good. Lahatin na natin. Pag neologism naman ang pinag-uusapan, formation of new words. Okay? Kapag confabulation, creation of false memories. Mga bata ni Sir Ken, ang gagaling sa psych. Okay, 67, that's dog. I-manifest na rin natin yung mga professors natin sa top rank, sa actual board exam. Sir Ken, dito ka. Okay, Sir Raymond, dito yung position mo. Okay, attorney, dyan ka ha. Okay, kapag may Palmer questions, okay, ikaw yung itatap ko. Sir Archie, andito ka. Ganon. Okay, 67, that's dog. 67, that's letter dog. 67, that's dog. Number 68, a male patient's yearly laboratory screening reveals an elevated serum prostate-specific antigen. This one is an example of a tumor marker. Sa kanya daw mataas. To which of the following nursing diagnosis should a nurse give priority for this patient? That's letter C, anxiety. Okay. Actually, kahit ano naman po yung diagnosis na ma-receive natin from the doctor, it could induce anxiety, right? Fear of the unknown yan. Okay? In this case, kapag mataas yung PSA level, ano meron siya? BPH or prostate cancer? Mamamatay ba ako dito? Mga ganyan. Okay? 68, that's cat. 68, letter cat. Again, number 68, letter cat. Number 69, which of the following actions should a nurse take when making the first contact with a paranoid patient? Parang may master's degree na tayo on how to handle paranoid patients. That's letter apple. Introduce self and avoid touching the patient. Baka kasi mag-agit yan. Okay, ma-misinterpret niya yung touch mo. 69, that's apple. 69, letter apple. Again, 69 apple. Number 70, the outcome. That would be most appropriate for the patient who has a diagnosis of agoraphobia would be that the patient will. Okay, bago tayo pumunta sa choices, again, magde-define po muna tayo dito. Ano bang ibig sabihin na agoraphobia na yan? Ay, sige, kukwento ko yung story mamaya. Okay? Pag agoraphobia, ano yan? Fear of what? I'm such a proud mama talaga. Walang nagkakamali. Open spaces, crowded areas. Sulat natin, crowded areas. Okay? Public places. Pwede. Ganyan. Now, paano daw natin malalaman na na-overcome niya tong fear na to? Okay, letter apple, go shopping in town. Okay, inescapable places. Sa place na feeling niya may hirapan siya mag-escape. Okay, pwede yan. Okay, 70, that's apple. 70, letter apple. Again, number 70 is apple. 71. Cameron is a new staff nurse in a psych ward reviewing the guidelines and ethical principles. Which of the following long-term goals is appropriate for this client? That's letter boy. Become involved in activities that foster social relationships. Especially since alam po natin na yung mga psych patients natin, they tend to have impaired social interaction. Okay, so 71, letter boy. 71, that's boy. Again, number 71, boy. 72, the client makes an inappropriate and reasonable report to you. Which of the following principles of good communication skill is important for you to use? Letter C, tell the client that you do not share this interpretation. If, for example, meron siyang delusion, wag mo i-feed. Okay, i-present mo yung reality. 72, that's cat. Okay, 72, letter cat. Confronting the patient. Do we do that? Di ba? Hindi naman. Okay, challenging the patient. Okay, do we also do that? Okay, ang sagot po natin ay just don't. Okay, confront, challenge the patient, just don't. It's very, very non-therapeutic. Okay, 72, that's cat. 72, letter cat. Again, number 72, letter cat. Isa pa po, 72, letter cat. When you use your logic kasi, feeling ng patient, china-challenge mo siya. Okay, so 72, that's cat. 73, you notice that the client has impaired social skills. Which of the following short-term goals is most appropriate for the client? That's letter C, identify personal feeling that hinders social interaction. Okay, self-awareness. Okay, and in addition to that, kapag po nagawa niya ito, we could say na magde-develop na rin po siya ng insight. Okay, so number 73, letter C po. 73, letter cat po tayo dyan. Okay, cat po tayo. 73, that's cat. Number 74, the client discusses current problems with the nurse. Which of the following interventions should have priority in the nursing care plans? Have the client, okay, clarify his thoughts and beliefs about an event. Sabihin natin may delusion si patient bago siya mag-act upon that kind of false belief. Okay, ipa-acknowledge muna natin sa kanya. Okay, 74, letters. I-validate muna natin yung thoughts niya with regards to a certain event. Okay, 74, that's cat. 74, letter cat. 75, what other traits is expected from a client with paranoid personality disorder? That's letter boy, is afraid another person will inflict harm. Feeling niya sasaktan daw po siya, guys. 75, letter boy. 75, letter boy. Okay pa ba tayo, guys? Kaya nyo pa ba? Ang tatad nyo in fairness, konting-konti na lang, ha? Kapit-kapit tayo. Magbe-break tayo kapag natapos natin to, ha? Okay. Alam nyo, kahit ganito na lang yung pagkakapit nyo. Isang daliri na lang, guys. Okay? Ganito yung kapit ko sa inyo. Buong kamay. Okay? So, kumapit po tayo. 75, that's boy. 76, when the nurse is told by the patient that she consented to ECT out of fear of being abandoned by her husband, what nursing action is required? Okay, okay, okay. Informed consent. Pinilit daw siya nung asawa niya. Napilitan na lang siya. Obviously, na-violate po natin yung right to self-determination. Right? Kasi kapag sinabi mo self-determination, walang pumilit sa'yo. Nag-decide ka on your own. Okay? So that's letter C. Document the patient statement. I-document mo lang. Responsibility mo yan. Hindi mo nga alam kung responsibility mo bang pagalitan yung asawa eh. Okay? So 76, letter C tayo. Okay? So hindi po letter dog. Nasa lugar ka ba? Right? Letter boy, letter apple, hindi rin po yan. Kasi parang kinampihan mo yung asawa dyan. Walang laban yung patient. 76, that's cat. 76, letter cat. Okay. 76, letter cat. 77, a patient is about to receive ECT. Okay. When the nurse sees that patient has not signed a consent for treatment, which of the following facts should determine the action of the nurse? Letter dog, failure to obtain the patient's written consent can result to a lawsuit. Okay, ang ECT po is invasive. At the same time, mas may potential po for more complications. Right? So, kailangan natin ng informed consent. Ano yung role natin kapag informed consent ang pinag-uusapan? As nurses, what do we do? Okay. Witness tayo, guys. Correct, witness. Hindi tayo mismo yung magpapapirma. So, kapag wala ka po palang na pirma or na witness na pirmahan na naganap, okay, pwede kang madamay sa lawsuit. Okay? So, you have to make sure na signed ni patient yung informed consent para maiwasan yung kasuhan. Okay? 77, that's dog. 77, letter dog. 77, that's letter dog. 78, a male psychiatric nurse receives a call asking whether a certain person has been a patient in the facility. How should the nurse respond? Letter apple states that he is unable to give any information to the caller. Okay? Hindi kasi natin alam kung totoo po ba siya yung nanay or yung tatay. Okay, especially guys, sa panahon ngayon, marami na po mga scammers everywhere. Okay? So kung gusto na lang po niya na maka-make sure about the patient's condition, siya na lang po yung bumisita sa ward. Okay? At kung meron naman pong kailangan yung nurse o kaya yung doktor sa family relative or member, okay, sila naman po mismo yung tatawag just to secure lang, okay, yung right to privacy ni patient, pati right to confidentiality. Huwag kang magda-divulge ng information through the telephone. Okay, 78, letter apple. 78, that's letter apple. Again, number 78, that's apple. 79, nurse learns that the patient was admitted involuntarily on the shift. What assumption can the nurse make about the patient? At the time of admission, he was considered to be imminent danger to himself or to others. Okay, 79, letter C. 79, that's cat. 79, letter cat. Number 80, the intervention by a psych nurse that implements the ethical principle of autonomy is when the nurse, letter C, explores alternative solutions with the client where the client later chooses one alternative. Basta po decision-making ang pinag-uusapan, please think of your autonomy as an ethical principle. Okay? 80, letter cat. Decision-making. Ayan. 80, that's letter cat. Again, number 80, that's cat. One more. 80 is letter cat. 81. As a professional nurse, you take into consideration the ethical moral principles in providing nursing care. Nurse Bong is planning care with Keith. The client believes in Mal-o-ju and uses treatment by a root healer. The nurse should do which of the following? Sino nga po ulit yung theories natin kapag pinag-uusapan natin yung transcultural theory? Yun na yun. Nagkakatalo na lang sa spelling, guys. Madeline Leininger. Ganun. Okay, Madeline Lineage. Hindi ko rin sure kung tama ba yung spelling ko, pero alam ko nagkakaintindihan tayo, guys. Let's letter dog involve the root healer in a consultation with the client, physician, and the nurse. Okay? Basta hindi naman siya contraindicated doon sa care na ibibigay natin, okay lang yan. Okay, involve natin yan. 81, that's dog. 81, letter dog. 82, nurse caring for a patient from a different culture notices that the patient did not eat the food on the meal tray. Which of the following comments by the nurse demonstrate an understanding of cultural diversity? As much as possible, kung kaya memorizing yung spelling, why not? Okay? Pero mind you guys, napakapangit po ng questionnaire. Hindi ko naman sinisiraan yung PRC, pero based on my own reviews, okay, feeling ko 3 out of 5 lang yan. Wow! Kasi pangit yung font size, tapos yung paper pangit din, parang third time niya nang ni-recycle. Okay, so yon, wag masyadong mataas yung expectations sa questionnaire. Okay, 82, letter apple. What foods do you eat at home? Okay, meron din kaming isang patient, hindi niya inubos yung pagkain sa meal tray. Apparently, Adventist pala siya. Okay, hindi pala siya kumakain ng food na yon. So you have to make sure na kahit yung diet ni patient, natatrack din natin para lang hindi sayang yung pagkain na ipoprovide. 82, that's apple. 82, that's letter apple. Tsaka para ma-provide natin yung kinakain talaga nila. Okay? 82, that's apple. 83, another requirement of informed consent is voluntariness. It means freedom of choice without the following conditions, exempt. Okay, may word ka na naman na exempt. Okay, negative sign over here. Part po ng pagpipirma natin sa informed consent is explaining to the patient na although yes, may benefits po kayong nakukuha dito, okay, meron din po mga possible consequences. Okay, 83, that's cat. 83, letter cat. 83, that's letter cat. 84, informed consent is given one of the patient's Bill of Rights. One of its requirements is the capacity of the patient to give it. Which of the following elements is related to this capacity? Select all that apply. Select all that apply na naman tayo, guys. I-highlight mo yan, okay? Patient is an adult. Of course, yes, 18 years old above. Ganun. So, highlight. What else? He is competent to make a choice. Of course, yes, mentally, emotionally, competent. Kailangan natin yan. Okay? Number 3, he has the freedom to make a choice. Again, he has a freedom to make a choice. Kasama ba yan sa elements na informed consent? Parang hindi. In fact, guys, yung isang taong sabihin natin 15 years old or 17 years old, di ba? May freedom to make a choice yan, pero hindi pa rin nakakapirma na informed consent. Okay? What else? A person who is under the influence of your alcohol, may freedom of choice pa rin naman sila, pero hindi natin pinapapirma na informed consent. Right? So, hindi siya kasama. X yan. Okay? Number 4, he can understand the consequences. Of course, competent siya. Okay? That's 1, 3, and 4. Okay? That's 1, 3, and 4. Letter boy. 1, 2, and 4 rather. 1, 2, and 4. So 84, that's boy. 84, letter boy. One more, 84 is boy. 85, Mrs. Cruz needs to undergo a hip surgery. She refused to have it done even after the attending surgeon has explained the procedure thoroughly. Pero basta po nag-decide si patient whether or not gusto natin yung decision yan, autonomy po yan. 85 is apple. 85, letter apple. Again, 85 is apple. 86, your patient is having difficulty making a decision to undergo hip surgery. Which of the following nursing actions best describes your advocacy roles as a nurse? Okay, when you say advocacy, okay, or advocate, okay, kasi sama po dito yung pag-uphold, okay, sa ethical principles ng mga patients. Letter apple, protect patients' autonomy and independence. Okay. 86, that's apple. 86, letter apple. 86, apple. 87, you released information over the phone to a caller who identified himself as the brother of your patient. Ito na nga po ang sinasabi natin. You found out later that the brother was out of town. Which of the following rights did you violate? That's letter apple, right to privacy. Okay, right to privacy. I would like to highlight this keyword. Right po ang tinatanong, kaya letter apple. Confidentiality is not a right. Okay, ano to? Principle po yan. Okay, magkaiba yun. Okay, so 87, that's apple. 87, letter apple. One more, 87, that's apple. 88, you are a nurse caring for patients who are victims of child abuse. The following questions apply. A nurse is planning a community education presentation on domestic violence. Which of the following factors should a nurse include? Okay, when we're talking about domestic violence, hindi naman natin alam or hindi rin natin kayang ma-predict kung kailan po yung magiging next episode ng domestic violence. Okay? But at the same time, gusto pa rin po natin i-uphold yung safety ni patient. So bigyan na lang po natin siya ng contact number in case it happens again. Okay? 88, letter boy. Telephone number of the local safe house. 88, letter boy. Again, 88, that's letter boy. Okay, just to make sure na safe siya. 89, if a child abuse is suspected in a family, which of the following approaches would a nurse take when beginning to interview the child? Okay, alam natin yung behavior ng mga bata. Di ba kapag tinatanong yan ng stranger, titingin muna yan sa mukha nung nanay niyo, kaya nung tatay niya, just to make sure lang na tama yung sagot niya or dapat siyang kausapin. Right? So, para lang masigurado natin na accurate yung assessment natin with the child, especially because the actual child abuse is happening within the family. Okay, ihiwalay muna natin siya sa family members. Letter dog, providing a private place to talk the child about the incident. Okay, 89, letter dog. 89, letter dog. Again, 89 is letter dog. Number 90, which of the following is a characteristic of a sexual abuser? Alam natin to, guys. It's everywhere. Letter apple, only males can be sexual abusers. Again, please be very careful with your absolute terms. So, only, absolute term yan, right? Actually, yung mga females, pwede rin sila maging sexual abusers. Yung mga lesbians, pwede rin. Yung mga gay, pwede rin yan. Okay? Letter boy, sexual abuse is usually a stranger to the victim. Kasinungalingan to, guys. Okay? Usually, kapag may nababalitaan tayo ng sexually assaulted na patient, di ba? Ay, bakit ko highlight? I-ano natin. Sino ba yung nang-rape sa kanila? The grandfather. Imagine, sino pa? Kapatid, pwede rin. Sino pa? Tatay, pwede rin. Okay? Related sa kanila. Tito, pwede rin. Hindi siya stranger sa victim. Okay? Letter C, he was most likely sexually abused as a child. Letter dog, he comes from a low-income family. Si Wong ba, guys? Okay? Mahirap ba siya? Hindi naman. Okay? Pero, okay, he has the capacity to sexually assault other people. Okay? So, kahit mayaman yung ibang tao, meron silang capacity to be a sexual abuser. Okay? Chismis reveal. Ako, ewan ko pero yung source ko. Hindi, joke lang. Okay? Letter C, he was most likely sexually abused as a child. Okay? If you want to explore more about how these sexual abusers think, basically, meron po silang history of being sexually abused nung bata sila. Ang tendency niyan, kapag lumaki na sila, guys, sila na po ngayon yung dominant sa situation. So sila na po yung may capacity to do it with the other people. Okay? So 90, letter C. 90, that's letter cat. Again, number 90, that's cat. 91, the following are signs that the child abuse is most likely present in a pedia client, except. So i-highlight natin ito, child abuse. I-highlight din po natin word na except. Okay? Simulan natin sa letter dog. Recurrent urinary tract infection. Imagine, 5-year-old preschooler, meron siyang recurrent UTI. Normal ba yun? Hindi po. Okay? Baka po kasi sexually abused siya. Right? Baka sexually abused yan. Letter C. Mother tells the bruises were due to home accident. The next day, she tells that it's due to a fight with a neighbor. Ito naman, guys, inconsistency with your history taking. Okay? Paiba-iba. Bakit? May tinatago siya. Medyo sketchy. right? Letter boy, mother was brought to the clinic for burn injury that happened 4 days ago. Delayed seeking treatment, another sign of your child abuse. Okay, especially this one. Burn injury po yung nangyari sa kanya. Major injury yan, guys. Bakit ngayon lang dinala? Okay. Exempt letter apple, abrasions on knees due to a bicycle crash as reported by the mother. Okay. Pwede rin naman siya mangyari. Malay mo kasi, bago lang yung bili ng bike na yon. Okay, natalisod siya, guys. Okay, or malay mo naman, enjoy na enjoy siya magbike sa village nila. Okay, ala coming of age movie. Okay lang yan. Okay, number 91, that's apple. Number 91, that's apple. Okay, 91, that's apple. Pero nag-elimination method tayo dito, guys. Di ba? Na-rationalize natin yung ibang choices. This one, sexually abused. This one, inconsistency. Okay. Letter apple talaga yung best answer. Okay. Itong mga except talaga na to mga pahamak sa buhay. Okay. Kaya nga po kailangan mag-highlight. Okay, a nurse found out that her patient in a medical ward was raped by her grandfather. She appropriately reports this assessment to which the following agencies or departments, that's DSWD. According to the law, may protocol po tayo kapag merong rape patient or sexually assaulted patient. I-report the DSWD. Okay, as a priority. Pwede mo rin naman siyang sabihin sa PNP since crime ito, but the most priority answer, letter boy. Okay, 92, that's boy. 92, letter boy. Again, 92, that's boy. 93, the family of a dependent psychiatric patient accuses Nurse Pao of negligence of her nursing responsibilities. Nurse Pao uses the patient's chart to letter boy serve as an evidence of Nurse Pao's care given to the client at the time of the event in question. Okay? Kapag kayo na po ngayon, yung magiging registered professional nurses, please make sure okay, na kaya mo namang panindigan yung documentation na isasubmit natin kasi legal document ito eh. Okay, hindi rin natin alam kung kailan ito magiging protection for us. Okay, if ever nakasuhan tayo sa court. So hindi lang siya protection ni patient, protection din po natin ito. 93, letter boy. Okay, 93, letter boy. Number 93, that's boy. 92, that's boy. 92, that's boy. 93, boy. 94, computerized patient records may be used as legal documents to maintain the legal standards in computer records. Which of the following should she or should be observed? That's letter C. Once the data has been input, further changes will not be allowed. Okay, wala pong edit button dito sa computerized patient records. Yung documentation system po where I worked before, okay, computerized na rin po sila doon. Okay, medyo nakakahiya kasi especially kapag may na-miss kang spelling, gusto mong baguhin, tapos ang haba-haba na ng documentation mo, lahat yun makikita in-strike through mo. Hindi mo kasi siya pwedeng i-edit. Lahat yun uulitin mo from the start. Wala rin siyang copy-paste option. So nakakapagod. Okay? Pero kasi protection din yun to maintain the legal standards. 94, that's cat. Okay? 94, letter cat. Again, number 94, that's cat. 95, a student nurse asks why ink is imperative in documentation. This is because, that's letter apple, changes will be easily noticed and the documents are permanent. Okay, 95, that's apple. Especially since legal cases ang pinag-uusapan or yung angle na tinitingnan. 95, that's apple. 96, the nurse is handling a psychiatric patient. During one of their interactions, the patient told the nurse, I am mad. How would the nurse document this? Okay, actually, isa po sa challenging parts of being a psych nurse, okay? Paano mo itatranslate ang subjective cue into your objective mode of documentation? Okay? Pwede mo rin naman na i-document as is yung sinabi niya. Okay? Pero if you want a more firm and objective manner of documentation, wag mo po sanang haluan ng sarili mong interpretation. Wag mo sanang haluan ng sarili mong emotional interpretation to the point na kapag binasa mo siya, parang literary sense na siya, parang thought catalog na yung binabasa mo. Okay, looks fierce and hostile, clenched fist, ready to attack. Hindi ganon. Okay, letter C po tayo. Loud and belligerent, frown on face. Okay, as is mo. Okay? So kung anong behavior niya at that time, ganun mo lang din siya i-describe. 96, that's cat. 96, that's letter cat. 97, a psychiatric patient tells you, I feel so depressed. Which of these behavioral manifestations would be the best documentation of the said cue? Ganun pa rin. Okay, cries when alone, avoids eye contact with drooping posture. As objective as possible. 97, that's boy. 97, that's letter boy. Again, number 97, that's boy. 98, how would you assess a patient who experiences prolonged vomiting? Okay, for signs of letter apple, hypovolemic shock. Okay, hypovolemic shock. Ang isang tao na nakaka-experience ng prolonged vomiting, suka ng suka, okay, na ilalabas niya po yung gastric contents niyan. Eventually, you would have reduced blood volume. Okay, eventually, it would lead to hypovolemic shock. Okay, kapag po vomiting ang pinag-uusapan, hindi po acidosis ang nangyayari. Alkalosis po tayo. Okay, at kapag vomiting ang pinag-uusapan, hindi po water intoxication. Fluid volume overload yan. So, dapat fluid deficit siguro ito. Okay, potassium excess, hindi rin po yan makikita sa prolonged vomiting. Actually, dapat ito ay hyperkalemia. Hypokalemia. Okay, so number 98, that's apple. 98, letter apple. One more, number 98, that's apple. 99, a nurse observes a cooling, performing an assessment of a child who has a head injury using Glasgow Coma scale. If performed by the colleague, indicates the colleague needs instructions regarding the use of this scale. Okay. Parang meron tayong karapatan na mang-judge ng isang nurse na pumasa sa board exam na hindi alam kung ano ba yung nilalaman ng GCS, guys. Okay, that's letter boy, deep tendon reflex. Okay, so kapag GCS po ang pinag-uusapan, that's eye-opening, E4, verbal ability, B5, motor responses, F6. Okay, 99, letter boy. May nalilito pa ba dito, guys, GCS? Okay, E4, B5, M6 tayo. Okay, you may also want to go back to the concept. Okay, at your own pace and at your own time. Okay lang yan. 100, you have a newly admitted patient with bulging fontanelles, setting sun eyes and lethargy. Which of the following doctor's order would you question? Okay, an order of letter dog, lumbar puncture. Okay, lumbar puncture. Baka po kasi further mag-increase lalo yung ICP ni patient. Okay, 100, letter dog. Questions so far? Or are we clear? Yun. Are we clear? Worth it ba yung coaching with the icons? Ako for me, kasi natuto naman ako, tsaka sobrang funny nila. Okay? Yung psych lecture, funny siya. Okay, so sige, mag-take muna tayo ng 15 minutes break for you guys. Hindi kasi ako makaka-provide ng 1 hour break, so 15 minutes break na lang. Okay, so balik po tayo after 15 minutes, so that's more likely 6:25. Okay, thank you very much po. Ay, sorry po, medyo hindi ko na-gets. Ano po yung work ng isang nurse sa community? Facilitator po ba, ma'am? Actually, iba-iba yung opportunities natin kapag community yung gusto mong tahakin. Meron ka rin dyan academic field if you want to teach about your community lectures or community nursing. Pwede ka rin maging researcher dyan. Okay, pwede ka rin maging nurse in the barrio. Okay, kung gusto mong mag-work sa rural areas. Okay, pwede ka rin namang ma-assign sa isang health center. Okay, wherein doon ka for a short period of time tapos may rotation kayo doon. Actually, marami kang career opportunity kapag community yung gusto mong piliin. Tama po ba, sir? Nasagot ko po ba yung tanong ninyo? Or ma'am? Ano ba? Actually, more than 6 months ako nag-aral. Kasi laging nagpo-postpone yung boards. Sabihin natin nag-lockdown ngayon, March 2020 ba yon nangyari? Okay, siguro mga May or August, nag-start kami mag-review kasi hindi pa tapos yung SEM namin noon. Tapos September kasi kami graduate eh. Okay, siguro May or July, start ng review sa top rank. Kasi akala namin sa November kami magti-take but apparently na-postpone. Okay, oo. Marami kami batch na na-postpone. Tapos, so na-postpone yung November, right? So akala namin sa May, but apparently na-postpone ulit. Okay, pero meron kasi, parang pinaglaban ata siya sa Senate, kaya naging July, yung time namin. Okay? Ayan, sige. Please take your break muna. Thank you, guys. Okay, sige. So we're done talking about your NP3, the half of it. So that's 51 to 100. Okay na rin po tayo sa NP4. Kung may pahabol questions, okay. NP5. Number 1. Last na to guys. Kapit-kapit po tayo. Situation. Miss Anna and Mr. Elmo are province mates and graduated from the same nursing school. Okay, after 2 years of staff nursing experience, they decided to go home to their province. Nurse Anna was employed as a school nurse while Mr. Elmo joined a tertiary health facility as an infection control nurse. One day, a group of school children approached Nurse Anna because of fever, cough, and fatigue. There is a senior student where Nurse Elmo is assigned. Which of the following infection control activities is appropriate to be delegated to the senior students? So, pwede naman tayo mag-delegate based sa skills nila, based sa intellectual capacity nila. That's letter C. Demonstration of hand washing to patients and relatives. Number 1, letter C. Okay, number 1, letter C. Again, number 1, that's letter C. Number 2, 30-year-old G6P5 woman at 12 weeks has just begun prenatal care. Her initial laboratory reveals that she has HIV infection. What would be a priority evidence-based nurse information for this patient? Okay, i-highlight natin, preggy si mother. Okay, at meron daw siyang HIV. Okay, that's letter C. Medication for HIV infection is safe and can greatly reduce transmission of HIV to the infant. Okay. Number 2, letter C. Halos lahat na po ng HIV medications na available sa market, safe to use na po yun with the pregnant women. Okay, pero kapag po nakita niyo yung medication na efavirenz, actually that's one of your antiretroviral drug, concerning your HIV, medyo hindi po ina-administer ito sa mga pregnant patients kasi may toxic effects daw yan. Okay, so number 2, that's cat. Again, number 2, letter cat. Number 3, Nurse Elmo is working with the infection control area and participated admitting patients affected with suspected viral infection. Which of the following actions proved to be effective to prevent incidents of cross-contamination in the work setting? Letter Apple, healthcare professionals should observe standard precautions. And when we are talking about standard precautions, kahit sino po yung patient natin, applicable po ito sa lahat. Whether or not meron siyang communicable disease or non-communicable disease, i-employ po natin ito. Okay? And a part of your standard precaution is about your hand hygiene. Right? So ito pong letter C, pwede mo siyang ipasok sa letter Apple. So number 3, that's Apple. Number 3 is Apple. Again, 3 is Apple. Number 2, cat. Number 2 is cat. Number 3, apple. Number 4, Nurse Anna conducted a visit to the community where the children live. She found out that the brother of one of the school children was just newly discharged from the hospital because of hepatitis A. Which of the following precautionary measures should she give highest priority to the family members? Okay, sige. So, yung kapatid niya daw ay merong hepatitis A. You have to make sure na alam po natin ano ba yung mode of transmission nito. Okay? Or yung route of transmission. This one is orophycal route. Right? So letter dog tayo. Wash hands before and after handling excretory and secretory materials of the patient. Okay? Number 4, letter dog. Basta alam mo yung mode of transmission. Okay? I-tailor fit mo doon yung interventions mo. Number 4, that's dog. Number 4 is dog. Letter cat daw po yung sa G form ng number 3. Pakipalitan na lang, guys. Okay, letter apple yung final answer natin dito. Number 3, that's apple. Again, number 3, that's letter apple. Number 4, that's dog. Number 4 is dog. Number 5, one of the children was complaining of headache and epistaxis. Which of the following nursing measures should Nurse Anna undertake first? Okay. Alam natin, nung mga bata-bata pa tayo, kapag nag-nosebleed tayo, sinabihan tayo ng mga magulang natin na, ay, iangat mo yung ulo mo. Di ba? Para mabawasan yung dugo. Okay? Upon learning. Okay, contraindicated pala yun guys kasi mas high risk tayo for aspiration. Okay, para I was today years old, mommy. Ginano mo siya, no? So letter boy, have the child sit upright with head tilted forward. Okay, tapos maglagay ka ng slight pressure sa nose bridge mo. Okay. Pwede rin naman mag-provide no ice compress or cold water compress. Pwede rin yan. Number 5, that's boy. Number 5, letter boy. Siguro sinumpa niyo ako guys, no? Kapag ganito ako mag-ratio. Number 5, that's boy. Number 6, that's boy. Okay, number 7, that's cat. Okay, so number 5, that's boy. Number 6, what priority nursing actions should Nurse Anna implement? Okay, letter boy, teach the children to cover mouth when coughing because kapag ito po yung pinili mong option, okay, preventive to, right? Hygienic practice as well. Okay, kapag kasi letter apple yung pinili natin, give cough syrup and antipyretic, okay, medyo ano na to, leaning towards your curative aspect. Okay, so number 6, the best answer is letter boy. Okay, number 6, letter boy. Again, number 6, letter boy. Number 7, registered nurses in the practice of profession are expected to demonstrate an upright and ethical values inside and outside of their work settings. What ethical principle is applied in a clinical situation when a respirator is available for 2 patients in a shock? Okay, so kapag equal or fair distribution of resources ang pinag-uusapan, that's letter C, justice. Okay, isa na lang daw yung available na respirator, dalawa yung nangangailangan, kanino mo siya ibibigay? That's justice. Number C, that's number 7, that's cat. Number 7, letter cat. Isa pa po, 7 is cat. Number 8, nurses can improve ethical decisions by letter apple, compliant to the code of ethics. So number 8, that's apple. Minsan hindi nyo namamalayan yung basis pala ng question galing sa code of ethics. So sana po nabasa natin siya bago tayo mag-take no actual words. Number 8, that's apple. Number 9, the ethical principle which considers a person's unconditional worth in determining his own destiny. That's letter C, autonomy. Okay? Siya daw po yung magde-decide for his own life. That's cat. Okay, number 9, that's cat. Number 9 is letter cat. Number 10, the primary purpose of nurses' code of ethics includes which of the following? Letter C, serves as guide in making morally upright decisions related to nursing practice. Okay, number 10, letter C. Again, number 10, that's letter cat. Number 11, orally. Is the nurse on duty in the medical ward and many of her patients are suffering from problems of oxygenation. Bumalik na po tayo sa mundo ng med-surg, guys. A client is on diuretic therapy. Expected entry should include the following information, except. Okay, may word na except. So maglagay ka pa rin ng negative sign sa tabi. Okay, letter C. Lasix administered at 8 o'clock in the evening. Okay, baka kasi kapag nabigay ka ng diuretic dyan, ma-impair naman natin yung sleeping pattern ni patient. 11, it's cat. Okay, 11, letter cat. Again, 11, that's cat. Number 12, Mr. Carl is with left-sided heart failure. Oralist documentation of her assessment findings will include the following except one. Okay, so left-sided heart failure. Huwag na nating pahirapan ang mga sarili natin. May palatandaan tayo dyan, right? So kapag po left-sided heart failure, pulmonary symptoms. Okay, nagre-regurgitate pabalik po sa lungs yung blood natin. So pulmonary symptoms. Kapag right-sided heart failure, ano naman to guys? Systemic symptoms. Let's say ascites or edema. Okay, right-sided yan. Okay. Sabi daw kasi left-sided heart failure except what? Okay, so that's letter apple, dependent edema. Number 12, that's apple. Number 12 is apple. Again, number 12, that's apple. Number 13, a client with congenital heart disease is suffering from thickening of his skin under his fingers due to chronic hemoglobin desaturation. Again, describe niya po sa'yo. Ano daw po yung term na hinahanap natin? Letter dog, clubbing of the fingers. Okay, ito yung medyo nagiging chunky yung edge ng fingers ni patient, but secondary to chronic hypoxia. Okay, 13, that's dog. 13, letter dog. 14, the following are relevant data to be documented when taking the health history of a client with anemia, except letter dog, episodes of bleeding. Okay, anemia ang pinag-uusapan natin. Tapos may word na except, negative sign, it's letter dog, episodes of bleeding. If you would notice, yung chronic alcoholic patients natin, di ba high risk din sila to having anemia, so kasama yung apple. Letter dog talaga kasi kapag bleeding issue po ito, hindi na siya anemia. Ano nang tawag dyan? Thrombocytopenia na. 14, that's dog. 14, that's letter dog. Again, 14 is dog. 15, a staff nurse in a government hospital. You have been exposed to varied cases of clients with endocrine problems. Your nursing responsibility starts from admission to discharge. Okay, so in the presence of pheochromocytoma, the diagnostic test, which is expected to be elevated, that's letter dog, 24 hours urine collection. Okay, number 15, letter dog. Ano ba ibig sabihin itong pheochromocytoma na yan? Basically, that is the tumor found in your adrenal medulla. Okay, adrenal medulla po yan. Okay, nasa kidneys yan. Anong pinaka-issue niyan? It would secrete excessive amounts of your catecholamines pagkataas-taas. Okay, let's take a look at the signs and symptoms of this one. Next number. Drugs pa po pala muna. Okay, so sa drugs muna tayo. So which of the following drugs can induce hypertensive crisis in pheochromocytoma? Okay, can induce hypertensive crisis. Letter apple po yan, tricyclic antidepressant. Okay, bakit po? Alam natin na kapag meron tayong pheochromocytoma, mataas na po agad yung catecholamines niyan. Even the norepinephrine levels, mataas yan. Right? Ano po yung ginagawa ng tricyclic antidepressant? It would inhibit the reuptake of your serotonin and norepinephrine. Okay, ulit, ang function ng tricyclic antidepressant would inhibit the reuptake of serotonin and norepinephrine. So imagine mo, di ba? Kung in the first place, mataas na yung norepi levels mo sa katawan, tapos may inhibit pa yung reuptake ng norepi, mas lalo siyang tataas. 16, that's apple. Okay, so mas mag-i-induce tayo ng hypertensive crisis dyan. 16, that's letter apple. Again, 16 is apple. Number 17, when the sympathetic nervous system is stimulated, in the case of pheochromocytoma, you expect which of the following signs? Para lang po mas matandaan nating maigi, ano ba yung signs and symptoms ng pheochromocytoma? Meron po tayong 5 H's na acronym. Okay, number 1 is your hypertension. Kasama yan, of course. Number 2, headache. Again, kasama pa rin. Okay, number 3, hyperhidrosis. Again, kasama pa rin yan. Number 4, hypermetabolism. Yes, kasama pa rin yan. Okay, ano pa po yung isa? We have our hyperglycemia. Okay, so that's letter C, 1, 2, 3, and 4. 17, that's cat. Okay, 17, letter cat. Lahat po yan ay nangyayari kasi napakataas po ng catecholamines niya sa katawan. 17, that's cat. Number 18, Nurse Ellen was invited to be a member of the Ethics Committee of Chinese Medical Hospital. Prerequisite to her informal induction into the committee was for her to complete a research. Again, guys, research na naman tayo. Number 18, getting the informed consent of research participants show that the nurse honors the principle of autonomy. However, there are instances where participants become incapable of giving informed consent. These groups of participants exclude which of the following? Medyo double negative po yung dating ng question. If you would notice, incapable, negative term yan, right? Tapos nagdagdag siya dito ng word na exclude, which is another negative term as well. Okay, lalabas na naman po yung kapangyarihan nating bilang mga common masters, guys. Negative plus negative, Positive na ngayon yung hahanapin natin, okay? Sino po dyan sa choices yung merong capacity to sign an informed consent? Okay, that's letter apple. Okay, because asan po ba banda ang paralysis ng isang tao may paraplegia? Lower half. Okay, ang gagaling talaga guys. Wala pa akong tinatanong na hindi nyo nasasagutan. Lower body, correct. So, kaya pa niyang pumirma dyan. Okay? Letter boy, 17-year-old college students. Minor, hindi pwede. 34-year-old mother, diagnosis schizophrenia with active positive symptoms. Guys, may delusions guys. Okay, all the more na hindi po pwedeng mag-sign. At lalong-lalong hindi all of the options. Okay, so 18, that's apple. Number 18, that's apple. Again, number 18, that's letter apple. Number 19, apart from the aforementioned ethical guidelines and principles, Nurse Ellen is aware that which of the following codes of conduct has endured through the ages. Endured through the ages, guys. Thousands of years na po ang nakalipas. Sinusunod pa rin natin to. That's letter dog, 10 Commandments. Okay? Even before na magkaroon or nauso po yung Code of Ethics, may 10 Commandments na. So 19, that's dog. 19, letter dog. Again, number 19, letter dog. 19, letter dog. 20. Another important ethical principle that guides nurse researchers is the principle of justice. Nurse Ellen knows that this principle connotes. Okay. Malilito ka na lang naman po between letter boy and letter dog, okay? Kailangan po nating mag-define ng terms dito. Kapag sinabi mong equality, basically, you want to provide equal, okay? Equal and same resources. Kunwari po, ako po ay isang bedside nurse, okay? Indigent po ang pamilya ko, guys, indigent. Ang sahod ko po ay 30,000 kada buwan. Okay? Pero, meron akong colleague na anak mayaman, guys. Okay? Siya po yung tagapagmana ng sports car ng tatay niya. 30,000 din yung sahod. Okay? Equality, yung tawag doon. Parehas kami nung natanggap. Okay? Whereas, kapag equity naman po yung pinag-uusapan, syempre magpo-provide ka pa rin naman dyan. Pero ano ipoprovide mo? You would want to provide resources to people according, okay, to individual needs po. Depende sa may kailangan. Okay, so ako po ay indigent family, mas kailangan ko yung resources. 20 letters C. Okay, 20 letters C. Baka lang may malito sa acronym natin. This one is people. Resources to people according to individual needs. Okay po. 20, that's cat. Again, 20 letter cat. 21, before and during the conduct of her research, she is guided by the following ethical principles, excluding. Okay? Again, with the word excluding, guys, negative na naman ang hahanapin natin. Okay? Protect the privacy of the subjects. That's positive. Okay? Get the informed consent of the subjects. Again, gagawin din natin yan. Avoid injury or harm. Yes. Treat the subjects fairly and justly. Kitang-kita natin, guys, ang hinahanap natin negative sign. Wala pong negative sign. Therefore, letter dog, none of the options. Okay, 21, letter dog. Again, number 21, letter dog. 21 is dog. Number 19, that's dog. 19, dog, 10 commandments. 19 is dog. 20, that's cat. 20 cat, 21 dog, 22 Mr. Dean, 62-year-old male, complains of shortness of breath, dyspnea on exertion, palpitation, expectorating frothy, blood-tinged sputum. Okay, alam na natin dito pa lang, situation pa lang guys, meron pong pulmonary edema si patient. Okay, fluid overload. He was brought to the ER, complained of easy fatigability and weakness. Isama rin natin yan sa i-highlight. Number 22, Nurse Penny performs the following interventions for the immediate management of Mr. Dean, excluding what? Okay, excluding letter apple, establish an IV line and administer NSS immediately. Okay, alam na po natin na nagpo-fluid overload na siya. So kung mag-i-insert ka ng line dyan, wag mo lagyan ng main line. Okay, haplock lang yan. Okay, 22, that's apple. Kasi mas lalo siyang malulunod, mas lalo siyang magkakaroon ng fluid overload. 22, that's apple. 22, Apple. 23, Mr. Dean has been diagnosed with heart failure. Nurse Penny expects this patient to not exhibit the following signs and symptoms except. Okay? Again, with your negative terms, guys, double negative pa yan. So, lalong positive na ngayon yung hahanapin natin. That's letter boy, murmurs. Ito pong murmurs, apparently, is the only option among the choices na expected natin sa patient with heart failure. Okay, 23, that's boy. 23, letter boy. Again, number 23, letter boy. 24, Cams, 35 years old, consulted the OPD because of pain and abdominal distension. She also she also complained of frequent urination in small amounts. Doctor's impression is the presence of kidney stones. Ayun naman pala, may kidney stones po siya. In other words, it's what you call your nephrolithiasis. Okay? Kapag may nakita kang lithiasis na suffix, ibig sabihin may stones sa loob. Okay? Kidney daw. So, nephro. Okay? Nephrolithiasis. Cams is preparing to go home. Which of the following is not an essential component of your health instruction? Not an essential component, guys. Negative na naman tayo. Letter Apple. Engage in outside activity so she can sweat a lot. Okay, so she can sweat a lot. Paano po ba na-form yung kidney stones in the first place? Diba? Super saturated no concentration. Okay, let's say pwedeng electrolytes yan. Let's say calcium. Okay, pwede magkaroon ng calcium stones. Okay, kapag po meron kang fluid volume deficit, mas lalong high risk ka to having kidney stones. All the more, kapag may dehydration si patient, okay, hindi natin siya pagpapawisin lang masyado kasi baka may dehydrate yan. 24, that's Apple. 24, letter Apple. Again, number 24, that's Apple. 25, lithotripsy was ordered for Cams. She asked the nurse, what is this procedure about? The nurse replied, it will create electrical discharge to break the stones in the kidney. That's her lithotripsy. Actually, non-invasive ito. Kapag po nabasa ninyo yung extracorporeal, okay, shockwave, lithotripsy, okay, or your ESWL, iisa lang sila ng concept ng lithotripsy. That's letter cat. Okay? Kapag po nakita nyo tong letter dog, will visualize the stone. Okay? May visualization na nagaganap, guys. Okay? You would want to expect na gagamit po sila dyan ng scope. Alright? So, ano tawag sa procedure na to? The ureteroscopy. Okay, ureteroscopy para silipin kung nasaan yung bato or yung stone. So, 25, that's cat. 25, letter cat. Again, number 25, that's cat. Number 26, Cams, is asked to describe the pain she's experiencing. Which of the following should the nurse expect? Select all that apply. Number 1, intense deep ache in the costovertebral region. Yes, kasama to. Okay. Number 2, pain usually radiates anteriorly and towards the bladder. Kasama rin ito. Okay. So that's 1 and 2, letter Apple. For your nephrolithiasis. Ibalik lang natin ano ba yung dinidescribe natin dito. Okay? Kasi kapag po itong number 3 and 4, wave-like pain, ano pa, colicky in nature, hindi na po nephrolithiasis yung problema natin dyan. So kapag 3 and 4 na po, ano na nangyayari? Ureters na po. Okay, ureterolithiasis. Ayan na yung nangyayari sa kanya. Okay, ureterolithiasis. Tongue twister pa more. Ayan, basta ganyan. So 26, okay, that's Apple. Okay, 26, that's Apple. Ureterolithiasis. Tama naman. Okay, so 26, that's Apple. Again, 26 is Apple. 27, Mr. Ans or Miss Ans, 42 years old, has been manifesting thyroid enlargement and bulging of the eyeballs. She has been complaining of dryness of the cornea, even though it is not a hot season. She was advised by doctor friend for further workup. So, i-highlight natin iyan. You plan to conduct a physical examination of the enlarged thyroid gland. What is the most appropriate procedure to be done to examine Miss Ans? That's letter boy. Request Miss Anne to sit on the chair and let her hyperextend the neck during palpation. Okay, please do not forget your anatomy, guys. Yung thyroid gland po natin nasa anterior aspect ng neck. Okay, so ipapa-hyperextend po natin yung leeg ni patient para mas mapapalpate natin na maayos yung thyroid gland niya. Para mas ma-expose din po yung gland na yon. So 27, that's boy. Okay, deep palpation is the word na ginamit niya. Conduct a deep palpation. We do not want to conduct it in a deeper way kasi baka mas lalo mo namang ma-stimulate yung hormones dyan. Okay. So 27, that's boy. Most appropriate also is the tanong. So best answer tayo. 27, that's boy. Okay, number 28, you have formulated a nursing diagnosis. Risk for corneal injury related to exophthalmos. Which of the following interventions is most appropriate to prevent this from happening? That's letter apple. Apply artificial tears if ordered. Okay. Kasi kapag meron po exophthalmos yung pasyente, may tendency po na maging dry yung cornea niyan. Okay. So kapag dry yung cornea niya, okay, higher risk for injury. So as much as possible, dapat po sana well lubricated yung cornea niyan. Okay. So 28, letter apple. 28, that's apple. Again, 28 is letter apple. 29, Mr. David is a 72-year-old who is a smoker and social drinker. He consulted the OPD because of rectal bleeding. His tentative diagnosis is colorectal cancer. He was advised for admission. Okay, rectal bleeding, colorectal cancer. Which of the following would you likely expect as a specific complaint of the client during your initial health history taking? Okay, please do not forget the warning signs ng cancer natin. Caution us. Okay, itong letter C, it stands for your change in bowel and bladder habits. Okay, so 29, that's cat. Okay, 29, letter cat. Along with your change in bowel habits, pwede ka rin magkaroon ng change in the characteristic of your stool in such a way that mag-iiba yung shape niyan, magiging pencil-shaped stools. Okay, pwede ka rin po magkaroon ng rectal bleeding as well. Okay, so 29, that's cat. 29 is cat. Number 30. Ano po yung caution us? Wala pa ba kayo on-collecture? On-collecture. Caution us. So that's change in bowel and bladder habits. Okay. Letter apple. That's a sore that does not heal. Okay. Letter U. That's unusual. Unusual bleeding or discharge. Okay, letter T, that's thickening of the breast or thickening or lumps in a breast or elsewhere. Letter I, that's indigestion. Okay, letter O, that's obvious change in warts or moles. Okay, letter N, that's nagging cough or hoarseness. Diyos ko, maubos na yung brain cells natin, guys. Letter U, that's unexplained anemia. Ay, ang tatag natin. Lastly, sudden weight loss. Yay! Nakompleto natin. We're so good talaga. That's sudden weight loss. Ayan. Ito po yung warning signs ng cancer natin with the acronym Caution Us. Okay? Sudden weight loss. All right, so it's okay if you want to screenshot for a quicker reference. So, patatagan ng brain cells dito, guys. Yan talaga yun, okay? So here, kasi rectal bleeding or colorectal cancer, a change in bowel habits, all right? Okay. Number 30. Okay na tayo doon. Nakuha natin. Number 30. Colonoscopy has been ordered. Which of the following is not advisable for the client to do? That's letter C. Can have a liquid diet before the procedure. Okay, sabi kasi not advisable. Kapag po magpapa-colonoscopy ang isang pasyente, before the procedure, dapat po NPO sana siya. Okay? So 30, that's cat. Very, very, very good. 30, letter cat. Again, number 30, that's cat. Number 31, the TQM nurse or Total Quality Management nurse reported to their director that there are a lot of medication errors committed, okay, for the past 3 months. The questions apply. In order to prevent error in insulin injection, which of the following safety measures should you do? That's letter boy. Double check with your head nurse calculations and consider high alert drugs. Okay, 31, letter boy. 31, that's letter boy. Again, number 31, that's boy. 32, health education is an area of nursing practice. When the nurse can be creative and independent in the work setting, the following questions apply. Nurse Cell is teaching a client on how to use metered dose inhaler to prevent asthmatic attack while in the hospital. She should instruct the client to do the following exam. Okay, so metered dose inhaler tayo dito. Tapos may word na except. So yung mali po, yung hahanapin natin. Negative sign over here, that's letter apple. Keep the head of the bed at 15 degrees angle. Napakababa naman nun, guys, di ba? Kapag magbibigay tayo ng inhaler as much as possible, sana upright position. Kasi gusto natin maximal expansion or expansion of the lungs yan. Okay, for better absorption. So 32, that's apple. Okay, 32, letter apple. Isa pa po, number 32 is apple. Yung mali, yung hahanapin natin. 33, nurse Cell is teaching Jen as an asthmatic on how to use spirometer. She should instruct the client to have the mouthpiece. Okay, letter C, place into the mouth and inhale slowly. Again, inhale slowly, guys. Hindi po exhale. Okay? Kapag po magbibigay tayo ng isang equipment sa pasyente, wag na wag kang aalis sa bedside nang hindi mo natuturo kung paano siya tamang gawin. Kasi madedefeat yung purpose, sayang yung energy, pati yung effort, kung mali naman yung paggamit niya doon sa isang specific equipment na yon. So 33, that's cat. 33, that's letter cat. Again, number 33, letter cat. 34, a nurse is developing a teaching plan for Jen, 18-year-old with bronchial asthma. She has an order for discharge. Which part of the teaching plan should be given priority? Okay, so i-highlight po natin yung age, pati yung condition niya, asthma. And as we know, ito po konsepto ng asthma, may exacerbations ito, right? Especially kapag na-trigger mo. Okay, so letter boy, avoid contact with fur-bearing pets. So, iwasan na natin yung triggers na yan. Okay, so 34, that's boy. 34, that's letter boy. Again, number 34, that's boy. Number 35, situation, nurse me is employed in Hospital X and assigned in a medical ward for a year now. The nurse supervisor ordered her to proceed immediately to the surgical ward as a reliever to another nurse. She was not oriented to the surgical ward and the unit was very busy. Okay, nasa konsepto na po tayo ng pagiging reliever. Okay, so ang pinanggalingan mo po ay medical ward, gusto ka daw pong i-assign sa surgical ward. Nurse Me has an expired license but promises to renew her license in due time. Which of the following violations can she be charged if she participated in home health care activity? Okay, bakit nagtatrabaho ka pa? Expired na yung license mo. Letter apple po yan, misdemeanor. Okay, at kapag narinig ninyo yung misdemeanor, ibig sabihin po niyan, slight crimes. Okay, yung mga mabababaw lang. Let's say the petty crimes. Kunwari, pickpocketing. Okay, ano pa ba? Possession of illegal drugs, mga light crimes yan. Okay, pero kapag sinabi mong the use of actual illegal drugs, okay, medyo grave crime na yan, okay? Felony naman yan, okay? Let's say malpractice or murder or rape. Yan yung mga example natin ng felony. So since expired license, ginamit mo 35, letter apple, misdemeanor. Okay, 35, that's apple. Again, number 35, that's letter apple. Okay. Ano po yung letter B? Grave coercion. Pinilit mo siya. Okay, sapilitan. Against his or her will. Okay? Kunwari, pinapipilit mo siya na mag-confess sa isang crime na hindi naman niya ginawa. Yan yung mga grave coercion. Okay? So 35, that's letter apple. 36, which of the following is most appropriate action of nurse me? That's letter dog. Request the nurse supervisor to give her brief orientation before compliance. Okay? Balik po tayo sa konsepto or requirements para makapag-float ka sa ibang unit. Number 1, we have to be well-oriented. Okay? To the unit kung saan ka i-assign. So kung hindi ka po oriented, magpo-orient ka. Okay? Inform your head nurse, tapos magpo-orient ka. Okay? Number 2 requirement, kailangan mo po ng core competency para maka-float ka doon or maka-relieve ka doon sa area na yon. Now, kung wala ka namang adequate core competency, okay, ganun pa rin, inform your head nurse, tapos magpa-train ka. Okay? Although mas matagal kasi yung pag-gain natin ng core competency, kailangan mo pa niyan ng trainings. Okay, so number 36, that's dog. 36, that's letter dog. Again, number 36, letter dog. 37, Mr. Lance is being prepared for a major surgery. Legal preparation for surgery consists of checking all the required forms for the operation. According to the Joint Commission, the most frequently cited factor in sentinel events that leads to patient's serious physical injury, that's letter C, incompetence by a team member. Okay, incompetence by a team member. Example, continuous drip feeding, enteral feeding, supposedly. Okay. Okay, enteral feeding, dapat continuous drip, dapat enteral yan. Apparently, si nurse, hinook niya po sa Y port ng main line. So anong nangyari? From enteral sana, naging IV. Okay, yung patient nagkaroon ng chills, shortness of breath, nag-code, namatay pa rin. Okay, sentinel event tawag doon. So 37, that's letter cat. Okay, 37, letter cat. Ano recalls yan, guys? Yung letter apple daw yung sagot. To assign a more experienced nurse reliever. Sino yan? I mean, anong recalls yan? Recalls what? Hindi po pwedeng i-dodge mo yung responsibility, guys. Own it. Okay? Ilang minutes lang ba magpa-orient sa ward? Okay? Baka iba po yung context. Baka iba yung context. But this is the very, very basic context or concept when we're dealing about the requirements for floating. Well-oriented core competency. Okay? Ayan. Minandohan mo yung nurse supervisor. Pwede bang iba na lang? Ganon, literal, yung letter apple. So letter dog, magpa-orient ka before you comply. Okay, so 36, that's dog. Okay, 36, letter dog. Okay, are we clear here? It should be letter dog po. Okay, no other answer. 37, letter cat. 37 is cat. Number 38, one of your patient's visitors whispers to you, I hope you will not try to revive my dear friend if her heart stops as she has already suffered a lot. The correct response is letter dog. I understand your concern, but I can't discuss this matter with you. Okay? Para lang ma-uphold natin yung principle of confidentiality. Okay? 38, that's letter dog. 38, letter dog. Okay? So 38, letter dog. Pero i-acknowledge pa rin naman natin yung sinabi nung relative. Okay? So 38, that's dog. Number 39, the patient asks you, what do you think of my surgeon? You answered, At sinagot mo talaga, guys. He is not really the best one and he seems not to care for patients. Siniraan mo siya, guys. As a result, natakot yung patient, nag-iba, okay, ng surgeon. Okay, the latter may have grounds to sue you for letter apple slander. Ano yung palatandaan natin kapag slander? This one is verbal or oral defamation. Correct. Kapag libel, this one, ano naman to? Written. Defamation. Paninirang puri pero written. Okay? Ang gagaling talaga guys, kahit anong concept, mapa-med-surg, UB, Psych, Palmer, lahat na. Kayo na talaga. 39 letter apple. Okay, 39 letter apple. Slander, sinabi. Libel, lapis, written. Uy, ang galing ng mga mnemonics. Okay, 39, that's apple. 40, informed consent is a process that gives the patient opportunity involved in his or her care. As patient advocate, the nurse ensures the following 3 conditions are present to make consent valid, except 1. Okay, umuulan po ng word na except. So negative sign, that's dog. Form signed by any close relative or watcher. Okay, kung kaya naman pong pumirma ni patient on his own, hayaan lang natin. So 40 except letter dog. 40 letter dog. 40 dog, 41, conducting research is one of the major roles of the nurses, both in hospital and community settings, to be able to develop such competencies. The nurse has to undergo an actual conduct of the research process. Research na naman tayo, guys. Okay? Kailangan natin maging excited sa research kasi umuulan nito, guys, para ganahan naman tayo. Okay? Nurse Fe wanted to conduct a study using quasi-experimental design. This design will need letter dog, manipulation of the independent variable. Okay, because under pa rin po ito ng tinatawag natin na experimental research design. Okay, under this classification, may further classifications pa yan. We have your true experimental, we have your quasi-experimental, we have your pre-experimental. But either way, lahat po sila kailangan merong presence ng manipulation kasi under sila ng experimental. Okay, so 41, that's dog. 41, letter dog. Again, number 41, letter dog. 41, dog. 42, a nurse researcher is using AccuCheck monitoring kit to test the presence of diabetes mellitus among her study subjects. Ang galing sa research, Sir Ralph. How do you classify this type of measurement? Okay. Ito po yung letter C, physiological. In other words, we have your bio, physiologic, measurement. In terms of your research instruments, okay? And here, biophysiologic, logic, okay? It is further divided into 2. We have your in vivo, we also have your in vitro, okay? Kapag sinabi mong in vivo, wala ka pong i-extract na specimen dyan for you to measure a certain occurrence inside our body. Kapag naman po in vitro, meron kang in-extract na specimen dito para ma-measure mo yung isang occurrence na yon. Okay? For example, the use of your glucometer to check for your blood sugar, is that in vivo or in vitro? Glucometer for blood sugar. Ano yan, guys? Okay, yun na yun. Okay, in vitro kasi may blood specimen ka dyan, CBG. Okay, another example. Ano pa ba? Serum chemistry. In vivo or in vitro? Serum chemistry, in vivo, in vitro. Again, in vitro pa rin. In vitro pa rin. What about urinalysis? In vitro, in vivo. Siguro sinasabi niyo, wala bang mas mahirap? Kasi alam na namin to. Okay? The use of your pulse oximeter to detect for your oxygen saturation. In vivo, in vitro. In vivo. Once again, guys, napakagagaling. Okay. Another kwento kay Survey. Alam mo ba yung section na hinawakan ko kanina? Parang di na po nila tayo kailangan. Ready na. So 42, that's cat. Okay, 42, letter cat. Please do not forget the basic concept para mas makalayo ka sa concept na yon. Okay, para mas maintindihan natin yung complex concepts. 42, that's cat. 43, weight is taken as a baseline measurement of obese female adolescents as study subjects for a weight reduction program. This is repeated to note any changes, and this pretest is done too. Okay, this pretest is done to, alam nyo guys, minsan po, okay, yung mga sagot sa tanong, nasa tanong na mismo. Okay, for example, this one, pretest. Okay, itong pretest na yan, it would serve as our baseline. Okay, nabanggit na rin niya, letter dog, obtain preliminary data before a treatment is conducted by the researcher. Okay, 43 letter dog. Okay, 43, that's letter dog. Again, number 43, that's dog. One more, guys. 43, that's dog. 44, which of the following statements best describes a researchable problem? That's letter boy. What is the relationship between relaxation technique and relief of pain of post-CABG patients in the surgical coronary care unit? Okay, bakit siya yung best answer among the choices? Because napaka-specifically stated po ng mga variables. Right? Pati po yung population nakasabi na rin dyan. At hindi lang yan, pati rin po yung setting kung saan gagawin. Okay? Nakasabi na rin po dyan. Kaya siya yung best. So, number 44, that's boy. Okay, number 44, letter boy. Again, number 44, letter boy. Number 45, a nurse is caring for several patients in PDA unit. The following questions apply. What is the most common technique of male masturbation? Okay, that's letter apple, grasping and stroking the shaft of the penis. Okay, so number 45, that's apple. Most common technique, guys. Okay, most common technique po. That's letter apple. Okay. Pwede naman yung letter boy, pero hindi kasi siya most common. Kailangan mong gumastos dyan. May pagbili ng mga object. Okay? 45 apple. Okay? 45 letter apple. Libre lang yung letter apple. Okay? 46. An 11-year-old boy is admitted to the PDA unit in traction who has fractured femur sustained in a motorcycle accident. His uncle, who was driving the cycle when the accident occurred, received only minor injuries. Sabi daw, wag daw siyang sisihin. Okay? Kasi yung uncle niya, in fact, the best motorcycle rider in the world. So, anong tawag sa defense mechanism na to? That's letter C. Hero worship. Okay? Hero worship. 46, letter C. Medyo valid naman kasi paggabi na daw. Okay? Ayan, so 46, that's cat. Actually, gabi na. 7 na pala, guys. Okay? So 46, that's letter cat. Okay, ito yung tipong sobrang taas ng tingin niya doon sa isang tao to the point na nilalagay niya sa pedestal. Okay? Tinuturing niya as hero. So 46, that's cat. 47, child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Medyo objective po yung dating ng question na to, na if hindi mo siya nabasa, may possibility na hindi mo siya masasagutan. That's letter C. The tumor extended beyond the kidney but was completely resected. Okay. Ito pong letter boy, this one is our stage 1. Stage 1 yan. Ito pong letter dog, this one is the stage 3. Okay, so 47, that's cat. 47, that's letter cat. Again, 47 is letter cat. Number 48, the parents are planning to give their child ginger candy for cough. How will the nurse respond best? Okay, medyo suki po itong tanong na to, guys. Para na-encounter na natin before. Letter apple, let him have some and let's see what will happen. Okay, as long as hindi po contraindicated sa care, hayaan lang natin. 48, that's apple. 48, that's letter apple. Again, 48, apple. 49, 3-year-old client is prescribed digoxin therapy. Okay, his resting heart rate is 60 beats per minute and has vomited twice. Okay, digoxin therapy, pedia patient. Okay, after taking prescribed doses, which of the following would show toxicity? Okay, ano muna yung mga signs and symptoms para masabi natin na, uy, digoxin toxicity to, guys. Okay, that's anorexia, number 1. Pwede ka po magkaroon ng vomiting. Fatigue, pwede rin. Okay, malay, pwede rin. Okay, but the best answer is letter C, lethargy. Bakit po? May option na letter boy, hindi siya kasama because even before na binigay natin yung digoxin therapy, nagsusuka na siya. So hindi siya reliable indicator for us to assess whether Toxicity na ba yun? Okay, so 49, hanap tayo ng ibang sign. It's letter C. Okay, lethargy. Letter C, lethargy. Okay, so 49, that's cat. Again, 49, that's letter cat. Number 50, at 4 months, what the health teaching must be communicated to parents to promote optimum safety. Bumalik na naman tayo guys, pedia patients na naman. So 4 months, again, please highlight kasi mag-iiba po yung intervention natin according to the age range kung sino kaharap natin ngayon. Okay, so infant apparently in relation to your safety, that's letter apple. Raise side rails high. Okay, raise side rails high. Itong letter boy, remove small objects from the floor. Toddlers yan. Okay, letter dog, temper tantrums, toddlers pa rin yan. Okay, letter C. Ano naman ito? Preschoolers. Okay, infant ang hinahanap natin, letter apple. Okay, number 50, that's apple. 50, letter apple. 50 is apple. 51, what is the appropriate response to a mother who is anxious to have her child undergo herniatomy? Okay, since ang patient natin is the patient, okay, at since kailangan natin na magbigay ng holistic approach, gusto natin na i-extend yung care natin, okay, with the other family members. So, therapeutic communication pa rin po. Letter C, what are your concerns about the procedure? Okay, because this option would encourage verbalization. Number 51, that's cat. Okay, number 51, that's letter cat. Again, number 51, letter cat. Number 52, Bridget is a newly hired nurse at the neonatal ICU. She received an endorsement that baby boy A and baby girl B is for discharge na. Okay, 2 days later, the mother of baby boy A came back to complain that she got the wrong baby because she got baby girl instead of a boy. Okay, which of the following should Bridget, being a professional nurse, understand as the primary outcome should she be proven guilty of gross incompetence? Okay, medyo may teleserye po nangyari dito, nagkapalit po ata. Okay, letter dog, that her license to practice nursing can be suspended or revoked for a period of time. That's under your RA 9173, section 23. Okay, it's about your revocation of your license. 52, that's dog. 52, letter dog. Again, number 52, that's dog. Number 53, which among the statements are true about health promotion? It is the process of. Okay, so health promotion po tayo. Number 1, enabling individuals to increase their abilities to control and improve their health, of course, kasama to. Okay, enhancing the individual's physical, psychological, and spiritual well-being. Yes, kasama pa rin to guys, health promotion. Okay, number 3, engaging in correcting the people's health behavior. Kapag pinili mo kasi, itong letter C or number 3, okay, para mo sinabi na, uy, mali yung ginagawa mo, i-correct natin. Okay, mali kasi yung dating or yung connotation. Instead of using the word correcting, baka mas pwede natin gamitin yung word na improving. Okay, improve lang natin yan. Okay, number 4, preventing disease from occurring and treating it when it occurs. Okay, health promotion pa ba to begin with? Yung number 4, or disease prevention na? Diba? Disease prevention na yan guys. So, hindi natin isasama. Okay? So, again, kung ano lang po yung hinighlight, yun lang po yung tamang sagot. Yes, correct. Hindi na siya health promotion. So, that's 1 and 2. That's letter dog. 1 and 2. Okay, number 53, that's dog. Okay, 53, that's letter dog. Again, number 53, that's letter dog. Number 54. Okay. Mrs. Arante, 28 years old, has been married for 4 years. She postponed pregnancy to pursue her career as a lawyer. One day, she went to the obstetrician because of vaginal spotting and to find ways of getting her pregnant. Okay, she was found to have endometriosis. Before we go to the actual question, i-define muna natin, ano po ba yung endometriosis? Okay, very, very familiar term, pero baka malito yung ibang students. Okay? Pag sinabi mo pong endometriosis, okay, yung endometrium, Okay? Lining po yan sa uterus natin. Okay? It should be found on the inside of our uterus. It just so happened na kapag po meron kang endometriosis, yung endometrium tissues na yan, ay makikita po natin sa labas ng uterus. Diba? It's not supposed to be there. So of course, meron kang inflammatory responses dyan. Okay? Yung usual sites nitong endometrium tissue outside the uterus, pwede po sa fallopian tube. Okay, doon siya magde-develop. So imaginein mo, merong unusual tissue na nasa fallopian tube. Okay, it would cause you to have number 1, scarring. Okay, pwede ka rin dyan magkaroon ng adhesion, tissue adhesion. Okay, anong implication nun? So pwede ka magkaroon ng obstruction or blockage. Okay, infertility for the mother. Okay, yun po yung concept ng endometriosis natin. Okay, the nurse performs an assessment on Mrs. Errante. Which of the findings would be indicative of endometriosis? Select all that apply. Okay, SATA question hanggang sa kadulu-duluhan, guys. Okay, let's start with number 4, menorrhagia. Ano ibig sabihin nito? Kasi kapag nagets mo yung concept ng menorrhagia, magigets mo kung bakit hindi isasama yung number 1. Okay, kapag sinabi mong menorrhagia, ano ibig sabihin yan? Excessive, heavy, menstrual flow or bleeding. Okay? Yun yung isa sa mga primary symptoms ng endometriosis. Okay? Dyspareunia, pwede rin. So that's painful sex. Okay? Persistent dysmenorrhea, kasama rin yan. Painful menstruation. Except number 1, spotting after intercourse. Because hindi lang po pabebeng spotting yung nafe-feel ni patient of after intercourse. Okay? Heavy bleeding din yan as well. So 54, that's dog. 2, 3, and 4. Okay? 54, letter dog. Okay, 54, that's letter dog. 54, that's dog. 55, the physician prescribed danazol for Mrs. Arante. The nurse should tell her that while taking this drug, she will experience all of these symptoms except one. Okay, so pharma drug na naman tayo, guys. So, okay, tatagan mo lang yung loob mo. Makakaraos tayo dito. Okay, so i-highlight mo yung gamot per se. I-highlight mo yung word na except. Okay, so ito po yung isang management natin to treat your endometriosis, especially kapag moderate na, okay, yung signs and symptoms. Except letter C, diminished menstrual flow, because kapag po binibigay natin itong gamot na ito, wala pong menstrual flow at all. Okay, it should be letter dog, cessation talaga of menses, hindi lang diminished, wala talaga. Okay, so 55, that's cat. Okay, 55, that's letter cat. Again, 55 is letter cat. Again, 55 is cat po. 56, what is the rationale behind endometriosis interfering with fertility? Buti na lang na pag-usapan na natin kanina, that's letter boy, total blockage of endometrial tissues. Okay, so 56, that's boy. 56, letter boy. Again, number 56, that's boy. 57, the nursing director assigned Alan in the orthopedic ward to care for patients with mobility problems. Alan is teaching a patient with crutches how to go up the stairs. Okay, may saklay po yung pasyente natin. Okay, gusto umakyat ng hagdan. Anong proper instruction? Letter dog. The crutches and affected leg go up the step together. Okay. Meron po tayong palatandaan kapag ito yung situation. Okay? The good leg goes to heaven, the bad leg goes to hell. Okay? So kapag, yes, ang gagaling talaga, guys. Meron pa ba akong nadudulot dito? Okay? So kung gustong umakyat ni patient, good leg muna. Kung gustong bumaba, ang mauuna is the bad leg. Okay? So 57, that's dog. Kailangan pa ba talaga ako dito, guys? Okay? Ang gagaling nyo na. 57, letter dog. Okay, 57, that's dog. 58, Alan is assisted by another staff nurse in lifting a patient. Which among the following actions to prevent injury to Alan? Okay, huwag niyo pong pilitin na kayo lang po yung magbubuhat sa patient on your own. Okay, you also have to protect yourself. Okay, please, please, please have your proper body mechanics. Okay, so that's letter boy, positioning himself close to the patient. Okay, para mabawasan natin yung horizontal reach, okay, maiwasan natin yung stress sa likod natin. So 58, that's boy. Okay, 58, that's letter boy. 58, that's letter boy. In lifting a patient, keeping the knees of the feet wide apart, the knees extended. Okay? Ito yung nagpamali, knees extended. So, dapat medyo naka-flex yan. Right? Mahirap mag-knees extended, tas bubuhat. So, 58, that's boy. 58, letter boy. Number 59, Nurse Alan asks 2 more nurses to help him log roll a patient. Na-excite ka doon, no? Na-excite ka doon sa option letter apple. Keep the feet wide apart. Uy, tama to. Okay, hindi mo na nabasa yun is extended. Okay, please do not be excited too much. Okay, tapusin natin yung question, pati yung choices word by word. Okay, 59, Nurse Alan asks 2 more nurses to help him log roll a patient. Where should Alan place the patient's arms prior to log rolling? Sabihin mo sa pasyente tayo, okay? Magwawakanda muna tayo dito. Okay, so cross on the chest muna. 59 letter boy. So wakanda position ka muna dyan. Okay? Kasi as much as ayaw mo magkaroon ng sarili mong injury, you also have to protect the patient against injury. Okay, so 59, that's boy. 59, that's letter boy. Again, number 59, that's boy. Number 60, in applying restraints, Alan should employ which type of tie? Okay, gusto natin yung secure release, secure restraints, but at the same time, quick release. Okay, so 60, that's apple, half bow. 60 is apple, half bow. Para in case of emergency, mabilis mo lang siyang matatanggal. 60, that's apple. 60 apple. Okay pa tayo dyan, guys? Okay pa tayo? Kaya pa ba? Kaya pa ba? Konting-konti na lang. Actually, by this point in time, pwede na po tayong mag-countdown. Last 40 items na lang to. Okay? Kaya pa, please. Kayanin natin. Kapit tayo. Okay? After nito, magpahinga na po tayo. Okay? 61. Jared, a staff nurse in a medical unit, understands that his charting must consist of the following, excluding what? Okay. Sino ba to si Jared? Sa buhay natin. Okay. Alam nating staff nurse siya. Okay. Gagawin niya daw, mag-chart daw siya. Okay. Dahil siya po ay isang staff nurse, yung charting niya, ang laman niyan, nursing diagnosis at hindi po medical diagnosis. So except letter apple. 61, that's apple. Okay. 61, letter apple. Again, 61 is apple. 62, Jared shares an LU hospital staff nurse. Okay, the importance of proper documentation. This includes, number 1, reflects quality and timeliness of nursing care. Uy, tama. So, i-highlight natin. Number 2, evidence of care provided by doctors and nurses. Uy, tama na naman. Okay, facilitates interprofessional communications. Tama na naman. Utilize as a legal document in a court litigation. Tama na naman, guys. Baka all of the above ito. Holds vital information about the patient. Yes, apparently, lahat po yan ay hinighlight natin. All of the above. Okay, tama ka na, Jared. Okay, 62, letter dog. 62, that's letter dog. All of the above. 62, that's dog. Okay, 63. What should be the size or gauge of the needle Nurse Jared would use in administering IV infusions for trauma patients? Large bore needles. Ang gagaling talaga. It's letter apple, 18. The smaller the size or the number, the larger bore it is. Okay, bakit po? Kasi trauma patients yung inaalagaan natin dito. We may want to anticipate, okay, na baka mag-blood transfusion tayo sa kanya. Okay, so 63 dapat malalaking bore yan. Okay, 63, that's apple. Correct. Okay, pati na rin sa mga surgery patients natin, dapat large bore ang gamit. 63, that's apple. Again, 63, that's letter apple. 64. OB nurse is currently handling patients who are undergoing various pregnant clients for certain laboratory and diagnostic tests. The nurse is providing instructions to a pregnant client who is scheduled for an amniocentesis. Which instruction should the nurse provide? In the first place, kapag sinabi mo amniocentesis, ano ito? Centesis is the suffix. Mag-aspirate ka po ng amniotic fluid para sa sample. Okay? Kailangan mo po na informed consent dito kasi tutusok tayo sa abdomen ni mother. This one is an invasive procedure. That's letter cat. Informed consent needs to be signed before the procedure. Okay? 64, letter cat. 64, that's letter cat. Again, 64 is cat. Meron akong naka-part na question. Sasagutin ko by the end. Okay? 64, that's cat. 65, the nurse asks a pregnant client who is in the first trimester, calls the nurse at the healthcare clinic that she has noticed a thin, colorless vaginal discharge. Okay. Normal po ba ito? Yes, normal na normal. Okay, that's letter boy. It may be bothersome, but ito po ay normal occurrence. Okay? Actually, ang tawag natin dito is leukorrhea. Very good. Okay? That's secondary to sudden surge of your estrogens. Okay, estrogen, ang dami. Estrogen. Okay, 65, that's boy. Sudden surge of estrogen. Yan. 65, that's letter boy. Again, 65, that's boy. 66, the nurse has performed a non-stress test. The nurse interprets this test as reactive. Ito yung gusto nating mangyari kapag meron non-stress test na reactive siya kasi normal po ito. 66 is apple. Very, very healthy si baby sa loob. So 66, that's apple. 66, letter apple. Isa pa po. 66, that's apple. 67, Janina is a nurse in the maternity unit. During the night shift, a woman is hospitalized for treatment of severe preeclampsia. Which of the following represents unusual finding for this condition? Again, highlight natin, severe preeclampsia. Okay? Hindi po tayo dapat nakakakita ng convulsions dito because kapag may convulsions na yan, ano na po yung meron si patient? 'Di ba? Hindi ko pa tapos yung tanong, may sagot na kayo guys. Ganun kayo kagagaling. Ganun kayo kagagaling. Okay, eclampsia na po kasi yan. Okay? Ganon. 67, letter apple. Pansin nyo ba? Okay, bumalik na naman tayo sa mundo na OBpedia. Nakakaloka yung recalls 3. Okay, NP3, NP5, very, very heavy sa OB concept. Okay, 67, that's apple. 67, that's apple. Again, number 67, letter apple. 68. As a nurse in the maternity unit, Janina knows that the action of hormones during pregnancy affects the body by, letter apple, raising resistance to insulin. Okay, because itong insulin na to, hormone din yan as well. Okay, so number 68, that's apple. Okay, 68, letter apple. Number 69. Okay. A 28-year-old woman has a diabetes mellitus since she was an adolescent. Okay, she is 8 weeks pregnant. Hyperglycemia during first trimester will have what effect on the fetus in the first place, guys? Ano yung pinaka-importanting nangyayari during your first trimester? Organogenesis. Okay, that's why letter C, yung sagot natin. Okay, organogenesis. Kating-kati na ba kayo matapos tong recalls na to? Kaya inuunahan nyo na yung mga tanong. 69, letter C. Okay? 69, that's letter C. Naulit na kasi. Okay, 69, that's cat. 70, metrogene is prescribed for a client with postpartum hemorrhage. Before Janina administers the medication, she contacts the healthcare provider, okay, to make sure lang, okay, doc, okay, sure ka po bang ibibigay ko itong metrogene sa patient natin? Upon history taking, meron po siyang peripheral vascular disease. So yung vasoconstrictive effect po ng gamot na yun, okay, could have a negative effect doon sa actual condition ni patient. So 70, that's dog. Okay, 70, letter dog. Ito po metrogene is an example of your ergoalkaloids, okay, which have your vasoconstrictive effects, kaya po siya ginagamit for postpartum hemorrhage. Okay, so 70, that's dog. 70, letter dog. Again, number 70, that's dog. Number 71, what resources should a nurse use in teaching her postpartum client? Select all that apply. Na naman, again, number 1, pamphlets. Of course, kasama natin yan. Pabonggahan tayo ng mga brochure ng student nurses pa lang. Number 2, audio tapes. Yung iba guys, kina-career, nagka-canva talaga sila para sa brochure. Okay? Number 2, audio tapes, kasama pa rin yan. Okay, number 4, video tapes. Kung gusto mo mag-download ng mga YouTube videos, pwede rin naman. Okay, so that's letter C, 1, 2, and 4. Except number 3. Okay, nurse specialist kasi we can do it on our own. Huwag na tayo magtatawag ng ibang tao. So 71, that's cat, 1, 2, and 4. 71, letter cat, 1, 2, and 4. 72, Monica is a pregnant mother living in Santa Ana, Manila. She has given birth to a twin, one child, and had an abortion. Which of the statements below correctly applies given the obstetrical history of Monica? Uy, maraming ganyan, major in graphic design, okay? Now, isa-isahin natin yung gravida tsaka yung para. Sabi kasi gravida 4. Guys, kung hindi na po kayo nakakasunod, pakisabihan niyo po ako ha, para i-adjust natin yung setting, yung pacing. Okay? Baka yung iba kasi pinipilit na lang, okay? Dapat on the same page pa rin tayo dito. Okay? Now, let's start with a twin. Okay? So itong twin na to, that's G1, gravida 1, right? Itong one child, gravida 2. So, yan. Abortion, kasama yan sa pagbibilang ng mga gravida natin. Basta nabuntis si mother, considered as 1. Pregnant mother, okay, yung current pregnancy niya, kasama rin yan. Diyan po nang galing yung G4 natin. Okay, kaya siya G4. Okay, paano naman po yung para 2? Okay, yung para, those who are beyond 20 weeks above. Okay, tama ba? 20 weeks above. Yun yung considered as para. Okay, so itong twin, as 1 lang yan. Okay, as 1 yan, yung one child as 1 din. Okay, yung abortion hindi kasama. Yung current pregnancy hindi rin kasama. Kaya P2 lang siya. Okay, so the best answer for 72, that's dog. G4 P2. G4 P2. Okay, 72, that's dog. Number 72, letter dog. 73, Nurse Denver, medical nurse, has been assigned as a floater nurse in the pedia hematology ward for a night shift. Which of the following would the nurse Denver identify as a priority nursing diagnosis during a toddler's vaso-occlusive sickle cell crisis? Okay, vaso-occlusive sickle cell crisis. As we know guys, okay, yung sickle cells na po na yan, no baby, kapag po yan is nag-clump together, nagsama-sama po sila, okay, lalaki po sila, magiging ball yan, it would obstruct the blood vessels, that would lead to occlusion, okay? Consequently, magkakaroon ka po dyan ng tissue ischemia or tissue anoxia. Okay, doon po nanggagaling yung pain natin. So 73, that's cat. Okay, number 73, letter cat. Okay, isa pa po, number 73, that's cat. One more, number 73, letter cat. 74. Which statements by the mother of a toddler would lead Nurse Denver to suspect that the child has iron deficiency anemia? Select all that apply. Again, select all that apply. Alin po? Yung 73, ulitin. This one. Okay, kasi may sickle cells sila to begin with. Yung C-shape. Diba? Letter C-shape yung RBCs nila. So, once po na nagsama-sama yung sickle cells na yon, they would clump together. They would form a, sabihin nating ball. Okay, that would obstruct the blood vessels. Okay, so kapag nag-obstruction ng blood vessel, it would lead to occlusion. So mauubusan tayo ng oxygen supply dyan. Okay, kaya tissue ischemia or tissue anoxia. Okay, kaya ka may pain. Kasi may tissue ischemia, nauubusan ka ng oxygen supply sa area na yon. Okay, so 73, that's cat. Okay, 73, letter cat. Okay tayo dito, sir. Okay na po. Okay, 73, that's cat. Number 74. He drinks over 3 cups of milk per day. Imagine niyo guys, over 3 cups of milk per day. Okay, puro gatas na lang yung iniinom niya. Paano naman yung ibang sources of food? Right? So kasama to, baka meron siyang iron deficiency anemia dito. Okay, I can't keep enough apple juice in the house. He must drink over 10 ounces per day. Ganun pa rin, kapag ang isang bata ay hyper-focused sa isang pagkain at hindi niya na po kinakain yung ibang sources of the food, okay, very high likely na magkakaroon siya ng vitamin and mineral deficiency. Okay, so number 2, kasama rin yan, i-highlight natin. Okay, he refuses to eat more than 2 different kinds of vegetables. Yes, kasama to. Ay hindi siya kasama. Yes, okay tayo dito. Yun yung gusto kong sabihin, okay? 2 different kinds of vegetables, basta kumakain ng vegetables, okay tayo dyan. Okay? He doesn't like to eat meat, but he will eat small amounts of it, okay? He sleeps 12 hours every night, okay pa rin. Okay, so kung ano lang po yung highlight, yun lang po yung tamang sagot which talks about your iron deficiency anemia. That's 1 and 2. 74, letter C. 1 and 2. 74, letter C. 74, letter C. 75, Nurse Hazel is caring for several patients in LRDR complex. What is the primary presenting symptom in a client with abruptio placenta? Alam nyo na to guys. Mas magagaling kayo sa OB kesa sa akin. Letter C, abdominal pain. Actually, ito po talaga yung hallmark symptom ng abruptio placenta natin. Right? 75, that's cat. Okay? Abdominal pain, 75, letter cat. Again, 75, that's cat. Number 76, pregnant mother, 32 weeks gestation, was admitted to OB ward for significant bleeding in different mucosal areas. Meron daw siyang dead fetus syndrome. Pag sinabi mong dead fetus syndrome, okay, alam mo na merong intrauterine fetal death pero hindi pa tinanggal within 4 weeks, okay, from the day of the abortion. So, pwede kang magkaroon dyan ng sepsis, okay, as a result, BIs. 76, that's cat. Okay, excessive bleeding tayo dyan kasi naubos mo na yung platelet count mo, pati yung clotting factors mo to compensate. Hindi na siya sapat. Okay, 76, that's cat. 76, that's letter cat. 77, Nurse Hazel monitors a patient in her transitional phase for intervals of contractions. She measures this. Again, define lang po tayo dito. That's letter C, from the end of the contraction to the beginning of the next contraction. That's your interval. Isulat natin, interval. Itong letter apple, beginning of one to the beginning of the next. Anong tawag natin dito? Beginning of one to the beginning of next. Frequency, correct. Okay, frequency. Pinagsisigawan pa natin frequency. From the start of a contraction to the end of the same contraction, same lang. Okay? Duration naman na po tayo dito. So please, wag niyo na po itong iiba-ibahin or interchange kasi iba-iba sila ng concept. So 77, since interval po yung tinatanong, that's letter C. Advance yung ratio mo, sir. Wala pa tayo dyan. 77, that's cat. 77 is letter cat. Wait lang, ito na. Wait lang, masyado kang advance. Malayo tayo dyan. 78, in the labor room, a pregnant patient was being assessed for cervical dilatation and uterine contraction. Parang gustong-gusto nyo lang matapos to, guys. Which of the following findings tells Nurse Hazel that the patient is in the active phase? Okay, active phase. Okay. 82 pa yun. 77 pa lang tayo kanina. That's letter boy, 7 centimeters dilated, contractions every 3 to 5 minutes. Okay, so when you say active phase, ano po ito? That's 4 to 7 centimeters, contractions every 3 to 5 minutes. Okay, and that would last for 40 seconds. Okay lang yan. 78, that's boy. 78, that's letter boy. Again, 78, letter boy. Naka times 2 na nga ako nito eh. Feeling ko kapag pinanood niyo yung recorded video, napakabilis, naka times 4 na yon. Okay, 78, that's boy. Okay, 78, letter boy. 79, when PROM occurs, which of the following provides evidence of the nurse's understanding of the client's immediate needs? So kapag sinabi niyo pong PROM, that's your premature rupture of membrane. Okay, spontaneous rupture of membrane before the onset of your labor. Okay, predisposes the patient to have possible infection. 79, that's boy. Okay? Because yung amniotic fluid na yon, that would also serve as your defense against your infection. So kapag spontaneously na-rupture yan, okay, infection. 79, that's boy. 79, letter boy. Again, number 79 is boy. Number 80, Belle is now in her second stage of labor, 8 centimeters cervix. Nurse Hazel puts her in lithotomy position, and one of the dangers that we should watch for in Belle is letter C, hypotension. Okay, letter C, hypotension. Although unusual complication ito or uncommon, it could also happen pa rin. Okay? Pwede ka mag-develop dyan ng compartment syndrome, okay, sa lower legs ni patient. So number 80, that's cat. Number 80, letter cat. Again, number 80, that's cat. 81, if Belle has a long second stage of labor and needs to be placed in lithotomy position for a long time, lahat daw ito ay pwede mong i-implement for safety measures except what? Okay, except what, guys? Negative na naman ang hahanapin natin. That's letter apple. Wrap the legs with elastic bandages. Okay? Bakit naman kasi elastic bandages? Wala po ba tayong stock ng compression stockings? Right? So 81, that's apple. Okay? Tinipid mo naman yung pasyente. 81, that's apple. Okay, again, 81, letter apple. 81 is apple, 82. Ito na yon, sir. Okay, ito na yon. Nurse Hazel understands Belle needs more support and encouragement during the peak and the most painful phase of uterine contractions. Next na, next na. 82, that's dog acne. Because I would also highly suggest na paki-improve din natin ng vocabulary because kahit hindi niyo naman po alam yung phases of uterine contractions, kayang-kayang masagutan. Okay? Yung peak pati yung acne, iisa lang po sila ng ibig sabihin. Okay? So 82, that's dog. Okay, ito letter C, increment. This one, you say gradual increase of contraction. Konti na lang, sir, konti na lang. Okay? So you have gradual increase until ma-reach natin yung peak or your acne. Okay? When you say decrement, ito naman po yung gradual decrease. Yon. Gradual decrease of contractions hanggang sa hindi na po ma-feel ni mother yung contractions. Okay? Ito pong decrescendo. Ito yung pinakaunang buburahin mo sa paningin mo in the context of your uterine contractions because hindi natin siya mababanggit. Okay? Let's say heart sounds, yung pinag-uusapan natin, heart sounds. Okay? Pwede mabanggit yung concept ng decrescendo, pero hindi po sa uterine contractions. Okay? Number 82, that's dog. 82, letter dog. Okay? 82, letter dog. 83, before the initial vaginal examination, okay, commonly referred as internal exam, what must Nurse Hazel check first? So kapag po acne, okay, ito po yung peak ng uterine contraction natin. Uterine contraction. Ito rin yung pinaka-painful phase. Okay? So 82, that's dog. 82, that's dog. 83, I would like to change our answer here. Check first kasi. Okay? So gusto muna nating i-assure na okay po yung vital signs ni mother. So that should be letter apple. Okay, 83, that's apple. Blood pressure for hypotension or hypertension. Gusto ko yung ansipag mo mag-reply sa mga comments ng students. Inisa-isa mo yung reply. Okay, gusto natin dyan. 83, that's apple. Okay, 83, that's letter apple. 83, letter apple. Napaka-active mo tonight. 83, that's apple. 84, nurse Pat is assigned to several patients in orthopedic ward. A CT scan is one of the diagnostic evaluations used for musculoskeletal function. Okay, which of the following is not an indication of the procedure? Again, i-highlight natin ito. Na-highlight mo na rin. Okay na tayo dito. Okay, so highlight mo rin yung word na not. Okay, letter apple. So negative sign. Okay, to measure the girth of an extremity. Because guys, kapag nagme-measure tayo ng girth or nagme-measure tayo ng height o kaya ng weight, okay, hindi naman natin kailangan ng CT scan for that. Ang ginagawa po natin is Anthropometrics. Okay, so 84, that's apple. Okay, so 84, that's apple. Again, number 84, letter apple. 84, that's apple. 85, which of the following conditions is not a factor that will aggravate or increase the blood pressure of a patient? That's apple. Having post-op pain. Bakit po yan yung sagot natin? Okay? Kasi among the choices, siya po yung pinaka-vague yung description ng pain. Just because a patient experiences post-op pain doesn't mean na automatic tataas po yung BP niyan. Okay, meron po tayong iba't ibang intensity ng post-op pain. It could be mild, it could also be severe. Okay, so kapag mild post-op pain lang yan, doesn't necessarily na magkakaroon din ng hypertension. So 85, that's apple. 85, letter apple. Again, number 85 is apple. Number 86, another patient of Nurse Pat is Mrs. D, a 45-year-old store owner with beginning thrombophlebitis. Which of the following instructions is best to be given to a client with this condition? Okay, highlight mo po, thrombophlebitis. That's letter dog, apply heat in the affected area. Because okay, gusto natin na mag-improve yung circulation sa area na yan. Therefore, i-encourage po natin yung vasodilation. Okay, so vasodilation tayo dyan. Hindi po tayo po pwedeng mag-massage at hindi rin po tayo pwedeng maglagay ng pillow behind the knees because baka po ma-stimulate natin or ma-trigger natin, okay, yung dislodgement ng thrombus na yan. Okay, at hindi naman po tayo po pwede na magpasuot ng support stockings one size larger. Okay, sayang po yung effort natin, defeated yung purpose niyan. Okay, so sana man lang appropriate size, right? Hindi siya one size larger. So 86, that's dog. 86, letter dog. Again, 86, that's dog. 87, in the assessment of peroneal nerve function in relation to movement, instruct the patient to, please do not forget your anatomy and physiology. Paulit-ulit ako guys, sorry na po, pero ayoko lang po na makalimot kayo. Okay? Hindi mo kasi ito masasagutan kapag hindi mo alam kung nasan po ba banda yung peroneal nerve na yan. Okay, so please ask the patient to dorsiflex the foot and to extend the toes. Okay, kapag po medyo impaired yung peroneal nerve function natin, the patient could have a foot drop. Okay, so 87, that should be apple. 87, that's apple. Okay, number 87, that's apple. 88, Nurse Leia is a nursing supervisor in the medical ward. Having adequate knowledge in nursing management, the following questions apply. Nurse Leia knows that one of her staff is experiencing burnout. Which of the following is the best thing to do? Let her staff ventilate her feelings. Let her encourage verbalization. 88, letter cat. Okay, 88, that's letter cat. Remind her to show loyalty. Ano to? Nanggigil trip ka ba, sir? Okay, so wag yung letter apple. Okay, gusto sana natin letter dog, pero hindi yan yung ideal. So 88, that's cat. 89, she knows that the performance appraisal consists of the following activities except what? That's letter cat, focusing activity on the correction of identified behavior. Okay, Palmer concept po ito. Okay, kapag performance appraisal, yung pinag-uusapan natin, hindi lang naman po strength, weakness. Okay, yung focus natin. Pati po yung strengths, kailangan din mapag-usapan. Okay, so ito po letter C, medyo limited po yung sagot niya. Nakafocus kasi siya sa weakness lang. Dapat may strengths na kasama yan. So 89, that's cat. Okay, 89, letter cat. 89 is cat. Number 90. Mr. Pons came to the ER because of sharp troubling pain. After his surgery, he claimed the pain is even felt when he is asleep. Naglag. In relation or in order for the nurse to recall the location of the pain, he has to letter boy mark the painful area in a body diagram. 90, letter boy. Okay, number 90, letter boy. Again, number 90 is letter boy. 90 boy, guys. 91. When a client is on prolonged pain therapy, the nurse should watch out for, that's letter apple, tolerance to the drug. Okay, prolonged pain therapy, tolerance of the drug. Okay, paano natin masasabi na, uy, tumataas na yung tolerance niya sa drug? Paano natin masasabi yan? Okay, if the patient asks for higher doses, di ba? Hindi na po umi-effect yung required dose sa kanya, hindi na siya effective, kailangan ng taasan. Kapag po drug resistance, yung pinag-uusapan natin, hindi po natin siya masyadong ma-appreciate kapag pain therapy yung pinag-uusapan, pero mas ma-appreciate mo to kapag antibiotic therapy po. Okay, yung concept. So 91, that's cat. Okay, 91, that's letter cat. Again, number 91, that's cat. Ay, cat tuloy. Cat ako ng cat, guys. Hindi niyo ako pinapansin. Letter apple, tolerance to drug. 91, that's apple, rather. Okay, 91, that's apple. 92. Anika, a 42-year-old teacher with cardiac ailment, nervously informs the doctor that her goiter is getting bigger and distracts her while swallowing food. Okay, kapag po binigyan tayo ng existing, okay, comorbidities, okay, kailangan nyo rin po itong i-highlight because it leads you to the right answer. 92. Based on your knowledge, Anika, who has a history of cardiac illness, should not be given an enema before surgery. Bakit daw po? Okay, because meron din po tayong vagus nerve sa GI tract natin. Right? Vagus nerve, guys. Vagus nerve. Ring a bell? Okay, ito pong vagus nerve na to, kapag na-irritate mo, na-stimulate mo, it would trigger the vasovagal responses. For example, bradycardia. Okay, vasodilation. Vasodilation. Okay, you could also have your hypotension. Syncope, pwede nating idagdag dyan. So imagine, yung patient natin meron ng history of cardiac illness to begin with. Okay, kapag binigyan mo ng enema, ma-experience na rin yan possibly. So 92, that's boy. Okay, 92, letter boy. Uy, okay. Okay to. Okay yan. So 92, that's boy. 93, Jorge. Diba? Jorge, guys. Ang social ng pagkaka-pronounce, that's George, 16-year-old. Foreigner was admitted in the medical ward due to abdominal pain, nausea, and vomiting by nurse Andre. Okay. Okay, 93. In initiating care for patient George, which of the following would be an appropriate question to be asked by nurse Andre in his assessment? Okay. Na-imagine niyo ba yung situation, guys? Mag-a-assess na si patient. Okay, letter dog, is there anything I am doing that is not acceptable to your culture? Okay, so 93, that's letter dog. 93, letter dog. Ito, letter boy. Do you have any books I could read about people in your culture? Actually, pwede mo rin naman itong isagot, pero hindi po kasi siya yung pinaka-priority natin to answer since mag-i-initiate na tayo ng care. Okay, so dapat direct to the point yung sagot natin. 93, that's dog. 93, that's letter dog. Again, number 93, that's dog. 94, Nurse Andre respects cultural practices, integration in her nursing care plan. Ano daw dito? Ang nagre-represent ng culturally competent nurse. Okay, that's letter dog. Ask patient George to help Nurse Andre in knowing more of the culture of his origin. Okay, in this case, guys, mas magbibuild pa lalo yung rapport ninyo, mag-i-increase lalo yung trust ni patient sa'yo. So 94, that's dog. Okay, 94, letter dog. Ito yung gusto nating i-aspire. Okay, to be a culturally competent nurse. 94, that's dog. Explain and validate health knowledge and beliefs of George with that of the hospital. Okay, culturally competent nurse. Explain and validate health knowledge and beliefs of George with that of the hospital. Ah, okay. Sige. Medyo mali kasi yung angle, right? So parang sinabi mo na, okay, George, what do you know about our hospital? Okay, tapos i-validate ko. Okay? In relation sa beliefs niya. Okay? So hindi. Medyo magulo, no, yung explanation ko. Pero something like that. Okay, so 94, letter dog. Okay, 94, letter dog. Okay? So parang kailangan mong isa-isahin yung knowledge, pati yung belief ni George, tapos i-relate mo sa hospital natin, di ba? So the best answer, dog po talaga. Okay, so number 95, patient George family request. A time for spiritual healing process in the hospital. This is allowed by Nurse Andre in the hospital because it letter apple gives fulfillment in meaning to the patient and family. Okay? Para rin masabi natin na, uy, holistic yung approach natin sa patient na to. Okay? So, i-involve natin yung spiritual aspect niyan. So, 95, letter apple. Hayaan lang natin. Okay, so 95 is apple. 95, that's letter apple. Again, number 95, that's apple. 96, the positive practice environment or PPE influences the healing process. Okay. Ang konsepto po ng positive practice environment, okay, yung settings po in general that would promote quality patient care. Okay, so ibig sabihin, encompassing sa lahat, hindi lang po yung patient safety, pati rin po yung nurses affected dyan. So 96, that's dog. Ensure that staff nurses does not experience burnout. Okay, 96, letter dog. Dapat pati yung well-being ni nurses or ni nurse well-attended din. So 96, that's dog. 96, letter dog. Again, 96 is dog. 97, Earl. He's 28 years old, diagnosed with diabetes mellitus. He was advised by his family physician to undergo insulin therapy. Okay, yung blood sugar niya daw was 200 to 210. At 6 a.m., Nurse Kenneth administered his insulin injection, and after 2 hours, the patient complained of cold, clammy perspiration. Anong nangyari? Di ba, nag-hypoglycemia na siya. Okay, paano ba naman kasi from 7 a.m. to 8 p.m. ang lecture? Nag-hypoglycemia na tuloy yung mga students. Okay? So 97, that's boy. Give him biscuit to eat. Okay? Bigyan natin ng immediate source ng blood sugar si patient or ng sugar si patient. So 97, that's letter boy. 97, letter boy. Uy, baka naman sabihin nyo, ginugutom namin kayo dito ha. Meron naman tayong breaks in between. At pwede naman kayong kumain. Okay? Habang habang nagle-lecture tayo. Okay, so number 97, that's boy. Last 3 items, guys. Number 98, patient Earl has been classified to have type 2 diabetes mellitus. Which of the following is not a typical manifestations? Okay, that's letter dog, weight loss. Especially, anong klaseng DM meron si patient? Type 2. So, dahil po ito sa lifestyle, right? So, dapat po ito ay weight gain. Okay, at lalong alam natin, di ba meron pong hyperphagia si patient. So mag-gain talaga siya ng weight dyan. So number 98, that's dog. Number 98, that's letter dog. Again, number 98, that's dog. Number 99, Mitch, 58 years old, is admitted to PA ward because of respiratory problems. The nurse initiates oxygen treatment by mask, but the client refuses despite the encouragement of the wife. Basta nag-decide si patient, please respect the decision. Letter dog. 99, let's dog. Okay, 99, letter dog. Uy, tapusin naman natin, guys. Dito na tayo. Okay, so 99, letter dog. Hindi ako pwede magpa-break. Baka sabunutan ako ng mga students. Okay, number 100. You are taking care of Mitch, who is on the last cycle of the radiation therapy for his lung cancer. Okay, you should instruct Mitch too. Okay, lung cancer daw. Radiation therapy. That's letter dog. Avoid hot drinking fluids or drinking hot fluids because, yes, correct, meron pong stomatitis si patient dyan. Okay, ito wait 1 hour after treatment before eating. Actually, wala namang regard. Okay, wala naman pong regard sa food. Problem lang natin is kapag po pabalik sa radiation, expect natin na nangihina si patient, may fatigue na siya dyan. So baka wala na rin siyang ganang kumain. Okay, do you have any more questions? Questions? Okay. Let me stop sharing now. Meron akong nakapark na question actually. Ang tinatanong niya sa akin was, after ko daw bang mag-take ng board exam, alam ko na daw po ba, okay, gusto niyo pa bang makinig? Gusto niyo pa bang ikwento ko? Alam ko na daw po ba right then and there kung papasa daw po po ba ako sa boards and even kung magta-top pa po ba ako. Okay, chika lang to, chika lang to. So if you want to go, okay lang. Okay, actually, meron kasing isang tradition, ang UP Manila College of Nursing, since 1948, wala po talagang bumabagsak sa mga UP Manila students. Ganun sila kagagaling. Okay? When I read the question, yung first day nung nursing board exam namin, sobrang umiyak talaga ako nun kasi natakot ako, what if ako yung unang bumagsak sa history ng UPM? Meron kaming inside joke na kung sino daw yung pinakaunang babagsak, gagawan daw ng rebulto. Andito yung mga UP Manila students, kaway-kaway naman kayo dyan. Okay, gagawan daw ng rebulto, tapos araw-araw babatuhin ng kamatis. Yun yung consequence. So of course, I was scared and anxious na baka ako yung una makabreak ng tradition. So to answer that question, hindi ko po in-expect na papasa ko and even magta-top sa board exam. Actually, kayo rin yung unang section na sasabihan ko nito. Dapat bandang dulo ko pa to ikukwento. Pero since nandito na rin naman tayo, di ba, ikwento ko na. I think 3 days before lumabas yung board results. 3 days before lumabas yung board exam results, napanaginipan ko po, napapasa ko sa board exam, napanaginipan ko na magta-top ako sa board exam, and specific ng panaginip na yon, lumabas na top 7 daw ako. Kaya sobrang nakaka-goosebumps na naging top 7 ako for real. Actually, yung buong panaginip na yon, napaka-weird kasi it started as meron daw swimming party. May swimming party, guys, kung saan nandoon lahat ng mga family and friends ko. Nagsama-sama silang lahat doon. Okay? Nagulat din ako, bakit ganon? May multiverse na mga set of friends ko. Andun silang lahat. Okay? Apparently, when I was trying to dive sa pool, walang tubig. Okay, so natakot ako na bumagsak ako sa semento at mamatay. So it happens, ang nangyari is, nung nag-dive ako sa pool na walang tubig, I flied instead. I flied. Mali yung past tense. Lumipad ako instead. So yun yung context ng panaginip. Tapos lumabas na magta-top 7 daw ako. So I really appreciate and cherish that dream. Because for me, I think yun yung way ko to manifest my own dream to even pass and top the board exam. So I hope na kayo rin, please believe in yourself kasi hindi possible na maniwala yung ibang tao kung kayo mismo ay hindi nyo pinapaniwalaan yung dreams ninyo. And please do not ever do not ever let the other people tell you that you are incapable of reaching your dreams because andyan na kayo, guys, napakalapit na po ninyo. Okay, napakalapit nyo na. So please, tiyagain na po natin. Yung finish line, andoon na siya. Okay, andun din kami to welcome you. Okay, lahat tayo magse-celebrate sa success ninyo. Okay, so yon. Ano yung quote ko kanina? You wouldn't really want to rush something that you want to last forever. Okay, ayaw mo madaliin yung process ng mga bagay na gusto mong mag-last forever. Yung RN, okay, after your name, it would last forever. Sayong-sayo yan. Okay, walang kukuha niyan sa'yo, walang aagaw niyan sa'yo. Okay, just please make sure to take the process slowly, to trust the process, and to enjoy the process as well. Okay, so yun, guys, sana po marami kayo natutunan. 7 to 8 p.m. lecture, grabe, hands down. Napakasaludo ko po sa inyong lahat. Okay, sobrang saludo, guys. Okay, pahinga na po tayo after this one. Okay, pahinga na po tayong lahat to top the board exam po. Thank you very much. I'm very excited for your season. Thank you so much, guys. Okay, thank you. Ingat po tayong lahat. Okay, bye-bye, guys. Thank you po.